sampling methods, wherein you deliberately take certain people with certain attributes of interest who can add to your understanding of that phenomenon. That being the case, the aim is not to generalize. The aim is instead to learn, to understand, to get insight. And if you sample across a cross section of different kinds of people, the chances are you're going to get quite rich diversity of of information. So you are the key instrument here. The way you go about doing your interviews, your open-mindedness, your ability to elicit, get people to talk. These become very key characteristics. And all this constitutes your data, right? Even your observations. So we usually recommend that people doing qualitative research need to document. So as you're doing an interview, at the end of the interview, document. What did you see? What did you hear? All that will go into your analysis. Okay? So it's not just simply out there to gather information. You are there as a very alive person, observing, listening, watching, noting down. All of this is very critical to qualitative research. You can't just sit back and say, oh, I've got this. I'll just ask these questions and my job is over. You have to be very, very mindful of what's happening as you go along. Okay. So the other thing that we look at is the data is very inductive. What does that mean? So we don't go with any preconceived ideas. Okay, in many of our qualitative researches, particularly when we do thematic, about which I'll tell you a little more, we use a conceptual framework. I'm not sure whether you had a session on that, but basically the idea of a conceptual framework is to give you some sort of a guide to take you through your study, some logic. Suppose I wanted to do a study on care-seeking behavior amongst children with pneumonia, or I want to do a study on looking at how do parents with children who have cleft lip and palate, what are their needs? How do they, seek care? What are the challenges they face? If that is your idea, then it's good to develop a framework before you begin your data collection. And what does that entail? You think, you sit and you think, you look at literature, you see what's out there, what are the kind of information you have gathered, use your own experience in the field, and then you think, okay, suppose I want to do a study on parental needs, what all would I need to know? You develop a framework. So one domain would be, I'd want to understand how much parents are aware. What do they understand by cleft lip? What does it mean to them? Cleft lip, and I'm sure many of you would be aware, can be, it's not a fatal condition or anomaly, but it can be very, very challenging and difficult for parents. And particularly in the initial years, bringing up a child with a cleft lip and palate poses a lot of problems because the child cannot suckle, cannot drink enough mother's milk, has to be fed differently, has to be cared for differently. So a lot of challenges. So basically, the idea is sit back and think, what could be the domains that I need to study in order for me to understand this phenomenon? So that would constitute the deductive approach. And the inductive will happen once you gather your data, you look at your data and see what people are saying. So the focus is on the emic, as I mentioned earlier, looking at it from the point of view of our participant. That is key to this, as opposed to quantitative studies which have an etic focus. Etic means it's researcher driven. You have decided what you believe to be your objectives. You have your study factors and you have your outcome factors. So you go with a very clear vision, and that's fine because that's the aim of quantitative research. Your aim is to generalize, identify, and explain and present it. But in qualitative research, that's not our aim. We are seeking to find out what else could they be. Is it only this? Are there other aspects that I need to look at? If so, what should I do? How do I go about it? So these are the questions that you need to be asking yourself. And how does a person sitting there, what does it mean to this person? How do they understand? Because that in turn determines the kind of behavior they adopt and how they go about actually seeking care or not, as the case may be. It's also very iterative. This is again a very critical aspect of qualitative research. You don't think that once I have developed my guide and I've collected some data, I'm okay, I can just use the same thing as I go along. That's not the way it works. Every interview informs the next. So maybe when I did this interview using this guide, I uncovered more issues because remember, this is a conversation. It's not a yes-no kind of questionnaire that I'm administering to my participant. I'm having a conversation like you would do with your friend. I'm trying to understand what happened, how did you deal with it, why did you feel so, what are the challenges you face, these kinds of questions, depending upon what your research question is, what you are trying to ascertain. So during the process, you be very open and try to elicit. So how well you are able to do this is the skill that you are able to bring into the interview. So you are always listening. What else I need to add? Where are the gaps? So after doing every interview, I look at the data, I transcribe, I read my interviews, I listen to my audio so that I'm better prepared when I go to the next interview. So this is the iterative process. You can keep bringing in add-on questions, modify the way you want to ask, rephrase the way you want to ask. That level of flexibility is what you need to bring into your research because you want to understand, you want to learn, you want to gather as much insight as possible. And if it demands you have to do this, then yes. So you have to go with that mindset. No tunnel vision. Open up your mind fully and just look at the problem. What is the problem? What's happening here? What else do I need to look for? Constantly ask yourself these questions. Your analysis begins there itself. It doesn't begin once data is collected. Analysis starts right from day one. Once you've started on your study, you're already starting to think, what do I look for? What is happening here? Why is it happening? These questions you constantly ask. So these are characteristics that you have to learn, which are different from quantitative research. So basically, this is the kind of scenario that you're dealing with, right? You are the researcher, you're planning your study. If you're looking at human behavior, remember, human behavior cannot be compartmentalized, Each one has their own ways of looking at things. And the idea in qualitative research is not to say this one is better or this is more or this is less. That's not the idea. We are trying to reflect the diversity. These are the various ways in which people behave. These are the various ways people do. And why do they do that? So once you have that understanding, you're in a better position to think of interventions, think of education, whatever it is you want to do to move forward in your research. It's also, we are looking at their experiences, their perspectives, and it's all non-numerical. There is no numbers here. And it's not wise to quantify qualitative data. I have seen earlier on some people, when they have done a qualitative interview or collected some qualitative data, they have tried to then present it in terms of percentages. So many percent said this, so many percent said that, so many percent said that. That is a major flaw. And why? Because remember, the sample is non-probability. They are not representative. You have just taken a few people with some attributes of interest in order to understand this phenomenon. That being the case, you have no ability to be able to extrapolate or generalize. So for that very reason, we cannot extrapolate. And we can't say only one person said this, and so I won't include that. I'll only take what majority said. How do you know? If you continue to sample, if you continue to start including more and more and more people, you might find what very few people have said in this sample, many may say there. So, right, it's a different kind of scenario. So remember, these are two arms. Each has their own principles, their own philosophy, their own focus, their own strengths, and their own limitations. Your job is to recognize that and see how best you can synergize the two. But never mix it in the sense, use qualitative methods of interpretation for quantitative, or most often quantitative methods for qualitative. Never do that. Okay. So what are we trying to understand from this data? We're trying to understand what's actually happening here. What does this participant feel? Why is he feeling? And because you have done interviews wherein you're probed, you have asked a lot of questions, you're trying to understand, you're in a better position to make sense why they're saying this, what's happening here. So those issues, are very, very helpful. Another way is when you do it, you've done a large quantitative study, you've done a survey probably, and you've gathered some data. Let me give you an example. Way back, we had done a big survey on domestic violence, wherein we had a structured questionnaire that was administered to over 10,000 women across 7 states in India, a very large sample. And the idea was to look at prevalence of domestic violence, spousal violence. So we had physical violence defined as being hit or kicked or beaten or slapped. And we had psychological violence defined as being threatened, humiliated, abandoned, infidelity. All of that went into the definition of psychological violence. So in our questionnaire, we had questions that asked, have you ever been slapped, hit, kicked, or beaten? Have you ever felt threatened or humiliated? Blah, blah, blah. Then we had one domain, which was called sexual violence. Now, this was the least defined because we ourselves didn't know how to ask it. So it was our problem. So we just kept, have you ever experienced sexual violence? So what happened? We administered the questionnaire, and what did we find? We found, I'm not very accurate with the numbers, but I remember physical violence was very high, almost 60%. I'm talking about the aggregate, overall sample. Psychological violence, little less, around 40%. But sexual violence was incredibly low at 1% or 2%, something like that. So suppose you were faced with the data like this. Would you be happy and accept it and think, okay, fine, so this is how it is? Or will there be some antenna that will tingle? Something's not quite okay here. Will you feel like that? You will, right? Why will you not expect? I mean, logically, when you're thinking, when a woman is being physically or psychologically abused, the risk of sexual violence is also going to be there, right? Is it not logical to think like that? So we felt that there was something that's not quite right here. So we decided to do qualitative study, interviews, focus groups to understand what is happening here. And the biggest thing we found when we did these qualitative interviews was how these terms were interpreted by these women, the sense of social appropriateness, not being able to speak it out. All these factors actually hindered their ability to come out and be truthful about what was actually happening. Many women think that this is part of marital life. If I need to please my husband, then that's the way it is. So these were some factors which had contributed to the low reporting of sexual violence. So once we understood and how women really appreciate this or look at it, then the way of questioning will change, and you will ask questions that are more will elicit greater truth than this. So if you want to understand, you've got some quantitative data and it's not making sense or it's confusing or there are gaps, you can definitely go back to do qualitative research. So that's where the mixed methods also comes into play. So interpretation that can never be judged true or false is only one possible interpretation. Remember, in qualitative research, we are not simply looking to see what is true and what is false. We're looking at the gray area. There are lots of things that are not so categorical, right? There are always so many ways of looking at interpretations. And that is what we are seeking to find. So these are some guidelines you have to absorb. First of all, recognize your mindset. What are your ideas? What are your thoughts? If you have certain preconceived ideas based on your experience, note it down before you go into doing your study, because we don't want those to influence you when you're collecting your data. Know your question. Always the research question must be clearly enunciated. There is no way any research that you do, unless you have clear research questions, you cannot move forward. Look for alternative interpretations. Always seek inputs from others. If it's your PhD where you alone are doing it, seek to get others, your seniors or your colleagues or anybody else, to look at this and give their thoughts and ideas on it. Look at all the data. Don't only take that which looks dominant. Take everything, because we don't know. This is a very purposive sample, and we are trying to reflect the variability in terms of opinions, diversity. What are all of this? Celebrate anomaly. So if you find something very unique or very different, recognize it. When I say celebrate, I mean it in the sense, recognize it and include it in your presentation of your report and your finding. And always get a lot of feedback. Qualitative research actually is one where it works well when you work in teams, because different opinions, different ways of collecting data, you all work with the same framework, you all have the same question, you all have the same guide, but each one will have their own way of doing the interview, which adds much more richness to your data collection. Documentation is critical. So because you don't forget, you're going to have huge volume of data. So don't get overwhelmed by it. You need to learn to be very systematic, methodical. So as you do an interview, make sure you label it, put down the demographics of each participant, give whether it's an intervention site or control site, whatever the case may be, make sure you document all of that. Another very good, important thing that I find very useful is once you finish an interview or a focus group, make a note. What was something you saw here? Was this interview focus group meaningful? Was there any gaps? Did you feel the respondent was truthful? Did they come out? Or do you feel there was a sense of diffidence, or they didn't really speak out, or they felt threatened or uncomfortable? These are important things that you need to make note of, so that when you're reporting your results, you'll be able to, draw connections. Maybe it was because of this person didn't come out, or whatever be the reason. Connection of data to show how one concept may influence. So like I said, you start off with a conceptual framework, right? To see how those domains fit together. Do they make sense? They have to be related. Otherwise, it's not a framework. Then corroborate. Look at alternative evidence. Get inputs from your colleagues or your peers. Make sure that you are trying to be as open as possible to gathering as much of information, critical inputs. Don't be scared or wary of what people may say, what my superior may say, or what my colleague may say. That is not the way. It's the information, it's the data, it's the methodology. So the more you are able to correct early, the better will be your study. So this, I think I've already said that it can be daunting. So it's very important that you record, document. And usually what we do is once an interview or focus group is transcribed, we bring it into our system and we use software for analysis. But let me tell you, software like NVivo, Ethnograph, Nudist, there are many qualitative softwares. Use it only when you have understood how to do qualitative. We all learned the hard way. We all learned manually doing analysis. That keeps you close to your data. Okay. So if you use these softwares without understanding how they work, you are going to be, if you use it like you do Stata or SPSS, that's a major problem. So I would strongly recommend those of you who are starting to do qualitative research, do not do it using software. Start with small data sets. You don't need a large number, 5, 10, more than enough. Get your hands dirty, become familiar with the process. Learn to read those transcripts. Become familiar with your data and extract the information. So all of this will help you to conceptualize. And this is another thing you need to constantly do as you're collecting your data. Don't be quick to say, okay, I think this is it. I've done these 5, 6 interviews. This is what I think. Keep documenting, keep noting down what you've come up with. But don't be quick to close the door. Okay, that's it, no more. Keep your mind open until the last interview or focus group is done. Keep your mind to whatever else that may be coming through. So this conceptualizing, coding, categorizing, these are things that happen simultaneously in qualitative research. Unlike quantitative, where you go in a very step-by-step fashion, right? You design your study, you have your field data collectors who go out into the community, administer the questionnaire, they bring it to you, then you have your data entry operators who review. Of course, now a lot of it is done by tablets, and you have the online modes that's there. So it cuts down one area. But certainly, if you look at it in the traditional way, people still do pen and paper questionnaires, which then have to be entered into the data entry operator enters it, then the biostatistician analyzes, makes the interpretation, and the PI then brings all of this together. In qualitative research, it does not work that way. Everyone in the team, if there are 4 of you, or 5 of you, or 2 of you, all of you have to be involved in the whole process. Everyone plans and decides why. Maybe one person can take the lead to develop the protocol, but all of them give their inputs. All of you go, it's good if all of you do data collection, because each one of you will bring your perspective in, which adds to the diversity. It's good. There is the risk of being only my perception will be minimized to that extent. You're bringing in different people. You're working with a conceptual framework, which has been thought through, logically planned and put together. So all of this will strengthen your case. And this is the way you would go about. So as you're doing your data collection, constantly keep noting down, okay, what do you think could be for instance, in the domestic violence study, one of the things that we kept documenting as we went along was women's interpretation of violence. What does it mean? You and I may think something, right? But across the road, when we started talking to these women, many of them felt it was okay if the husband slapped her. After all, he's trying to correct me, he's providing for me, looking after me and my children. So they excuse it that way. Somebody else may say, he said very harsh words to me, I didn't like it. Somebody may get put off by that and may see that as violence. So varied interpretations exist. And we need to recognize that there are these varied interpretations. We are not trying to, push them into one compartment. We are trying to pull it all out so that I know what is out there. So when I plan my intervention, I know, okay, I have to do something that will target as many as possible of these different varied perceptions and beliefs. But what you look for is you're looking for a pattern. Is there something that is consistently being reported? Is there something that is very dominant, So you'll see that once you're doing these interviews, you'll find some of the women kept saying that initially it was great, there were just the 2 of us, the marriage was going on fine. Then the children came in. His income did not improve. See, you look at the context. You are not just looking at the behavior. Why is it happening? What triggered off this behavior? So the stress on the husband to earn, then they have all those cultural values. Women should not go out and work. Cannot the husband look after the wife? What kind of a man are you? So those kinds of stresses and pressures come into the picture. The demands increase, and then the stress increase. He takes recourse to alcohol. Then the woman starts annoying him. So these kinds of patterns we started to see consistently as we did more and more interviews. So this is something that gives you a sense, okay, so this are some contributors that could incite the violence in the family. So look for all of these. This is something you have to be aware of as you're doing keep noting down your conceptualizations, what you think is happening, what you think could also happen, and look for those. So I'm just giving us a simple example to help you understand how do you conceptualize, because that's how the data analysis goes. It's all about conceptualizing, interpreting. Don't expect numbers. There are no numbers here. If you're having a text, right? Interviews, which run into 12, 13 pages. How do you then extract the information from that? There are no numbers here. You're trying to see what people have said. You've got your research question in mind. You're trying to see whether that helps to answer the research question. But just look at this text. This was an interview we had done with a TB patient, okay, wherein we were looking at what is their sense of care seeking. You know, many of these patients aren't very compliant. They don't finish the course. They stop early. So you're seeing a lot of drug resistance. So why? What's happening here? So we started talking to this. I went to the TB clinic for the first time about 6 months ago when they told me. So how did you find out? Was the interviewer asked, how did you find out? Who told you? People at the clinic, this first patient said. Okay, so how did you feel when you first knew you had TB? You'd like to know, right? What was the reaction when you felt you had TB? So what does this person say? I felt a bit scared. I was upset. I was concerned that my family would also have it. He's expressing his. So what were you scared of? Is the interviewer. You see the interview, right? How it is, you're listening to what the respondent says. Based on that, you're asking the next question. You may have a guide, but let me tell you, the guide is there only to make sure you address all issues. Most of it will come as you're listening to what the respondent says. So what does this patient say? I was scared of what was going to happen to me. Most people I knew who had it died. I was also scared of what others, my family, would think and how they would react. So then the interviewer asked, was there anything else? I was scared because I don't want to make anyone else sick. So I try not to go places where I might give it to other people. So I just like if anybody could tell me from this, any key finding you're seeing, what is emerging from this text, this little paragraph, anything that strikes you. I'll just give a few minutes. Anything? What do you see in this text? No? Nobody's seeing anything? Okay, now let's go to this. Fear about the disease. Where do we see that? Fear about the disease. He says, no? I felt a bit scared. I was upset. I was concerned that my family would also have it. And what were you scared of? Scared that it would affect others, my people I knew people who had died. So the fear about the disease has become is an important aspect that we can see from this. So imagine if you're looking through 15, 20, 30 odd interviews and you see this thing constantly being reported by many patients, then you know that fears about the disease is an important finding that we're getting from these people. Fears about infecting family and others. Where do we see that? I was scared what was going to happen to me. Most people I knew who had it died. I was also scared of what others, my family, would think. And then in the last paragraph, I was scared because I don't want to make anyone else sick. So I try not to go places where I might give it to other people. So fears of transmission. So you're making sense. It's coming straight from the data. It's not what I am thinking. Exactly here, the patient has said that this is the reason I'm scared, because I'm afraid. I know people have died. I'm afraid that I might infect others and my family. And what would my family think? See, he has written it here. Most people I knew who had it died. I was scared of what others, my family, would think, right? So this is the kind of initial conceptualizations that you have to keep doing as you go along with the interviews, okay? It's another excerpt. It's just that I would feel so weak. And many people, they die from TB. It's not good to have this disease. That sounds pretty tough. So how do you deal with it? With the help and support of my family. How do they help and support you? Well, they do all of this. So they take me to the clinic. I need to go. My son and his wife, they make sure I don't forget. And they make sure that I'm taking the right ones. But most of all, I think they help me because they make me want to get better. So anybody would like to try? What is the thing about family support we are seeing here? Are we seeing anything on family support here? Yes? Yes, we're seeing, right? And how does the family support shape up? The children take him to the clinic and they make sure that he is getting his medicines. You know, we know that it affects your physical health and the support of the family to cope. So when you're thinking of the findings that you will come, one of the key issues you'll find is, one is you need to build awareness about disease. They need to understand that it's treatable and that you need to follow a certain course of medication in order to get better. You need to educate families on how to cope and give the support the patient needs, right? So these are some of the takeaways that you will get once you finish your analysis. So then you look at the data, you look at what are these patterns, see the relationship, how are they related. Definitely we can see, right? If there's better awareness, better understanding of the disease, the likelihood of patient being more compliant, completing the course will be better, right? Suppose he feels that, okay, I'm feeling better now, I've just completed 1 or 2 months, I'm having these side effects, I don't want to take it, and he stops, then you're in deep trouble, right? He has not really understood the ramifications of the disease. So which means you need to plow in more effort to educating these people. So these are the themes and patterns that you look for, which will come from this data, which you have to make sense of and write up. A lot of it will depend on you. It's not going to be, it's not like a software that pulls it out for you. You have to look at the data and extract key messages and information that you see there. Yes.
Content, but on the side will be changed there.
Okay.
Because you turn back.
That's okay. Okay. But I'll move it here. Okay. Okay, so when you're looking at this, also look for those extremes, or different case, somebody who was different. Like I remember in this one case, there was this one patient who was very compliant, who consistently took all the medicines, consistently made the regular follow-up visits. So we try to understand what's happening here. And here, one of the things that we understood when talking to this patient was, number one, his awareness. He understood the ramifications of the disease. That's very treatable. And particularly if you identify early and start your course and complete it, it works wonders. And number two, very important, he had an extremely supportive family who took care of him, who did not just leave it to him to do whatever he wanted. They monitored his medication dosage. They made sure that he completed it. They took him to the follow-up visits. All of this contributed to a better performance as against somebody else who didn't have such a very supportive environment. So you need to examine all of these. Important that these are carefully examined. And when you are examining all of these, then you can get the explanation. What is happening here? Why did this work so well here as against the other situation? Okay. So these are the deductive and inductive techniques that I told you about also earlier. So usually when we do thematic analysis, about which I'll talk to you about, we usually start off with a deductive. Deductive is what you do in quantitative, where you have a predefined, you have already decided. If you say that all crows are black, right? Right now, that's an open-ended, that's a clearly structured question. Or smoking leads to lung cancer. It's a deductive approach. You have already identified what is the exposure, which is smoking, and that contributes to lung cancer. That is how you would approach a quantitative study. That is deductive, wherein the researcher decides what all to look for and tries to test to prove whether, in fact, the smoking does contribute to lung cancer, and you have designs for that. Now, in qualitative, we don't go with that approach. Instead, we will ask the question, what contributes to lung cancer? I will not say smoking leads to lung cancer. Instead, I will say, what are those various phenomena or influences or factors that contribute to lung cancer? I'm leaving the door open. Whatever. There could be so many issues. Primary may still be smoking. But if it is, if there are other exacerbating features like not enough diet, not enough healthcare access or poor access or whatever it is, it's going to worsen the situation. So that will be the inductive approach. So usually when we do thematic analysis, we start off with the deductive, which is your conceptual framework, wherein you have identified the domains that go into explaining this phenomenon. And then you develop your guide, keeping those domains in mind. So if you have a domain on awareness about the disease, you will have a lot of open-ended questions that you will ask. What do you know about the disease? What does it mean to you? Where did you learn this from? Then you may have another domain about support from the family. So who takes care of you? Do you have somebody you can rely on? Who is that person? So these kinds of open-ended questions we will have based on the conceptual framework. That's the deductive. That is the closest we get to deductive in qualitative, unlike quantitative, which is much more structured. Here we're just identifying domains and asking open-ended questions. Then we collect our data, and that qualitative data, which is open-ended interviews, is then interpreted, analyzed, and extracted. And you try to see whether the domain you set off with, all those domains you had identified, are they being seen here? Do you indeed find that awareness is very important in determining how well a person seeks or doesn't seek care? So these are things you will look for. So I think I've kind of covered much of this, deductive techniques and qualitative research, where you put together domains to help you identify. Now let's look at now remember, in qualitative research, there are various analytical approaches. There is no one way of doing it. There are various approaches, and usually you're recommended to identify which is the approach you intend to use. Now, it's general way of thinking, how are you going to do this data? What is, you have, I'm sure you may have heard of ethnography or phenomenology or grounded theory as the case may be. So basically, this analytical approach will help you to decide what is the purpose of your research, your role in it, the stages, and how you're going to go about analyzing. Each approach has its own unique characteristics. So once you've framed your research question, depending on what it is, you then decide which is the most suitable analytical approach I need to use. Of course, you should be familiar with that. You should know how to do it because each approach has its own nuances. So these are some, there are many more. I've just listed a few for your benefit because just so that you get a sense. Remember, this is just an orientation. You will definitely need to follow this up with more reading and actually doing before you really want to master this. So we have something called content analysis, which can be used in quantitative studies as well as in qualitative studies. Here it looks at the occurrence of certain words. For instance, you want to develop education messages. Your aim is to develop, see, it depends on the question. What is the question? What is the approach that will be most suitable? Suppose your idea is you want to develop an education message to educate parents about dental hygiene. Okay, and you've done a lot of interviews and focus groups. So in the interviews and focus groups, you're asking people, what do you know about dental hygiene? How important is it? How do you think it should be maintained? How about toothbrushing? How about use of toothpaste? Blah, blah, blah. You ask a lot of questions. So when you're reading the interviews, what is the information we got from parents? From people? What do they say? People say, dental hygiene is not a big, very important thing. After all, you can't get sick or die because of it. People may say that, right? And yeah, toothbrushing is okay. We need to do it once a day. That's enough. And toothpaste, yes, I do whatever is there. I use a lot of these Ayurvedic toothpaste. These are the things people may be saying from your interviews. So you can count and see how many times did people say that dental hygiene is not important. It's not necessary. How many times? You can count. Suppose you have done 20 interviews. In all 20 interviews, people have said, or in 15 interviews, people have said, it's not a very important aspect of healthcare. There are other more important aspects. In terms of practicing of oral hygiene, people may have said, I brush only once a day, or I brush whenever I feel like it. People would have said. So you count each of these, practicing oral hygiene once a day, dental hygiene not important, use of toothpaste, preferable Ayurvedic toothpaste are better. So you've counted how many times people have said this. It will guide you in terms of education. So when I do my education messages, I find that awareness about importance of dental health is so poor. So I need to have more messages that explain how this is. Another thing I might find is people practice brushing only once a day. So you have to have messages or videos that show how important it is to brush at least twice a day, particularly before going to bed. So these are the way you can use content analysis. It quantifies. This is the closest you get to quantification in qualitative research, where you can count. So you can't use it for any type of qualitative research. It depends on what your purpose is. So if this, something like this, a health education or something like that, it can be very useful. Then you have grounded theory. I'm sure some of you may have heard of it. Now, the aim behind grounded theory is to develop a theory. That's how it was initially developed. The idea was that you come up with a theory. The idea is that you go into this phenomenon with no preconceived ideas or thoughts at all. Very difficult in today's day and age because you have access to so much literature. You already know a lot about what you're going to be getting into. But the idea behind this was that if you already have certain preconceived ideas, it's going to influence you and might influence the way you interpret the results. So you go with an open-ended. You don't go with any conceptual framework. You have just some open-ended questions. And then you go where the data takes you. It's called theoretical sampling. So I'm talking to this one person and I'm asking this one person, so what did you do when you found out that your child had cleft lip and palate? Where did you go? What did you do? So the person tells me, I didn't know anything about this. Nobody told me when I was doing my wife underwent the scans. Nobody said that the child is going to be born with cleft lip and palate. So it came as a big shock to me. So what is it telling me? Number one, that this person didn't know anything about it. The scans didn't reveal anything about it, and it came as a shock. So when I go into my next interview, this information is informing me. Okay, so do I talk to women who have undergone scanning? And what was the result of the scanning? Some women already knew. So the data drives the sampling decision of who you will select. So you will select young people, women or men, as the case may be, who are educated, not so educated, who have undergone scanning, anomaly scanning or no scanning as the case may be. You are trying to see whether their perspectives change, whether awareness about the disease was not, I'm saying the abnormality, was it better if they had been informed earlier? So that's how you will go about doing grounded theory, because the idea is to develop a theoretical framework from the findings that you gather. Then ethnography is the one that anthropologists developed. And it usually happened when involved living with, it used to be in those days, involved with working with tribes or particular groups, remote groups. The idea was, if I work with them, live with them, the chances are they will accept me and I will get to see the truth. Otherwise, remember, whatever you do, if you go into a slum area and you don't live there, you are an outsider to that slum. So there's always a certain sense that people may not be telling you the real truth. People may wonder, why should I tell this person? What is the purpose? What is going to happen? So these questions may be there. So the anthropologists believe the best way to get at the truth is to get assimilation. And how do you get assimilation? By living with these people. You live with them, but you maintain your objectivity and document what you see happening. So that will guide you in terms of understanding and interpreting that particular culture. Now we can use it. Ethnography has been modified and you can still use it, but it involves a lot of observations, repeated observations, maybe repeated interviews, more focus groups, because you're looking at culture, right? So it takes a little more of that. And then the thematic analysis, which is one that I will strongly recommend those of you who are starting off to do qualitative research, use the thematic analytical approach. It is much more structured and more easier to do, and I will take you through it. So this is basically about content analysis, where you're trying to see how much, or how often. It's an iterative. It all hinges on how you code. So coding is a very critical aspect in qualitative research. Unlike quantitative studies, where the coding is done before, like you pre-code your data. Here, the coding happens on the data transcript. So as you're reading, you write down your words or phrase. It's not numbers. It's a word or a phrase that is summating what is being described in that piece of text. So you can, depending upon how frequent you use certain code words, you can count and see how often this particular phenomenon has been reported by our participants. There are some questions. Okay. So helps identify which concepts want further. This is what I already explained to you. So it's not just, you're not just simply counting the words, you're trying to understand what is being said there. Like I told you about the dental health example. By listening to those, counting those when we coded, and we found how many, almost everybody had indicated that, they did not feel dental hygiene to be important. It gives you a sense of how important it is to educate people about the importance of oral hygiene. So these are the messages that you can then put into your intervention. It is quick and easy to do compared to other qualitative methods, definitely. And grounded theory, Glaser and Strauss, like I told you earlier, they are the ones who define this whole thing. But subsequently, they split because Glaser believed in this, that I must go with an open mind. I must not be influenced by anything. But Strauss he brought in other ways of looking at grounded theory. It's also known as constructivist grounded theory. Some of you may have heard about it, where every individual constructs their own reality. Just if I talk to you about your perceptions about dental hygiene, you will have your own ideas. Similarly, somebody else will have their own ideas. So that is how the whole phenomenon works. So don't look at any literature before data collection. You better to transcribe verbatim your interviews as you're doing it soon after you finish, so that you can read it. This constant comparison is critical here. So you read through the first interview, what are people said here. When you go into the next interview, and remember, we are following theoretical sampling. So we need to make sure that whatever has been asked here, we are comparing in the other interview, and we are going based on what direction that particular information is giving us. So these ideas from analysis are included in the data collection in the next interview. Okay. So this is the cycle of where from the data you go. So that's why it's called grounded theory. The theory is grounded in your data. It is not that you have decided it beforehand. Looking at your data based on what people have said, you have made your interpretations and pulled out what are those key features or key themes that help to explain your data. So this new theory may not necessarily always be a new theory. It could be a modification or an addition to a new theory. Have any of you heard of the health beliefs model? Health beliefs models of perceived behavior, perceived susceptibility, perceived barriers. So originally, this particular model was developed to look at behavior change. say you've given an intervention and you want to see at the end of the intervention in what ways behavior changed. You can use it qualitatively as well as quantitatively. It's the health behavior, HBM, is very well known in social science and psychology. So this particular model, so when you do your interviews, you will ask people, uh, first of all, perceived understanding. What does this illness or this phenomenon or this problem mean to you? Then you will ask them, how severe is it? How much at risk are you of developing an infection or becoming sick because of exposure to, say, smoking? Then you will also ask them, what are the barriers to following it or not following it, as the case may be? And what are the role models you face? So these were the initial domains in this particular model. But after doing the studies, many studies, others brought in one more domain to this, and that is cues to action. They found that if there is somebody in the family who encourages you, who guides you, who pushes you to doing something, you are likely to change your behavior more readily. So cues to action was another component that was added to this model. So that's how these theories work. You may already have, there may be an existing theory, but if you can add to it, if you can modify it, build on it, that's also a good way of going about your study. But remember, go without any preconceived ideas. Very important when you do grounded theory. And then ethnography, of course, as I mentioned earlier, originated in anthropology. It's on looking at the culture. In those days, culture meant living with a tribe, whatever. Now, culture can be translated to a nursing group culture or a school culture or a business culture, whatever it be. A culture where there are certain shared values and shared beliefs. That's exactly what we look at. It's looking more at normative behavior, not at individual experiences so much. So if that is your aim, your idea is to look at, say, culture of farmers in a community, then you can certainly think of doing this one, ethnography. So the other term that we use a lot in qualitative research is becoming immersed. You need to immerse yourself. See, half of the interpretation comes from this. So once you know, you've seen, you've been there, you've done that, the chances are you have already understood what is happening here. So you will be able to give better explanation. And always we keep the context in mind. And the context means the milieu, the background. Who are these people? Where do they come from? What is happening here? Those issues have to be described in great detail. Then you document in detail, you have participant observation, very important in ethnography, where you sit and observe what's happening here. So if you want to study how nurses give care in an inpatient setting, you can be an observer, but of course you have to get the ethics, you have to get their consent, they should be willing for all of that, but you may have to do it over several days and at different time points to see what happens, how is nursing care actually delivered, just observations. You can have a checklist and use that to make your observations. And the thematic analysis is the one that I'd like to just quickly, take you through the steps of this whole process, because it's a little more distinctive, it's a little more structured, easier for young novices to, to adopt and do. And it has been made better with Braun and Clark, who have given a very clear structure of how to actually carry out thematic analysis. And let me take you through that. You can use any kind of data. It doesn't matter. You can use large volumes of data or smaller volumes. It doesn't matter. So these are the steps that you would follow if you're doing thematic analysis. So the first step is always transcribing, then reading, coding, searching for themes, reviewing, defining, finalizing the themes. So what is transcribing? I'm sure those of you who have done qualitative research know what that means, right? It's also the most tedious part of qualitative. Personally, I hate this transcribing because very, very tedious. You have to listen to the audio and transcribe verbatim. You don't summarize. You don't take shortcuts. You have to document everything that you hear, write it down. I remember earlier on, then if it's in Tamil, the interview is in Tamil, then you transcribe it in Tamil, then translate. So now we have found some quicker routes to do this. One is we take people, young students or housewives who are free, who are fluent in both languages. So we'll select these people whom we have identified over the years, who know both Tamil and English. We give them the audio transcript, ask them to listen and transcribe in English, verbatim. Then we do a quality check, because we can't just accept it. Sometimes poor quality English is not good and all. You get very poor quality data. So transcription is a very important part. And remember, an hour of tape may take an hour of audio may take 7 to 8 hours of transcription. So it's a very, very challenging job, and people can lose interest, not very motivating. But we pay them whatever for the time that they give for this. But this is your data. And this is the data that we need. If the data quality is poor, your whole analysis goes out the window, right? It's pointless. So we have to be very careful that we get good transcripts. Then you have to become familiar. So if you have done 30 interviews or 40 interviews or 10 focus groups, you need to read every one of them. And why do we need to do this? Because that's when you become familiar. Already the analysis has started, right? I told you analysis begins right from day one. So as you're seeing, you're reading, you're rereading, you're looking at what people are saying, looking carefully at what people are saying, why are they saying, what are they saying, and hopefully you have asked the right questions. You have asked follow-up questions. You have probed so that there are no gaps. Person said something, oh yeah, I found this healthcare seeking going to the government facility very difficult. So I stopped going there. And suppose you leave it at that. What should you ask next? You should ask, what was difficult? Why was it difficult? Why did you leave it? If I don't ask those questions, then I haven't got the richness of information that I need for me to be able to explain what are the challenges in care seeking in health facilities. So it all hinges on the way you have done the interviews, how much detail you have been able to extract. So become familiar, intimately familiar. It's called data immersion. And you may have to read it several times. So analysis takes a long time. Don't expect that it'll be over just like quantitative. Don't apply those principles at all when you're doing qualitative analysis. It's time consuming. You make sure you give yourself the time. And you also listen to the audio, read through the transcripts, make sure that you're informed when you go to the next interview. You've already, got a sense of what happened here. And you don't have to wait for all the data to be collected to start. You can start coding early. As soon as you've done a couple of interviews, start the process of coding because you have to develop a code book, right? Of code words, which you then use in all your other interviews. So this process is an ongoing process. And then you can start identifying your conceptualization. Like I showed you earlier with that example, right? You can begin by identifying those, which you have done already. You can start looking to see, okay, I think these are the broad areas that are there and it helps to answer my research question. So it's all there in you. You are the instrument and you have to be able to, and don't get overwhelmed by this. It's not something that you cannot do. It's an area of research you are already familiar with. Obviously, you will do research in an area you already know. But the thing is, you have to be patient and you have to give yourself the time. Otherwise, it'll be very poor quality research. Look for gaps, incomplete responses. Make sure that all these you identify early so that as you're moving on to the next interview, you're already trying to seek explanations for all of this. So it's a very simultaneous process. In fact, we show it as a circle. You're collecting data, you're transcribing, you're interpreting, you're collecting data, you're transcribing, you're interpreting. This process goes on simultaneously. That's the only way you're able to get at, any gaps that are there, any doubts that you have, you're able to answer it. If you leave it at that, it's gone. So then you code. So code is a very tricky exercise. And in our workshops, we teach people how do you actually code data. So it may be difficult for you to absorb this in this few minutes that I have with you. But basically what we do is as we are reading a transcript, we are, right, see, we have so much of text. You have to reduce this data now. So much of volume of data. How do you then make sense and come up with those 5 or 6 themes? It has to come from this data, right? So as you're reading your data, in the margin, suppose in this first paragraph, the woman has described about her experiences in the, with care seeking, with different facilities, where all she went, why she went, whether she had decision, all those things she has described there. So in the margin, you can write a code word, experiences with seeking care. Okay, you can be more specific in your codes as you move along. I'm just trying to give you an example. As you're reading further down, the woman says, when I went to this private hospital, first thing they ask is, I have to pay so much money. And I found that very difficult to do because I didn't have the money. So because of that, I decided not to go there. So in the margin, you can write the code word, expense, or you can use any word. So costly care. It's up to you to decide whatever words you want to use. So basically, what are you trying to do? You're reducing this into few code words. And those code words are the ones that you will use for your interpretation and analysis. Okay. You have semantic codes or latent codes. Semantic codes are basically what the data says. Always you have, when you do inductive coding, it must be semantic, meaning you're just not making any interpretations. You're not assuming. If a woman says, when I was waiting in the queue to see the doctor, the nurse asked me to go to the back of the line. I have HIV, so I was asked to go to the back of the line. So you shouldn't say feeling stigmatized. Did she say that? She didn't say that, right? All she said was, I was waiting. The nurse asked me to go back in the line. What do we know? What was the reason? Maybe she came late. So others you have to give everyone their turn, right? You can't just because, but the woman may interpret it differently. So it's not your job to do that. Your job is initially just code, was asked to wait in the end of the line, had to wait for many hours for care, whatever it is. It's when you come back to the data and you want to bring in your interpretation, that's when, if you feel that this is something that has been reported by many people, you could say they are treated differently. You may decide to even use words like feelings of discrimination and stigmatization as a latent code. That is your interpretation, which comes in later. Okay. So these are the kinds of code words that you will use. You will predominantly do mostly semantic coding, and the latent code comes later at the time of theme development, when you're determining what are the themes that will go to explain this data. So data derived or semantic codes capture the surface meaning, and there you have to be very careful. You don't bring in your own ideas or thoughts. You stick to what a person is saying. Only that must be reflective, because we are looking at participant perspective, not yours. Remember that. And the researcher-derived or latent codes can be brought in later. As you're reading through, you kind of are making sense, making your interpretations. Okay, so use both. So these are, you make sure that what we do is we initially when we're doing our interviews, right? Once we've got 2 or 3 interviews, we do inductive coding. That is myself and my colleague. We just simply code inductively without being guided by anything. Keep my mind open, look at the data, what are people saying, put code words right through. Once that is done, we then compile our codes. What my colleague has done, and we made a big code book. And then whatever is repetitive or saying the same thing in different words, we pull it out. We can also think to group. Everything that is asking about experiences of care seeking, I can put it under one category. I can put the title experiences of caregiving under that, care seeking. Under that, I can put down all the things people said. I can have another category wherein people say affordability, availability of care, wherein people have talked about how costly it is, how they can't afford it. So all those code words so you're already beginning to form your initial conceptualization. These initial categories can then be merged to form themes as the case may be. So this is the way you would go about analyzing your data and coming up with these kinds of relationships between different categories. And then you review to see, you may end up with 15, 20 odd categories. Can I further reduce and combine? Some of them may be best brought together. So there's a lot of playing around that you do with your data. So this is the same thing that we were seeing earlier. So feeling scared, upset about diagnosis, fear of infecting others. These were things that the participants said. So those are all semantic codes. Whereas latent code is what we then interpreted, wherein they talk about feelings of self-stigma. We felt ashamed, right? I don't feel like going out. I'm afraid of what people will say. When he was afraid of how people would treat him. And also fears of disease transmission. So those latent codes will eventually become my beginnings of my theoretical framework or my conceptual analysis of the findings. So you have to constantly look for this. Don't be quick to finish. Okay, I have identified, I think this is it. So you keep looking at your data, start with these conceptualizing, keep adding to it, and you can move it around, bring 2 categories together to form a theme. Or if you feel that the whole thing about awareness about disease needs to be a separate standalone theme, you can keep it as a standalone theme. But it's all coming from the data. So only after you're finished coding the entire data set, do you finalize the themes. Okay. So it will allow you time. So by the time you're finished, at this, you already got a clear sense. That's the richness or the beauty of qualitative research. By the time you're finished doing the interviews, you're reading through the transcripts, already the internalization has happened. Already you've got a fairly clear picture of what are the things that are happening. So it becomes very easy to identify. So you shouldn't get, perturbed by all of this. It is time consuming, I agree. And there are no shortcuts. That's also there. But the fact is, once you have done this process, your familiarity with and understanding of the phenomenon will be that much stronger, more robust. You know exactly what's happening and why. And you will be able to explain, which sometimes in quantitative, you may not get that depth of information that you will get in qualitative. Okay. And you may find that when you're coding, some codes are used more often. Maybe that's dominant. Maybe that's an issue that people have all reported. So definitely needs to be featured in your report. But always remember that when you write up your results, you bring in all perspectives. Like I said earlier, no? Just if only one person has said, only two people have said this, all others have said something else. Do not sideline these two. You have to bring everyone into the story. So it's basically like writing a story. So your skill of writing, how well you are able to describe and explain such that people will understand is very important here. So check that they work, reflect on whether, remember, you can't just bring something in and say, this is what I found here. It must be convincing. It must be believable. And in your discussion section, you're going to look at your study findings in the context of other studies. How different is it? If it is different, why? So all that argument you have to give. Do not think that I can just do anything I want and call it qualitative research and say, I found this, so that's it. It must be believable. It must be trustworthy. It must be credible. And just like you have checklists for looking at doing good quantitative studies, we have checklists for qualitative research also. It's called the COREQ guidelines, COREQ. I forget the full details of the acronym, but just simply like any, concert guidelines or any other, which tells you how you frame your question, how you then design your methodology, how you then sample, how then you decide to do the coding, and how you go about presenting your results. So you then decide whether I can split it, collapse it. So that's entirely up to you. So at the end of all of this, you then identify what are those 3 or 4 or 5 themes that best help to explain this phenomenon. So if your research question are, what are the needs of parents who are seeking care for cleft lip and palate? Yes, I'm finished. If that is your objective, then yes, you'll be able to do that with this kind of data that you have gathered. You're looking at what their needs are, at where and what levels, okay? So then, of course, writing up, that's up to you, how well you are able to write and present, that's very important. These skills, the more articles you read, the better you will become at writing, The more you are able to read and absorb, the better you will be, more skilled you will be. And always make sure that in your discussion, you contextualize it, bring in the literature review and see what others have found. So broadly, this would be the steps that you would follow. You begin by gathering your data, then you read it all, then you code, then you think. The thinking has to be there right through the whole process. Repeat as needed, and then identify the themes that go into explain. So the challenge is that you need to learn these methodologies. It is critical. There's no way you can do it without getting proper training. It's not something you can just, go ahead and do. You need to understand the nuances of this. You need to understand how it's different from quantitative. What are the methodologies? How iterative it is? How do I code data? How do I then interpret and make sense? This is not something you can do unless you get some training or read up a lot. Reading good published articles will also be very good. But the benefits are that it gives you, like I said earlier, very deep understanding about a phenomenon. It enables exploration, it enables you to understand what are the, factors going on here, what's happening here. You get the perspective of our participants, amplifies their voice. You want to understand what people say, and that is what you're able to get, okay? So it gives you a lot of rich data, which will help you to move forward with your study. So this is basically what the whole analysis will center on. It will look at, yes, it is subjective because that's what the aim is. You're trying to understand subjective perceptions of people. You have to contextualize it. It's flexible. There's a lot of richness and depth that we are looking at, okay? And it's inductive. That means bottom up. And also you have it's all very natural, happens in a naturalistic setting. So with this, I have finished my presentation. I know there's a lot of information that you all have had to listen to, but if there are any questions, anybody has any doubts, I'd be happy to take some. Okay, there's a question here, how to ensure the validity and reliability of qualitative findings. Yes, very good question. But remember, you don't look at the validity and reliability the same you would do for quantitative studies. Validity in qualitative research means trying to get at the truth, right? So it's the way you do the study, how open you are, the kinds of open-ended questions you're able to elicit from people that will give you the truth. And reliability, see, we are not so concerned about repeatability as you would in a quantitative questionnaire. When you administer a quantitative structured questionnaire, you would like to see that similar circumstances, you will get the same because you're using structured questions. But remember, in qualitative research, you're just having a guide and you keep adding on to the guide. So you're not so much interested in that level of degree of reliability, but we do like to see that you follow the same conceptual framework. You're using a similar guide to guide you through the whole process. So the interpretation of the two is a little different. Okay. I think any other questions? Anybody else?
Any questions from the audience? Can you pass the mic? That's
Ma'am, we have one question from online delegate.
Okay.
Can you share some practical strategies or techniques that you have found effective in implementing bracketing throughout the research process?
See, yeah, when you're talking about bracketing, you're talking about phenomenology, right? Basically, but we do this even for qualitative. The best step that I found useful is before you begin your study, you sit down and write down what you expect to see. It's a good idea to begin that before you begin your study, you put down in a piece of paper what are all your expectations, what do you expect to see, what are the issues that's happening here, and what could be problems, what could be challenges, what could be difficulties. Put it aside, put it down. When you go out into your study, do not let these influence you. Keep your mind open. So that comes from practice, keeping your mind open to ask open-ended questions, because it's very, very critical in phenomenology where you need to set aside or bracket your own ideas and thoughts and allow the respondent to speak. So a lot hinges on the way you are able to ask open-ended questions without being leading, without being, a judgment. So that's one of the strategies I feel would be helpful.
One more, ma'am. Can you please suggest training program or center to undergo qualitative analysis?
Well, we do workshops. So they can contact me, and as and when we do a next workshop, we can always, keep them on the loop and ask them to participate. We just finished actually in May a workshop on qualitative research methods where we go through the whole process, including methods as well as analysis. There are others, but I have not. I think just have to keep looking out for it.
One more, ma'am. Semi-structured interview guide can be formulated with themes and sub-themes.
See, the guide, you don't begin with themes when you develop your guide, right? The guide is only to guide you through, to ensure that you ask all relevant questions. Don't use the guide as your theme. Okay, the guide is based on your conceptual framework, but that is not the end of that's not the final end result. That is only there to guide you through. Yes, once you collect your data and you have been exhaustive, you might find that the framework you set out with, on which your guide is based, will be reflected in your findings, in which case it's fine. You can go ahead and use that. But be very careful that you don't use the word theme when the theme is a finding, it's a result. So when you start off, they're all domains, right? A conceptual framework. You're not yet decided. You don't know. You're keeping your mind open to what could happen. So be careful of how you use these terms.
I'm here. Thank you very much for the very informative and very detailed presentation. I really appreciate that. And thank you very much for this presentation. Just a quick thought about some things, maybe that I have come across the questions that I was asked by students ahead regarding qualitative research, because not most of us are experts in health behavior to understand certain aspects of the data collected to qualitative research. One thing that I noticed was that interpreting non-verbal data during qualitative research, because we're not health behavior experts, and I don't know how we can train the students to understand this kind of non-verbal data, be it a pause, be it head scratching or whatever it is. There's a pause in between the data. How do you interpret this kind of data? That is the first kind of question. A sub-question to that is, how do you explain the role of power dynamics or social desirability influencing this kind of pause during data collection? That was one question. I'll ask my second question as well. And like you said, this kind of qualitative analysis is mostly researcher derives. The analysis is done by the researcher, how he interprets it. I think it comes close to the validity question that was asked before. I'm not sure, but my question is, how do we know that researcher has interpreted the data correctly.
Mhm.
Doesn't it come back to the same point of
Well,
researcher's bias or objective bias?
Yeah.
That's the second question. Maybe it's related to the first question to how he interprets the
Yeah.
pause and nonverbal data. This is mostly interrelated to each other. The last question is, like you said, the qualitative data is mostly deriving things off the data and going ahead slow. It's reflexive, like that's what the reflexivity is, the main idea behind qualitative research. So as a researcher, how do you explain the change in your methodology that you have done during the study?
Mhm.
Like, for example, you've obtained your ethical clearance, you've given a set of questionnaires, and then you realize during your study that, okay, there's something that is missing, and I will include another set of stakeholders in my study, and maybe I will induce another questionnaire.
Mm.
So how do you explain to your your supervisors
Mm.
or your ethics committee? How do you back up and say that, you know what, I'm going to do another questionnaire because I found them as important stakeholders? So these are my questions. Thank you.
Thank you. Very nice questions. And thank you for your interest in what you have asked. See, as when it comes to body language, it's very important how you communicate. So usually when we are doing our focus groups, you are always observing, right? So it's more than anything, it gives you a sense of reliability of this respondent. Has this person, is he speak from his heart, or is he or she really hiding something? So these are things that you have to gauge. Now, how it comes, it'll come with experience. As you talk to people, you will get a sense. I know I've been in focus groups where I've seen people not interested. You know, after a point of time, they're not engaged. So you know very well it's not working. So it's just a message for you that you need to maybe something in the way you're doing it, or maybe the questions, the kind of selection of participants hasn't worked. So these are ways by which you try to improve. The other one is about the validity, right? About how do you make sure that the information you have gathered. See, let me tell you, whether it is qualitative or quantitative, researcher bias is something that goes through all of them. It's only a matter of the degree, right? And then qualitative, probably because it's less understood, people don't understand the nuances of how you do it, it's criticized more. It's seen as anecdotal and what have you, which is why we follow all these. I didn't go into all those other issues of data saturation, of triangulation. These are all techniques we use in order to try to corroborate evidence. So if I'm using, say, data triangulation, where I'm collecting information on the same person, usually we would do that if it's a holistic study. I would not just talk to parents alone. I'll talk to family members. I'll talk to healthcare providers. And from all of them, I'll try to get similar kind of information. What do they all say? Maybe they say it from their own point of view, but it builds evidence on the phenomenon. We are only seeking to understand a phenomenon. We're not trying to generalize or whatever. So to that extent, it definitely strengthens the validity. So if you write in your proposal how you went about doing data triangulation, how did you look at saturation? Saturation happens at various levels, right from data saturation when you're collecting data, to coding saturation, to thematic saturation. So it's up to you how well you are able to show that and how well it works. And the last one was on, I'm sorry, about the adding on.
Yeah,
question.
how do you
Yeah,
add on and
yeah.
how do you explain it to the ethical committee?
Yes,
Do you
yes,
give
yes.
you a new
Yeah, it's a big-
questionnaire and how do you justify it?
Yes, that's a big challenge, particularly if the review committee is not familiar with qualitative research. But I find that there's less now. More and more people are recognizing the importance. So one of the things you can do is when you write your protocol, you add a rider that I intend to include so many people, but depending upon the issues I face or depending upon my need, I might want to include one or two more. Once you do decide to include one or two more, then you have to probably submit it to the ethics committee saying as an amendment, you know, instead of planning to do 15, I've done 20. You have to justify it. Why you have included this person? What is the new information? So if you're able to justify it, that's fine. Now, adding questions is not something, see, it's not a questionnaire that we use, you know, it's a guide. Remember the difference between the two words. Question is very structured. You can't change it. You can't modify it. Once you've validated it, that's what you will be using. But this is only a guide. Everything is out there, right? You have internalized it. So you can give that explanation that we are using a guide. These are the broad domains you explain all that in the protocol. That's why protocol will be very detailed. In the protocol itself, you say, I'm going with this guide, but this is an area I'm exploring. There's a possibility that depending on what people say, I may have to add on more questions or rephrase existing questions. That's perfectly fine. So long as you're able to say it upfront. Thank you.
Any more questions?
Think that-
Thank you, ma'am, for your outstanding presentation
Thank
in
you.
highlighting the key features of qualitative analysis. Your expertise and insights on recording, documentation of data, and thematic analysis captivated our delegate with a lasting response.
Thank you.
Thank you so much.
Thank you, sir.
I now request the chairperson, Dr. Umarani J, to hand over a certificate to this resource person, Dr. Shubhakumar.
Check. I think we have one more question.
Dr. Shubha, it is not a question. I have a doubt about that validity of the data which they have asked.
Hmm.
Is it okay if we validate the transcribed data with the participant to know whether they express the same as the researcher have perceived? Is it correct?
See, we don't do that because number one, once the interview is over, participant may go off, you may not be able to catch it. But there is one thing that people do, which is feedback. So what you do, at least in focus groups, is something we do. As you're running through the focus group, you have your questions, right? You have your topics. As you cover a topic, you can then stop, pause, and say, okay, thank you for your participation. You all have said all of this. Is it correct? Is there anything else you would like to add? So at that point in time, you could strengthen to make sure that whatever you have, stated there has been their opinions. That's something you can do. The other thing people do is, once a study is over, you can go back to the community or the setup where you did it, present your findings and ask them to, like a dissemination, right? Do you agree with this? This is what we found. Is there any issues that you feel not working out? Nowadays, there's co-design. I know you've heard this term. Co-design is something that's the catchword now. For any study you do, the target respondents who are going to be the subjects of your study are involved in the whole process. For instance, we're doing some work with youth. Now, throughout the development of the guides and the planning of the whole study, youth are part of the whole planning framework. So to some extent, their opinions, their ideas, their thoughts are all reflected in the way we would do it. So these are ways by which you could, enhance validity. Okay, thank you.
I request the moderator, Mrs. Savita, to hand over the certificate to the chairperson, Dr. Umarani J. Thank you, ma'am. Now I request Mrs. Timmy Thomas, Associate Professor, Department of OBG, Yenepoya Nursing College, to hand over a certificate to the moderator, Mrs. Savita.
Thank you, ma'am. Let's take a break to refresh ourselves. Refreshment is arranged in the backside of the hall. Kindly proceed.
He did his diploma nursing from Government School of Nursing, Kozhikode, Kerala, PBBSc Nursing, MSc in Mental Health Nursing, and PhD from Manipal College of Nursing, Mahe, Manipal, Karnataka. He also received a master degree in Applied Psychology from Madras University, Tamil Nadu, and a postgraduate diploma in Psychological Guidance and Counseling from Manasa Educational Foundation for Mental Health, Shivamogga, Karnataka. He has over 35 peer-reviewed publications in the area of nursing. He is currently involved in funded projects from the ICMR, Ministry of Social Justice and Empowerment, and Ministry of Human Resources Development, Government of India. Dr. Binel is a life member of TNI, NRSI, ISPN. He is currently the Deputy Member Secretary of Institutional Ethical Committee of Kasturba Hospital and Kasturba Medical College, Manipal. He is currently supervises 6 PhD scholars. With this brief introduction, I invite you, sir, to introduce resource person. Over to you.
Thank you, madam, for the lovely introduction. Good morning, esteemed guests and participants. I'm grateful to the management for giving me this opportunity to chair this wonderful session. So, hearty welcome to this insightful session on integrating quantitative and qualitative results analysis and interpretation mixed methods research. This particular session will explore the critical aspects of analyzing and interpreting mixed methods data, which is essential for advancing evidence-based and improving patient care. It is my distinct honor to introduce our resource person, Dr. Kanchana S., Principal of Mailachi College of Nursing and Research Director at the International Center for Collaborative Research. Dr. Kanchana completed her BSc and MSc in Nursing from the Tamil Nadu Dr. MGR Medical University in 1996 and 2000 respectively, and her PhD from MP Boch Open University in 2009. She also holds a postdoctoral fellowship in research from QMU, Edinburgh, Scotland in 2009, and a postgraduate diploma in values in healthcare from Annamalai University, Chennai in 2016. Dr. Kanchana is a Senate member of the Tamil Nadu Dr. MGR Medical University, Chennai, and a former Board of Studies member of the same university. Her accolades include the Best Teacher Award from the TN Dr. MGR Medical University in 2012, and the Paul Harris Fellow from the Rotary Club of Tambaram in 2011. With over 90 publications and more than 100 presentations, Dr. Kanchana has significantly contributed to the field in nursing research. She has led numerous funded projects and supervised PhD scholars, in addition to authoring 3 books. Dr. Kanchana also has extensive experience in implementing mixed method research in healthcare settings. Her insights and expertise will undoubtedly enrich our understanding and application of these methodologies. So with this brief introduction, I request Madam to take over the session. A hearty welcome to you, dear friend.
A very good morning. I feel you're very far away from me, but hopefully my talk and the connectivity and interaction we will have in the next probably 40 minutes, we should be able to connect with each other. Thank you, Leena, Dr. Leena and team for having me here today. And I know that you're facing a lot of challenges due to the weather, but still having it in a hybrid mode was a big choice. You had made it earlier so that you can meet those challenges, what you're currently facing. Yesterday's speaker, Dr. Richard, spoke on quantitative, and today Dr. Shubha spoke on qualitative. So I think my job would be easier to say where you need to integrate. I hopefully believe so. Quantitative has been a tradition in medical research, and that became a tradition in nursing research. because it was a medical model of research and then came into nursing research too. Qualitative, though we had many pioneers who were doing a lot of research on quantitative, there was always a fear or always a hesitancy to take up qualitative researches. So a small brief, a survey was done on why nurses were having this hesitancy to take the qualitative research. So when it was identified that the major thing was writing their own context, writing the context and the language to be used was a major barrier which they felt prevented them from taking up qualitative research. I think now with the current education system or the last 2 decades of education system, we have overcome that to a certain extent. And because of the influence of the foreign universities and the collaborations we have had with many universities under many institutions, the concept of qualitative research was brought in to nursing in India. And I remember Manipal, the Manipal Institute, which has first conducted a qualitative research. Then we, in 2009, did a qualitative research. So like that, the pioneer institutions came in trying to introduce to nurses that you don't need to do only quantitative research, you can also do qualitative research. But most, as what the previous speaker said, when reviewers or evaluators, they felt that qualitative research was very subjective. It doesn't have any objective data or there's no evidence being brought forward from qualitative data. So some of them were hesitant to accept qualitative as a dissertation or as a thesis or as an individual project or a funded project. So that again was a gap which was there. At that point of time, people introduced the concept of, trying to merge quantitative concepts and qualitative concepts. And we were doing a lot of primary healthcare or community-based participatory researches. So when we started using community-based participatory researches in primary healthcare context, we were driven to doing some kind of small interviews to the beneficiaries of our research in the quantitative aspect. So there was some embedding of qualitative informations which were brought in. So that brought in the impact of having MMR studies in nursing. So we at Omyalachi, the first kind of study we did was on child abuse, because that was the first thing we are trying to explore in a community. We had to face a lot of legal implications, but when we thought of doing a child abuse study, because that was more prevalent in the specific area where we were working with, we then decided, why don't we do a study on child abuse? Again, remember, audience, both virtually and presence, don't select the design and then select the phenomena. Is it the right approach? Is it the right approach? Because you're attending an MMR international conference, can you go and think about a phenomena which meets a design? That is not the format of selecting a design. Always have the question first. Have the phenomena in your hand. Have the question in your hand. And only the question should drive a researcher to choose what design you should select for your study. That is the right approach towards any research, research approach or research design you want to select for the procedure, for the phenomena you have chosen. So when we thought about, then came in the thought process of MMR. But the challenge was, this was the first ever MMR study we were doing. So we had to take experts' guidance. So we had people from, CMC, we had people from Queen Margaret University, and we had people from University of Saskatchewan where we collaborated. So the experts came in and helped us to frame the process of study. So initially, when we started doing the study, we need a lot of expert guidance. So if you are looking forward to take up studies in qualitative or MMR, identify those people who are here today, who are the legends, who have been doing a lot of MMR and qualitative studies. Identify them, go back to them, get their ideas, pull in their ideas, the process, the expertise, all that has to be taken before you start doing any kind of studies, and especially MMR, because you have a result separately from a data driven from a qualitative aspect, which is completely subjective, and you have a data driven by a quantitative aspect, which is mostly objective. So when you're going to mix a subjective and an objective data, you need to have a lot of expertise and know where are the key decisions as research experts we should be able to take, so that the process of qualitative and the outcome of quantitative is being answered in your MMR integration. So integrating, or the analysis kind of integration, and the interpretation of results based on the integration is very important. So you can do 2 independent studies, but importantly, at what point of level of the process you're trying to integrate the result is something which we have to look into. So today, the next 40 minutes, as I said, we'll be doing, we're looking at these introduction steps and the focuses of MMDA and the designs. So what emerged? When we had quantitative, when we had qualitative data, when we mixed quantitative and qualitative, we had mixed methods. So when there was identification of a mixed method research, we also had different kinds of methods which we came. Should I do quantitative first or should I do qualitative first? The question of that brought in different designs and methods in mixed method research. The kind of methodology, the process, who should be the participant and where, what kind of participant, what would be the sample size, what would be my participant end, how do I have to select criteria, should I write quantitative separately, should I write qualitative separately? So all these questions were being answered through the development of this research perspective. So we mixed 2 different paradigms of quantitative and qualitative, and the mixed method research paradigm was brought into place. So the steps in conducting a mixed method study include, as usual for your quantitative, it's a design. You'll have a phenomena will be there. You select a design. What is the data collection method specifically for the data, for the quantitative part, as well as the qualitative part, and see where you're going to merge, and then your interpretation. Interpretation requires a lot of expertise in doing triangulation. Triangulation is trying to mix information or the outcome from a quantitative and a qualitative aspect, different methods put together to answer the research question. Only then we can comprehensively answer the research question framed for a MMR study. So these are the steps which will be included in your MMR analysis. You'll have a qualitative data separately. You'll have a quantitative data separately. Qualitative data analysis method, Subha ma'am said you have thematic analysis, you can have various methods like Colazzi method is there. There are a lot of other methods available for different type of designs. You have different types of data analysis in a qualitative aspect. And in a quantitative, all of us know we use a descriptive and inferential statistics, and various types of statistical tests are there. For both forms, you have softwares to help you. If you want to validate if your information is correct, there are softwares which is trying to help you now. Earlier, we used to read line by line, word by word, identify. Suppose a child who has gone through child abuse is trying to express fear of seeing a person or a stranger or a male person or a elderly. Probably they express us in different kinds of words. So we'll have to read through every line, identify those codes in that paper and try to cumulatively do that. But now you have an Atlas T software, you have a Maxda, you have an NVivo. These are softwares which are available for the qualitative researchers to identify the codes that even tell you what kind of themes can be derived in the qualitative aspect. And quantitative, all of you know, there's an SPSS software available for a quantitative analysis. So you have the advanced technological softwares available for even assessing the transcription to a back translation, etc. Everything is available. And so you have 2 sets of information, one derived by quantitative, one derived by qualitative, and there you need to mix it. The focus in a mixed method data analysis should always be on what type of MMR questions we are trying to answer. For example, I want to do a quantitative aspect first and then go in for a qualitative aspect next. So it's a sequential design. So what question has led me to select the design, and what is the answer I want to do? Do I want to see if strategies help a child with an abuse to overcome the post-traumatic stress disorder which a child is having? Or should I explore more about the strategies the child utilized to overcome the tragedy and currently living in? What were the coping the child has used? So what is the question I'm trying to answer becomes a major question in a data analysis aspect. And as researchers, when we are doing analysis for MMR, it is important that you have certain key decisions, which I'll highlight in the framework for you. So what will the MMDA reveal? Suppose you want to mix a data analysis, you want to do a data analysis for mixed method research. These are the benefits what you can have. One, validity. Someone asked about validity in qualitative research, and it's more of trustworthiness, which is very important in qualitative research. So whatever disadvantages qualitative have, you can answer with the quantitative research, or the quantitative research supplements the answers for the qualitative component, and vice versa. Offsets the weakness of a quantitative. Suppose quantitative says it is only depending on the numbers. It doesn't say anything about if I'm going to see what is the stigma, or what is the the burden the child is facing, or the grief the child is facing, or a family with a child with cystic fibrosis is facing, or family with a terminal illness. What is the burden they are facing? I can only use a scale, assess it, quantitatively say this is so many percentage of burden or grief the family is having. But I do not have an opportunity in a quantitative research to say what the family felt while they are caring, where the burden is more, what are the aspects the burden is more. Quantitative doesn't allow you an opportunity to do that. But when you mix qualitative in that quantitative aspect, you have an opportunity to write a story of that family, and this story will help the others who are also facing, and how they've overcome that difficulty would always be told in the story. So that way, the quantitative and the qualitative helps to support each other's difficulties. And there is a more comprehensive content you have in your hand. That comprehensiveness is because, as I say, I also quantify the amount of burden the family has. Also, I will say, see, this is how a family has overcome, and it's possible that if you follow these processes, the family can overcome the other difficulties or grief. So that way, there is a completeness. And as I said, quantitative gives you the outcome, and quality is a process. So it is important to have the process assessment and the quantum assessment, which is the outcome. And qual can explain the quant results, that is the transformation. Some of the researchers have now done a beautiful study where in relation to the nurses, burnout, where they have qualitatively assessed certain areas of burnout, but they have transformed the qualitative data into quantitative information, so and that's what explanation. Trying to provide what the quantity has given towards quality. So that way, you can have an explanation available. And unexpected results. Sometimes we have as we had the child with an abuse, age of 10, a girl child with an abuse from the own family member, has the grit to live in the same family over the last 5-6 years. We were amazed how this child was able to cope. Where did the child get the coping from? So this was our biggest question we had, but we were able to answer the way, because the child has been brought up with so much challenges in the complete environment where the child was living. And those challenges has given her the strength to overcome this tragedy of child abuse. So that is unexpected results, and how this unexpected results can be answered by the alternative methodology is what you will be able to answer in a mixed method data analysis. Instrument development, as you say, as Subhash said in the morning, the grounded theory helps you to develop a theory by its own. I've been telling my my teachers as well as my students here in my PhD stating, we have a lot of problem with non-communicable diseases. We have algorithms for disease. We have algorithms for disease, but we do not have a theory to help. We are using previous theories, but what is a theory towards handling non-communicable diseases? There are many aspects which we are looking at. Physical syndromes are there, psychosomatic syndromes are there, psychological syndromes are there, terminal aspects of those syndromes. There are so many things which we can connect to. So that's one thing. You can develop instruments using when you combine qualitative and quantitative. And the credibility, again, both the procedures. When you use quantitative, again, it has its own rigorousness in the data, what you are going to analyze. The same way for qualitative. So there is a credibility in the information, what you provide from quantitative and qualitative. So when qualitative says that this is the kind of stigma the child faces, then quantitative also you develop assess a protocol, and based on that you tell. So you have an information which is shared, tells, yes, that result is correct. Yes, this result is correct. There is credibility in the outcome of the research, what you are going to give as evidence to the profession. And the context qual provides a context and quant provides the generality. So as I said, we always generalize findings based on quantitative results. But community-based participatory research, which are in the big boom now, are focusing on the integration of both quantitative and qualitative, because qualitative provides the context for the phenomena which you are trying to study. And it is more useful for practitioners, especially in nursing, because in nursing, we deal with human beings. We don't deal with machines. We don't deal with laboratory, chemicals or materials. It is more of human lives. If a patient comes to you with a terminal illness, it's not about the disease is more important. It is about the person by himself is more important. But if you want to assess that person, you should have known the qualitative aspects of how to interview that person, how to get information, what would help more, what is that the family requires, what patient support is required. So the human feelings and emotions, if I ask you, can you measure the happiness of a person? Can you measure the happiness of a person with a scale? No. But you can measure a quality of life of a person. That quality of life, can it tell you the happiness of that person? No. If you do the assessing the standard of living or the quality of living using qualitative aspects, and then try to integrate it with the quality of life of that individual, probably you better answer the question or the phenomena than just individually doing the study. Am I meaningful to you when I'm communicating? Yes? Okay. So now you know the basics of quantitative through Dr. Richard yesterday, and today through Dr. Shubha, you know the basics of the quantitative and qualitative analysis, presuming that I'm just giving you a highlight of what qualitative and quantitative will do under this 6 major subheadings. Now, the first one is preparing. Once the data set is in your hand, quantitative data set is there in your hand, collection after your data collection. In qualitative, you have a data set in your hand. What will you do with that data set? First, you have to prepare that data information for the analysis, the data analysis. So what you do with the quantitative information? Generally, we advise when the scholars are doing research, the initial part we say, as you frame your questionnaire for quantitative, see that you also put the coding sheet side by side. So when you have the coding sheet in hand, it's always easier because you have to do the statistical procedures, dry run before you enter into your data collection itself. That is the norm how it has to be done. So you have to code the data in quantitative research, prepare the data analysis to feed into a computer program. You have a lot of cleaning which will happen in your quantitative database, recode if it is required, and you establish a code book. Coding is very, very important. That is the initial phase, because even if SPS is available in your hand, which will only do analysis of what data you enter. If you enter wrong data, SPSS will give you wrong information only. Either you use EpiInfo or you use a StatS, whatever it is, what information we feed. So the data cleaning and data, how it is to be handled, the data information have to be fed properly. So for feeding that, your preparation of analysis, the data what you have for entry or analysis, the first thing in quantitative is that. In qualitative, actually qualitative analysis doesn't start after you collect your information. Qualitative analysis starts as the time you start off your interviews with your participants. It's an ongoing data analysis, because if you have to ask the next lead question, you have to know what you have already got information from them, so that it leads you into understanding the story of the participant you are trying to speak with. So ongoing analysis is there. So when you as along with the ongoing analysis, after you collect the data, the first thing is you organize the data, documents which you have collected so far as per the date, because generally that organization is important, and you transcribe. You would have mostly audio taped, and every audio taped information or videographed, pictures you have or a video you have, or you have small diaries which you have written. It's called as field notes. If you have written those field notes, there you say, as they rightly asked, if a person, squeezes her hand, if a person's have a specific grimace on her face, what does that really, at what context of question did your participant respond in that non-verbal communication? So that has to be recorded in your field note. So when you are doing the analysis for qualitative, you have to comprehensively see the audio taped transcribed information, the non-verbal transcribed information, your photographed information into your paper. All that should form the basis for analysis in the qualitative data. So thereby you can prepare the information what you want to feed into the computer program. Next is exploring the data. So far we have prepared the data, both for quantitative separately, qualitative separately. Now you're exploring the data. Exploring is, in a quantitative data, you roughly go through visually, you see how the data has come out. For example, the demographic variables or the pain scales score assessment is there, or you have a quality of life assessment scores are there, or the tobacco control program, you're looking at quit smoking willingness. So there are so many things which are there. So you visually inspect what data you have got ready to be fed, conduct a descriptive analysis of the data, and check for any trends and distributions. Very important, because for the next inferential statistics, this slides as a base forward towards your the first step towards in the quantitative analysis. In your qualitative, as you explore the data, you're looking at reading through the transcribed data line by line. In qualitative research, we always say the researcher is the instrument in the study. If the researcher is not there, the study doesn't happen in a qualitative study, because I am the one who is looking at to answer the question what I have framed. So I should be the one collecting data. I should be the one transcribing the data. I should be the one who is reading or writing the story of that person where I am. So I have to read through the data, write small memos. As I said, if the child has expressed fear in our interview, the fear in different forms from 5 participants, you would have different forms of fear expressed. So you have to write those memos. Fear was expressed like what? Coping was what are the different ways of coping 5 participants has expressed to you as a researcher. So all that you'll have to write memos in areas wherever you think the themes can evolve from, and develop a qualitative code book, which is important because this code books allows you to identify the themes and the sub-themes for your qualitative research. Next comes the analyzing the data. So we have to choose, you have done the descriptive analysis, basic descriptive analysis. You have done the, assess the trends. Now you have to identify, you want to use a t-test, or you want to use a ANOVA, you want to use a MANOVA, what test you want to use. So quantitatively, I'm sure they would have dealt everything. So what test you have done should do for quantitative, and for qualitative, all what Subha ma'am had said, from coding to theming, using thematic analysis, and then using the sub-themes for the codes so that you can write the story under those sub-themes and themes. So that is where qualitative analysis of data will be done. Next, you have to represent. Generally, we represent the quantitative data in a tabular column or in figures or in descriptions. In qualitative data, we write it as, you can write it, it is told as themes, but descriptions, representation of descriptions after the theme, which is selected for the qualitative research. Next is interpreting results. It's important that we are looking, our ultimatum in quantitative researches, we have framed hypothesis. We are now testing the hypothesis. So we have to see if the answers support your hypothesis or does not support your hypothesis. Are you going to accept or reject your hypothesis? That is where your interpretation of results should represent the hypothesis testing, and same way, describe what does it do with the hypothesis. In the qualitative data, we'll always see, based on the questions, how the researcher has evolved a story about the participant. So thereby, you are trying to answer the question using narrative descriptions. So this narrative descriptions will answer your research questions. And it's very, as I said, bracketing was spoken there, reflectivity was spoken there, triangulation was spoken. I think these are very important tools in qualitative research where a researcher should be using to have more valid information or reliable qualitative information at the end of your study. And next is validating. So validating in quantitative, as we said, you can, the statistician will help you. There are many instruments which are available. You can discuss with the previous findings and see if how your study is going to help that. But in qualitative, we were talking about, should we go back to the participant to go and ask about the story is correct? Yes. You have written a story about a participant. I feel the trustworthiness of the information has to be checked across the family or across the peer group, or along with the teacher, without breaking the confidentiality and the anonymity. But on the other end, once you write the story, it is always good to go back to the participant and ask them, is this what you wanted to actually, is this what you told me? Am I correct? Only then your answers are correct. So this all should be done even before the interpretation of your findings in the qualitative study. So you have to check the accuracy of the information. In mixed method, what we do is that trying to merge these two set of data under aspects of these. So how do we merge? How do we sequentially analyze? So the first thing is doing data reduction. Data reduction. So ONT gives a 7-stage model for what are the steps you can utilize in the mixed method data analysis. The first one is data reduction. So as we said, we have all now by prescription, we have reduced the raw data into a data set for interpretation. That is called as data reduction. In quantitative and qualitative, we have already done. So you have data, which is raw data or raw themes or raw statements of a participant have a comprehensive stories of various participants under different themes. Then you do a data display, which is representing quantitative and qualitative informations, quantitative through your bar graphs and your pie diagrams and your box plots, whatever you may use, you can use that. And data transformation, very important aspect in mixed method data analysis is qualitative results, qualitative informations of the end product of qualitative can also be told as quantitative. Suppose I say 5 participants were there and all five of them express fear. I can quantitatively say that all 5 of them express fear in some form, not only individually. I can also say that. And all of them, their abuse types, you can say it as quantitatively. And who were the people who abused the child, again, you can tell that. And if they're coping, you can quantitatively put in numbers, say 4 out of 5, 3 out of 5. See, sometimes this helps because we want to compare the results of quantitative with qualitative information. So transforming is feasible, but it has to be done. You cannot anyway throw it in percentages. Don't say if it is 4 out of 5, 90% of the participants. Never say that. You have to say 4 out of 5 participants or 3 out of 5 participants. So that way, transformation of qualitative to quantitative information and quantitative to qualitative information. When you identify that the majority of the people with living with HIV, okay, they had this, their CD counts were so much. So how this will have an impact on their quality of life or living? So somewhere you want to associate or relate, you can, wherever. I'm just giving an example. It might, I'm just trying how you can qualify the quantitative information. So transformation is giving quantitative perspective to qualitative results, and giving qualitative transformation to quantitative results. So this is what is data transformation. Next is data correlation. You're saying you're trying to correlate the information between what you have received here and here. Many of them, when we ask them why they feel, though they are willing to quit smoking, or why they, no, we did a research on this TB, same thing in compliance to TB drugs. When we asked them, most of them said that the medicines or capsules were big. Now, this question was not asked when the program regimen came into, where the questions were asked only after we had many resistance TB people who came with a lot of drug resistance. Then they said, no, it's important to go back and ask them why they were not able to. So they have given their own reasons why it was not given. And I am sure all of you would have read the story of how DOTS therapy came in. So the actual story of DOTS therapy was related to that. Going back, asking them, many of them forgot. Many of them said that it was too big and I don't want to take. So all these were led to the development of this program of DOTS in TB, National TB Control Program. So correlation of results, data consolidation, trying to create new variables or consolidated variables for the data sets you have, and comparing data, comparing informations you have received from one to that of the other, and integration. So how you can do the integration? See, intentionally, here we don't do integration just like that. There is a scientific process of how to integrate. So this integration should happen, and it is intentionally happening because in MMR, the researcher wants to see the correlation or the association or the comparison between the informations what we have received in the quantitative and the qualitative. So I will directly go to this approaches for data analysis. Now I am highlighting 3 major approaches, which I think we can use it, which is very easy for even utilizing. Now we have many approaches which has already happened in different steps or in different stages. So first is converging. If you can see the diagram there, what do you interpret from the diagram? What is converging? What does the monograph show there? You have a quantitative result on one end. Yes. On the other end, you have a qualitative. So where are the 2 arrows facing? Where are the 2 arrows facing? Inward, isn't it? It's facing inward, which shows that you're going to merge these data. So it is called as merging analysis in a convergent data. Okay, so you use a merging analysis when you want to use 2 data sets of information, collect, both are done differently, and then you want to integrate. It is called as merging analysis. And second one is connected data. So first you see there is a qual. First I go and identify the experiences or you lived experiences of these children who are living with abuse, or patients who are living with HIV, or patients who are living with terminal illness. Go to them, ask them the story. And then based on that, you want to develop a program. You want to put up a plan of action so that that program will help this child. So we developed something called as a child safety approach program, which we brought in with the support of the community, and we developed that program, which is still in place. So any child who has gone through the abuse has a liberty to come and speak to these group of people who have been trained by the researcher and left in the community. So we have the collected qualitative data. Using that qualitative data, you are trying to approach the quantitative study of the quantitative approach of that study. So that is called as sequential designs. I think sequential designs, which is there, and connecting that data between qualitative and quantitative is called as sequential analysis. So it is called a sequential analysis and embedding data. For example, I'm doing TB research, okay, and I'm assessing the compliance of these people. How, as and when I assess the compliance, I'm also asking certain semi-structured questions and asking why they are not complying. So I'm doing a quantitative study, but in that quantitative study, some piece of information, I want to collect it as qualitative. That is called as an embedded data. This is called as embedded analysis. Again, a merging analysis can be used in this form of data analysis. So now as I go through drop down the transition, I'm sure you'll be able to follow the monograph. But if you, and I'll stop after it completes and you can tell me if you have understood. If not, we'll go back with the assessment. So data collection goes concurrent. You have both qualitative and quantitative info in your hand. So two sets of information. You can see an exclamatory mark. These exclamatory marks shows the importance of an MMR researcher to take key decisions at that point of time. So specify dimensions to compare results. Specify information for comparison in dimension. Refine the qualitative and quantitative analysis. You represent the comparison and interpret how merged results have, answer the qualitative and quantitative and MMR research questions. See now, these are the three important decisions which an MMR, are you able to follow the monograph? Do you want explanation on a monograph? Anyone? Can we go ahead? Yes, see, this is how a convergent design goes. You collect quantitative separately, qualitative separately. Both data are there on the same time to you, and then you merge the data. While you merge, the key decisions as an MMR researcher, you should be able to know is that decide how data sets will be compared. Are you going to merge the data, or you're going to independently analyze and then merge or interpret the results separately? Decide how to represent or present combined analysis. Are you going to use an objective-based discussion with the quantitative and qualitative results, or are you going to have quantitative results first and then you're going to answer with the qualitative results? Decide if future analysis is needed. After you do that, still you feel there are certain areas, still you feel that you are still not able to understand what level of stigma this people with HIV are living with. I think at that point of time, then you have to again decide about future analysis, what it is required. I told you that we can do transformation, quantitative to qualitative, qualitative to quantitative results can be done. So this is an example of the transformation. See, quantitative is there, but you'll also, the next step, the decisions is decide on how to quantify the qualitative data and decide how to qualitatively answer the quantitative information. So what are the statistics you're going to use? The key decisions for as an MMR researcher is what we have to take. So merging data, again, I tell you, it is a risky job, very risky job. You cannot go from here, do data collection and do it. You need some level of training or exposure, or you can work as an, co-researcher in some of the MMR projects by experiential learning. Not mandatorily you have to go only for a training program, because I believe not only training programs will build experiences. You can be a co-researcher in an MMR research driven program, or be in a qualitative separately, be in a quantitative separately. And by that experience, you can be an MMR researcher. So that's about merging. This is an example, a mixed method study of caregiver grief. Used qualitative interviews informed by descriptive phenomenology and quantitative standardized instrument to measure distress and grief while caring for a person with terminal illness and during bereavement. So what they have done here, they have assessed the caregiver grief through qualitative interviews, and they've also assessed using a quantitative tool, a standardized tool. So the two set of information is available, and they'll be that will help us understand the complete caregiver grief of the family. Okay. These are some examples which I leave with you, which you can go through later. So merging can be used for the following purposes, where you are triangulating two set of information you are using, or you have using the data from different methods of data collection or different set of peoples. The child would give you an information, the peer group will give you an information, the family will give you an information. If you want to, correlate these three things, then that time also you can use triangulation and expansion or complementarity. So if you want to give even more better examples or explanations towards your research questions, then you can utilize it. And you want to develop a tool, then you can merge data. Next, the second set which I spoke, one is a convergent, where you have separate quantitative, separate qualitative. But here in the convergent design, you are connecting data. So first you collect quantitative data. For example, I am looking at compliance of TB, patients' compliance towards TB drugs. So I use a standardized tool which has been validated. I check reliability, I do pilot study, do everything, and use the collect the quantitative data. Then I analyze the quantitative data, and I have percentages. And I have also reasons why this percentage of people are not compliant to the drugs. So they give their own reasons based on your standardized tool. Now, you must then decide, once you have that data set in your hand, what is a qualitative stand? What is that you want to ask? You want to explore their experience of being a patient, or who is undergoing this treatment, or the problem of taking these drugs continuously or regularly. Is there a stigma attached to taking these drugs in the family? So you will be asking, what is that qualitative standard which you want to assess? So that is what you'll have to decide. You collect the qualitative data, you analyze qualitative data, and you interpret how the connected data answers the qualitative questions and MMR questions. So the key decision here is decide what participants to follow up with and what results need to be explained. So what you really want to assess in that TB patient, their compliance, or is their their nutritional aspects which they are taking is preventing them, not only the medicines, you also have to have good nutrition. What is that? So that is key decisions have to be made by us. Now, this is an explanatory design where we do quantitative first, followed by qualitative. Any quantitative followed by qualitative is called as explanatory, sequential explanatory design. But if you have one example, you can see, compare two doses of high and low of a nurse-led psychoeducational intervention to assist oncology outpatients to effectively manage their pain. They implemented an RCT study to compare the two treatments in terms of various repeated measures patient outcomes, including pain levels. Within the RCT, they also gathered qualitative data in the form of audio tapes of the intervention sessions, along with the nurse and patient notes, to describe the issues, strategies, and interactions experienced during the intervention. The results provide an evaluation of both the outcome, which is the quantitative, and the process, which is the qualitative aspect of the intervention. Now, can we do MMR studies in nursing at every level, at every component and every emotions of the human being? You can definitely do study in MMR, both qualitative and quantitative, but that should be the felt need of that, and there should be a real problem existing and a real question which has to be answered. Not for the sake of doing, we should do research. Next come exploratory. When I said explanatory, it is explanatory first one is quantitative followed by qualitative. So what should be exploratory be? Qualitative followed by quantitative. In child abuse, we did this. We went to around 7 children with abuse who had very high abuse, who had mild abuse, all these, and who were coped very well, who still had problems in getting over the trauma. So we saw this kind of mixture in our sample, in the information we collected. And some childs we took around 18 interviews. Some children we we were able to finish in 6 interviews. So it only depends on the child, how open they are to come and talk to you. So first collect qualitative data and analyze qualitative data. So you finish your analysis at this point of time, the primary analysis, and decide on what quantitative stand. Do an interventional study to see how, in our study, what we did is we used a guided imagery, we used a peer group cell, and we also used an adult support group there. So these were a form of our intervention by which we did a quantitative study to assess the effectiveness of that process. Then we did a pilot study, we developed a new instrument, we collected the quantitative data, we analyzed the quantitative data, and we interpreted how these answers, what you got from the qualitative and quantitative, will answer the research question which was framed. The key decisions, decide what data can be used in the quantitative follow-up, decide how best the psychometric quality which you are utilizing will assess the actual outcome, and also decide how the quantitative results build or expand on the qualitative findings. So this is key decisions as an MMR researcher we have to take. So one of the examples is Dawson et al. Studied non-abusing drinkers diagnosed with hepatitis C. An initial qualitative component based on the interviews and internet postings described new decision factors related to curtailing the consumption of alcohol. These findings were used to develop new items for a quantitative instrument, which was administered in the second phase to assess the prevalence of new factors and the association with current drinking pattern. So they did a qualitative assessment, assessed based on that, they developed an instrument to assess the current drinking pattern of the people. So that was for the sequential design, explanatory and exploratory. We know explanatory is quan followed by qual, and exploratory is qual followed by quan. Embedded is you have the qual or the quan embedded within the research. So analyze the primary data and set to answer the primary research question, and you analyze qual or quan, whichever you're doing, the major area, what you are doing, and within that, what kind of design you are looking at. And same, you have to interpret. The merging analysis is what we have already spoken. The same philosophy you will apply here. Decide on using what should be used as a secondary data and that data result, and decide when the secondary data should be incorporated into the primary data set. So you're going to use the quan results to explain quan or quan results to explain the qual. These has to be decided by the MMR researcher. An example is a collection of supplemental qualitative data about how participants are experiencing the intervention during an experimental trial. Alternatively, a qualitative data collection may precede an experimental trial to inform development of procedures or follow an experimental trial to help explain the results of a trial. So we did a qualitative study on why women are not coming for cervical cancer screening. Because we had so much of funds, we developed a program plan, and when we were there with so many people for the camp, hardly 3 or 5 turned for the camp. We were totally devastated because so much of resources were pooled in. So we said, before assessing what it is, we are not going to conduct another camp. So the first thing we did is we did a qualitative study where we assessed the factors which were influencing or which were for people who came for the screening, what brought them for the screening, and for people who feared to come for the screening, what made them not to come for the screening. So we had a qualitative information. Then we put in a program plan and action called the peer, protector, and professional model. Peer is a person who already underwent the cancer screening. Protector is the village leader or the self-help group women member. And the professional is the OBG department of Homeopathic College of Nursing. So after the qualitative results, we identified what factors actually had a problem. So we handled them using the peer and the protector. Only when they are handled by the peer and protector, then we brought them to the professional for the screening. So now at any point of time, we have 60 to 65 people who come for cervical cancer screening. A real model which is in working, and we feel that if we want to go to the community, we should know what they want to, and then based on that, we have to do the assessment. So that's about a qual research, and then followed by the quantitative research. You can also do multiphasic or multi-method component. So this is again, it employs a strategy somewhere like the embedded component. We must know where the combination of analysis has to happen and which place. That is the multiphasic, or you use multiple methods to collect data. Again, transformative design, as I told you earlier, what quantitative, if you're using, how to transform to qualitative results. So it is called as a transformative design. These are new designs which have come in scope, which you can also read aloud. But the three important, which I've already mentioned to you, is the convergent and the sequential, as well as the embedded designs. So design-based analysis is important. Next, final is the interpretation. Now, all of us are very good when we see the tables, bar diagrams, and the pie diagrams. We say this percentage of people had pain and this percentage of people have moderate pain. How many of you have done real interpretation? Seeing the table, writing the description is not interpretation. Is that interpretation? Most of the PG researchers carry interpretations like that. Though we give them a lot of advices, only at the last minute we are able to modify, because they come to us at the last minute with the data information. But please understand, interpretation is not describing the data in your table. Interpretation is using your own, you have done a lot of literature review, you have seen them you have done the interviews, so you know how to do the interpretation. For example, I see an association. 18 to 20 age children had more compliance, if I say. Why they had the compliance to accept your advices than a 20 to 24-year-old child? If you're trying to say something like that, your interpretations and your discussion should come there by previous reviews or by your own experiences. So that way, interpretations are important. You have data sets, everything is in numbers or in words, but you must be critical thinkers. I know it will take a lot of experience and time to write it, but we must learn the actual act of writing interpretations, not just discussion. So strategies which I think has been discussed is reflexivity. Negative case sampling is if you are identifying a case which is it's beyond your expectation, you have a separate result. For example, you know this program worked well, but still people did not show much change in their attitude. Now that is a big thing which you want to study. So you can go back and do an analysis based using a different tools. So yes, I've got 5 minutes more. I think I should be able to finish. So validation, we have spoken much. So the take-home message for you is, if this is the design, the convergent, then you merge analysis. If you have explanatory design, you have sequential analysis. If you have an exploratory design, you have a sequential analysis again. If it's an embedded design, you can either merge or use a sequential analysis. If it's a transformative design or a multiphasic design, again, you can use a merging or a sequential analysis. Now, you just remember the monograph which was shown. Anyway, this PPT will be shared to you. It's available for you to utilize. So learn it from there. Books give better understanding, better examples. Please read. You need to read. There are a lot of studies which has been done and published in journals. Nursing personnel have published many journals. Papers on MMR. I think you have to read. When you keep reading, I think that's where you gain more experience. So thank you for the opportunity, and thank you all.
Thank you, madam, for the insightful presentation. Being a healthcare provider, as nurses, we will get a lot of opportunity to take up mixed method studies. Being in ethics committee, I got an opportunity to evaluate many mixed method protocols. So when we receive the protocols, so many researchers forget to write mixing objectives or the type of mixed method design or how they are going to analyze the data. So we are forced to send back for the modification. So this particular session will be an insight for all of us on how to use different methods to integrate quantitative and qualitative results. So I would like to take up few questions from the audience, maybe one or two questions.
Madam, there is one question from online audience.
Yeah.
Softwares for MMR analysis.
Now you have to utilize, you have this Maxter, you have NVivo. So I think the MMR analysis, you use quantitative, qualitative, two different sets of softwares and then merge the results. That should come from the researcher.
Okay, ma'am.
Yes,
Yes.
thank you very much, madam, for the very detailed presentation. Just a question from the other side of being as a review editor for journal. So there are a couple of papers that come with the mixed methods research, right? Most of the researchers prefer to publish them separately, either qualitative or quantitative. I don't know, mixed methods. Well, I know there's a next presentation that
Yeah.
will talk in detail about the presentations, but even in the protocol itself, when you're planning the mixed methods research, I think this is important to explain why you have use a sequential design or exploratory design.
Yes.
So thank you for highlighting this. And I think this is something, a very big take-home message from this presentation to people who are conducting mixed methods research is to highlight and know yourself why you're doing a mixed methods research. So I think I just want to just highlight this point here. And even if you're submitting in journals or whatever, the first explanation is why you are conducting this particular type of research. So yeah, just highlighting this. Thank you very much.
Thank you. As I said, exactly, don't do a research because you want to use an MMR or you want to use a qualitative. Identify the design based on the question you are trying to answer or the phenomena you are trying to answer. That's important as a researcher. Anything?
Any queries from audience? So far, no other queries from online audience, ma'am.
I now request the chairperson, Dr. Binil, to hand over the certificate to the resource person, Dr. Kanchana S. Thank you, sir. I request the moderator, Mrs. Benazira, to hand over a certificate to the chairperson, Dr. Binil. Thank you, ma'am. I request Mr. Melvin, Assistant Professor, Department of Yenepoya Nursing College, to hand over a certificate to the moderator, Mrs. Benazira.
Thank you, sir. We'll move on to the next session on crafting comprehensive reports for mixed method research. For this, I invite Mrs. Vijay Prasad, Moderator, Associate Professor, Department of Mental Health Nursing, to escort the resource person, Dr. Vatsala Sadan, and Chairperson, Dr. Meera Achrekar, to the dais. Over to you, ma'am.
Thank you, Pavitra. Happy morning to you all. It is my great pleasure to introduce our chairperson for this session, Dr. Meera Achrekar, who is a highly accomplished nursing professional with over 34 years of experience. Currently serving as the nursing superintendent at ACT RIC Tata Memorial Center and a professor at Homi Bhabha National Institute, Mumbai. Her extensive involvement in various leadership roles, including positions at NABH, TNAI, and academic boards, underscores her commitment to the nursing profession. Dr. Achrekar holds a PhD in clinical communication skills and has a strong research focus on quality improvement in cancer care nursing. Over to you.
Thank you, Ms. Viji. Thank you, Ms. Viji, for the introduction. Hello, everyone, and a warm good afternoon to each one of you. I would like to quote Albert Sent, who said, "Research is seeing what everybody else has seen and thinking what nobody else has thought." So once you have thought about it, and then the next step comes in after you have finished all what topics that we have taken today, our topic for the next session is very apt. That is crafting comprehensive research report for mixed method research studies. I feel incredibly privileged and thrilled to have the opportunity to introduce the resource person for the session, Dr. Vatsala Sadan, who was the professor and HOD of the Department of Community Health Nursing and also former dean at College of Nursing, CMC Vellore. Madam holds a PhD degree in nursing and has worked in various capacities from staff nurse to professor. During her tenure in CMC, she has been the guide for PG and PhD students. Madam has also been the faculty and HOD, Department of Community and Mental Health at Sultanate Qaboos University, Sultanate of Oman. Madam has served as an examiner in India and abroad and has memberships with many professional bodies, is member of Inspection Committee, member of Doctoral Advisory Committee of Kerala University and JIPMER, Pondicherry, member of Board of Studies and editor to various journals. Madam has presented papers at national and international levels and has 5 books and more than 35 journal publications to her credit. Madam has also organized workshops and conferences and initiated 13 short-term courses. It was truly a challenge for me to concise ma'am's vast experience in this short time. I welcome you, ma'am, and hand over the session to you.
I can use it. I know this I can't. I will use this. This, huh? Back. Once more. This is front, this is back.
Good afternoon, everyone. Thank you, Dr. Meera, for the good words you said about me. And it's my pleasant privilege to be part of this international conference on mixed methods research. And I thank Dr. Leena and her team for inviting me to speak during this conference. And I really thank God for, in spite of all the challenges, you were able to make it without any problem. I should give a round of applause because I was admiring the way your team was working from the time the conference was initiated, from the time I was invited. I had very good communication regarding, different logistics which you have planned, and everything was going smoothly. And I'm thankful for the hospitality provided by the institution. We are already late. So because it was said 1.5 hours, my preparation was based on that, time. But however, some I might skip and then insist only on important things. So the presentation outline goes like this. I will be talking about the characteristics of good research report, general guidelines for writing good research report, and what are the best practices for writing MMR report, and what are the components of MMR report, and writing MMR reports for publication, for manuscript writing and article publication, and what are the challenges of writing mixed methods research report, and also some of the guidelines and tips how to write MMR research studies. The outline goes like this. And to introduce the topic, all of us know this is the last step, but it is again very important. We do research, but unless we communicate to the audience or to our professionals, it is of no use. At least now institutions and the universities have made it, and the examining bodies have made it that compulsory that the students need to publish before they have their viva for the PhD program, and even for faculty promotion, it is mandatory. So communicating research findings is very important, though it is the last step. And good reporting is again not just communicating and writing reports. Good reporting is again very important, which will tell or assess the quality of your research. And it involves a report and disseminating the report, not just writing, and you need to pass on. And this dissemination can take place either through presentation or through publications, either orally or as a written report. Presentations like this we have in the conference, scientific forums. And the advantages of research report is you get personal recognition, and you grow professionally, and it promotes critique and replication. As we were going through many of the studies, we were also talking about many flaws, or what are the good benefits of doing this MMR research. So we are able to critique, and then we can do similar studies. Dr. Kanchana gave so many examples. Many of them, the audience may be thinking that we could also replicate such studies in your own areas, which is culture specific. So it promotes replication of studies, and it identifies an additional research problem from your experience. You will further explore what more I can do. And it also adds evidence to our discipline of nursing science. And ultimately, whatever nursing research we do, it promotes the it improves the patient's outcome, whether it is education or nursing administration, management, or in the clinical practice. So these are advantages. So writing research report is very important. So I am skipping this. Written reports are mainly for academic purpose. PhD and MSc students write thesis and dissertation. Not only that, when you say you have to write a written report, not for academic program alone, but also for the funding agencies, we need to submit a report. Nowadays, many of the IRBs, Institutional Review Board, also ask us to submit a report. So it's a requirement, and it has its own advantages. When you publish in scientific journals, you will have worldwide audience of readers, and that is permanent in nature. Yesterday, many of the experts were presenting by systematic reviews. These many studies were done. Those are the studies done in different parts of the world. So it is available, permanent in nature, which through systematic review, you get to know more about or explore more about that problem. And the disadvantage is preparation and writing the research report is very difficult. Most of us here seated here would have found it very difficult, and because it takes time, and even publication, many times we send, and when we get it is rejected, we are upset. But if you write it, a good report is written, then you will not have problem, but it is worth that you prepare properly and publish. And there are some general characteristics for good research report. One is, everybody was talking yesterday, it has to be concise. You will have lot of wealth of data and information coming up from MMR. But what has to come in the report is very important. So when I say conciseness, you have to keep one thing in mind, that whatever you put in your paper, whether it addresses your research objectives or your research questions, that is very important. And next one is honesty, or your transparency. Yesterday, Dr. Vishnu was talking about transparency, which is one of the very important characteristics of MMR. And it has to be complete. Sometimes we find that when we edit or when we read the thesis, we find some of the information are missing. So you have to write complete report. And yesterday, Dr. Sushma also presented what are there's a checklist, what all should be there in your report, and accurate. There should not be any errors in your reporting. And the very important thing is for the readers, it has to be clear. So clarity is very important. So keep these 5 important characteristics in your mind to write a good research report. So ultimately, the principle is keep it simple, and it has to be concise, objective, it has to be straightforward, and the organization of your content is also very important. There should be a logical sequence in your way of writing and presentation of the report, either for the thesis or for the scientific article. And there are other few guidelines I'll quickly run through. I have highlighted the important points. Always avoid highly technical terms. As I said, it has to be simple, and complex sentences need not be there because it doesn't actually bring out the best way of conveying your ideas, what you want to give to your audience. And the style, again, the same thing, concise and straightforward, and grammatical spelling should be avoided. And next thing is, in quantitative research, when you present in the MMR report, try and avoid personal nouns like I, me, my, and we, like that. And always it has to be in passive voice, and impersonal nouns suggest impartiality. And as I mentioned, sequential organization should be there, and continuity. When you read, there should be a continuity and logical thematic development. And methods and discussion should be described in the past sentence, and results should be described in the present tense. And reference styles, of course, we have different reference styles based on the university requirement or the journal to which you are submitting your article. Based on their guidelines, you will follow the reference styles. And I have put in 2. One is the thesis. Thesis research report is in-depth, and the number of pages also are given nowadays as a guideline. And it is a lengthy document, and each section in the research report for thesis writing is important. And it actually ultimately demonstrates researchers' understanding of research problem and the process. And in the journal article, it is actually the short version and of reporting or communicating to the nurses and the health professionals. And here it is more diverted to results and discussion. In reporting MMR studies again to journals, results and discussions are very important. And they also have page limits, number of pages are limited. And usually the students or the scholars ask how many pages. Some of the, journals as part of requirement they give. And commonly Pollitt says 10 to 25, and Overman says 15 to 20, and each one has their own. And again, it depends on what type of research you have done and what type of information you are trying to communicate. And you follow the manuscript submission guidelines as per the journal requirement. So when you report mixed method research, actually it is a complex phenomena. Many of the PhD scholars come to and ask what to put in the results, how to write the discussion. That is actually a blind area. Yesterday, Dr. Vishnu was saying, you read more and more of mixed method research articles, then you get an idea. And Dr. Kanchana also said, not just attending training programs, you have to actually do it. Then only you can learn. So same way, writing research report also, MMR especially, you have to write, then only you will, you can, sorry, where did I do? Here in reporting mixed method research, you have to pay close attention to methods, results, and discussion. These are very important sections, which are vital. And effective reporting is very crucial. We also face a lot of challenges. And however, many of our experts in qualitative research, the qualitative and quantitative research, and the experts in MMR have drafted some guidelines how to write the MMR reports. And these are some of the challenges. So when you say mixed method research, we had Dr. Subha speaking. So, the sociologists, psychologists, even engineers, they do mixed methods research. We had recently in CMC Vellore, somebody came, said that during the summer, they wanted to devise something from VIT. shopkeepers are on the road. So they wanted to have some environmental protection for them. So they wanted to have a device and they wanted, CMC to be part of it. To help in the environmental measures and to interview the patients who come to the emergency department with heat stroke. So many of the other disciplines also do mixed method research, and we have readers from all disciplines, not only health disciplines. So you have a varied audience. So writing is a challenge, and language and style. Again, many of the articles, when you look at it, is in different languages, mixed method research. Some have translations like Spanish and different languages. So your language and style, writing style matters. And those who are doing mixed method research and writing the report should have adequate knowledge about all the research methodologies, because you're mixing both quantitative and qualitative. You have to be confident in all the research methodologies. Within qualitative itself, Dr. Kanchana was highlighting the different, designs. So you have to be confident. Maybe you may have to go through or go for a training and get yourself, become knowledgeable. And formatting, again, formatting and writing, even a single quantitative research report is, many of us find it very difficult. When it comes with a comments, so we are disappointed. I know one of our audience or expert is an editor. And the previous moderator also said what they look for, and they send back with questions. So formatting is very important. That's again a challenge. And publishing outlets, finding out which journal you have to publish is again a big challenge. And for mixed method research, there are 3 important criteria. Initially, I mentioned the characteristics of a good report. Here it is specific for the MMR. So clarity, transparency, and replicability. And it is almost similar to what yesterday Dr. Vishnu was saying about the train crossing, and 3 important things he said: transparency, and what are the other 2? 2 more, important things he highlighted. So one is the clarity and the transparency and replicability. And I will not take much time. The overall research report writing for dissertation or any, research work for the academic purpose, we follow this format, IMRED format: introduction, methods, results, and discussion of findings. So most of you who are doing MMR studies for your academic purpose, you will follow this format, because university also expects this. There are other sections in writing research reports like title, abstract, keywords. And yesterday, Dr. Vishnu also mentioned about the abstract. He showed some examples, so I'm not repeating it. And the reference styles also, he highlighted the different reference styles, and the acknowledgements and the appendices I will briefly discuss later. So as he mentioned also yesterday, the word mixed method should be there in the title. And create a neutral title words that do not tip into qual or quan approach. So the tip the words, if the design calls for a strong priority for either of that, then you can have that in your title. Otherwise, it should not, it should be a neutral title. However, make sure that the mixed methods is mentioned there. See here, parental perception of physical activity and quality of life of children under home lockdown in the COVID-19 pandemic, a mixed method study. So this is how you can write, and it has to be short again. And abstract, when you write, 2 important things are very important. Apart from the way usually we write the abstracts, in MMR, the type of mixed method design and the integration approach used should be there in your abstract. And the 4 questions should be addressed when you write any research report. One is, what was the study? Why was the study done? And how was the study done? And what was learned? And what does it? Was the study is very important. Justification and your rationale, especially for MMR, and how you have done, because you have 2 different approaches, and again you are integrating. So how it was done has to be very clearly written in your report. And what have you learned is the results, and then what it means to you, not just the percentage or whatever themes have come out of your qualitative study, and for by mixing what you have got it. What it means to you in terms of your research objectives or your questions. So that is very important. So when you write the introduction, it is the research problem and the background and the significance and the need and the context in which it was developed. And it actually sets the stage. The reader, when they read, it actually sets the stage, describing the existing literature and also the existing framework available. And then it also includes the research purpose, objectives, and hypothesis, if applicable for quantitative study. So the research scholars, the students, you need to write all these in detail in the introduction. And of course, some universities have their own guidelines, operational definition, very briefly in your study, what it means to you by this different concept, for this different concepts. And again, it should not be lengthy. It has to be very concise, meaningful. That is very important. What you're trying to measure and what you're looking for should be there when you operationally define your concepts. And always we say the introduction chapter has to be in the funnel shaped structure. You have to start from broad to specific. And end point of the introduction should be concise and delineating the research question. Why? Why you want to do the study. That has to be there. So in mixed method research, as one of the experts also said, we have to clearly say what MMR design you have used, and it has to be clear and consistent. And purpose, priority, and the timing at which follows what are concurrent, those has to be clearly written, where you integrated qual and its components. And also explain the rationale repeatedly. Whatever article you read about publishing mixed methods research, everyone says justification or rationale has to be there, why you are using this. And discuss how it addresses your research question and objectives when you write your rationale. And it also helps the readers to understand the scope, structure, and the validity of your MMR findings. And coming to the statement of the problem, it has to be clearly stated. As I said, the reason for using also should be explained. Two important points which I have highlighted. It has to be an appropriate one to, MMR has to be an appropriate one to address the research problem. And again, and how it necessitates both why qualitative and quantitative methods to be used in this study. So that has to be there, appropriateness and the necessity to use the problem. And when you write the purpose statement, you have to use script, general intent why you want to do, and then come down to quant and qual purpose and data collection analysis and specific reason. Dr. Kanchana also was saying specific reason for mixing and how mixing occurred in the study. That has to be then in your purpose statement. When you write research questions, you have to have quantitative questions, you have to have qualitative questions, and you need to have mixed method question. These are all in the protocol. Actually, yesterday, Dr. Vishnu addressed this when he said how to draft a protocol. So he said planning, and I'm saying after implementation, what to be written there. So it has to be there, question has to be there. And present the questions, it can be either in the terms of hypothesis or as question, and explain how these questions are interrelated. That is very important in MMR. And research objectives, when you write, there are types of objectives. Again, qualitative, quantitative, and mixed methods. And again, here you have to describe the way the approaches to inquiry were combined. That is important. One example I have given for problem statement. This study investigates the impact of social media on academic performance using a mixed method approach to capture both the qualitative measures of performance, academic performance of students, and it also gives the qualitative insights into students' experiences. This is how the problem statement is written. When you write the purpose statement or the aims, digital learning tools have revolutionized education, offering new ways to engage students. Despite the widespread of adoption of these technologies, their impact on student engagement requires further investigation. You see there, the purpose is come there, addressing the gap. The study aims to fill this gap by employing a mixed method research approach to provide a comprehensive understanding of how digital learning tools influence student engagement. So this is how the qualitative study brings in. So this is how we state the purpose statement in the MMR. And literature review, I'm not going in detail. You have to highlight the gaps or the deficiencies and how it clarifies your study or the contribution of the new study. And when we evaluate for, thesis work, we also look at this. There is a weightage for literature review. So we, as evaluators, we will give marks reading this, which will tell you the researcher's knowledge about the research problem. And it has to be literature, review has to be very concise to journal articles. And see, one example I have given here, when you end the literature review, when you say there is a gap identified, previous research studies have highlighted the potential for social media to both distract from and enhance academic performance, but gaps remain in understanding these effects comprehensively. That is the gap they have identified. And again, as part of your requirement, you need to have a theoretical framework for quantitative, definitely. And that has to be there. I'm not going into detail. Only thing is you need to understand and link to the research problem and identify the major concepts and the relationships. Many a time when we read the thesis, we find that it is taken as it is from there and just presented. It should not be. It has to be adopted or customized to your study. The study variables should be reflected there, and your research design should be reflected there, and also your population should be reflected there. If you're doing interventional study, all those groups, everything, looking at the framework, you should be able to say what is your research about. No, so like that, you need to develop a map or a model can be developed. So with that, we finish the introduction section. Now we come to the method section. Here we write how the study was conducted in a narrative structure. As I mentioned, it has to be written in the past tense. And you have to write the research methods, detailed ones for the dissertation and a concise one for the scientific papers. And these are the other subsections of the research report under the methods section. Research design, population, sample, setting, data collection instruments, what you have used, the process, and the pilot study, what you have done, and the data analysis. And also you need to include the ethical consideration. I'm not going in again to detail, but make sure that all these are addressed in your ethical consideration. Yesterday, Dr. Sushma has spoken in detail, but these are the very important points which you have to remember when you think of ethical consideration for the MMR. And there are two phases. Some say you should not use the term phase. And some studies say study 1 and study 2. There are still conflicts going on. But most of the studies, they write each phase within the study of quantitative or qualitative. So the phase, when you use different steps or different phases, you need to sequence it and how the phases are integrated, how they inform each other. That is very important when you describe your different study 1, study 2, or phase 1 or phase 2. And type of mixed method design in the method section, you have to clearly write convergent, parallel, or explanatory, or embedded. That has to be clearly mentioned there. And provide a rationale. Again, everywhere it is repeated in the literature. And we saw many visual way of showing the research design. It's all available. So make sure that a diagram is used, visual diagram is used to illustrate your design that actually captures the readers quickly. And this one example I have given, if you have used convergent parallel design, assessment of lived experiences of patients suffering from HIV by using phenomenological design. And this is one way of depicting using a diagram. And assessment of quality of life, health status, treatment seeking behavior, that's a quantitative component. That was a descriptive cross-sectional design. So how the results are obtained and it is merged, and then how the interpretation and explaining convergence or divergence. I'll talk about it in the later slides. And so how can you say your methods, the designs are very well written in your research report? When you read, if you are able to identify the type of design and the design is explained either in the narrative form or a diagrammatic way of depicting, visual diagram, then it is a plus point, good. And then quant and qual methods has to have detailed description of separate quant and separate qual methods, and what you have used and how you have done the recruitment procedure for the study subjects for qualitative and sample selection for quantitative. How did you calculate the sample size? In your thesis work, you have to write everything. In your journal, you need to have, you can have, few sentences. But the important points, whatever I have put in there, should be there in your design. Then you can say that it is a well-written design. And again, if in the quantitative study, if you have used instruments, reliability and validity, the psychometric properties should be given. If it is standardized, you give those. If you have developed and validated, you give those properties, psychometric properties, that is the validity and reliability. Then the type of data analysis. Yesterday also somebody was mentioning, don't write just descriptive and inferential. You need to write for this, address this research problem. What is the data analysis, technique you followed? That has to be clearly written. To which objective that particular data analysis written. And usually the design, as I mentioned, it is better that you have a diagrammatic way of showing your design. And this is, all of you know, actually the inclusion and exclusion criteria. In MMR, you need to have separately inclusion, exclusion criteria written for the quantitative and then the qualitative. And again, for the sample selection and the rationale. In quantitative, you need to use the power analysis. And then if divided into, if it is an interventional study or RCT, you need to have experimental and control. And there you need to write the method of assigning the participants or study subjects into both the groups and state which randomization you used. And when you write in the journal and again in the thesis, you need to give information about the response rates or the attrition rate. And also briefly the study setting. In the journal, it is very brief, but in the thesis, you need to describe properly. So in qual and quant, nowadays we don't use samples, we say study participants. And you have to describe this, all these, as I mentioned in the previous slide. And participant selection again to be given clearly for quantitative and qualitative in separate sections. And your recruitment strategy for both is very important. And whatever order of sections to the procedures used in MMR also should be there. And when it comes to description of data collection, you need to write the method of measurement. And it again depends on the variable, you are measuring. And explain the study instruments developed by you or by so-and-so and which year it was and what are the scales. I'll give you one example. And also, as I mentioned, the psychometric properties. So data collection instrument, when you write, you have to, if you have developed, you have to write how you developed. So as part of the MMR, sometimes we do a qualitative study. From that, we develop a tool and then we use it for the quantitative. So that has to be clearly written, whether you have done any pre-testing, any revisions done, how did you develop your scoring procedures and based on any, previous literature, all that guidelines, whatever you have used for interpretation has to be there. And then if an existing one is adopted, then you have to write clearly. If you are using you have developed a new equipment and you are using, give a brief description of the many comfort measures some of our nurses have innovated. So that has to be clearly written how it was developed. This is one example, the sickness impact profile used to measure quality of people living with HIV. The SIP consists of these many items and 12 subscales and how it measures behavior related to sickness. And the subject checks off phrases under each category. And then the next paragraph says how it is assigned to each item and how the score is given and how it is interpreted. So when you develop or when some other scale you use in the quantitative data, you need to specify this as part of data collection instruments. And the data collection process, again, who collected the data? Do they have experience? That's why I said when you do qualitative research, you need to have experience. As Dr. Kanchana suggested, you be part of as a co-investigator, so you learn and then you become confident. You attend training programs. Sometimes interventional study, you administer the intervention. So you have especially counseling. All of us are very good. So you need to have a training and counseling. And some of this, many nurses do acupuncture and alternative therapies. So you need to be an expert. So you learn, get it trained, and then do it. So that has to be mentioned there in your report. That has an additional weightage. And if more than one data collector you are involving in your study, you need to do the consistency, check the consistency by doing inter-rater reliability. And if you are interviewing who conducted, usually these information are missed in the dissertation, or when they present for Viva. These are all very important. Who conducted, where it was conducted, how long the time it took, and the experience and the training of the researcher. And the process in an observational study, the role of the observer has to be written, and the question as used and how it was delivered, self-administered or, it was a semi-interview. That process has to be written where follow-up process. Sometimes we provide the intervention and we make phone calls, or we communicate through, phone, or we post some messages. So that whether that also has to be written, any follow-up was done. In an interventional study, especially in quantitative study, detailed information of the intervention, what you are administering, how and by whom was the treatment and intervention administered, what type of special training was required for that, what was done with the subjects in the control group. That's again very important ethical point of view, whether for the control group the intervention was given or standard care was given. How much time? There are many time dimensional studies between intervention and the post-assessment. So how much time elapsed between the intervention and the measurement of the dependent variable, and what are the measures taken to protect the human rights. And data analysis, Dr. Kanchana has detailed about all that, but how to put that in your research report is very important. Many times the students and the researchers are confused in MMR, what to put the analysis, what to put in your report about the analysis and the findings. So here, I have given some points. Devote separate sections to the qualitative analysis and quantitative data analysis and the mixed method analysis. You have to have in the findings separate sections. And this mixed methods analysis consists of ways of mixing. When you have integrated according to the type of methods design you have used, then you can decide how we can show your data analysis and the report. And integration of data, how the data are combined, compared or contrasted to produce comprehensive, coherent answer to the research question. So there are different types of data. So we have to have a balance of data types. So balancing, demonstrates the value and the credibility of your MMR. Avoid overemphasizing or underrepresenting either of quantitative or qualitative data. As the previous speaker spoke, because I'm an expert in quantitative research, I might, give more importance to quantitative. So it should not be there. You should avoid overemphasizing or underrepresenting either of this qualitative or quantitative. Present both with equal depth, detail, as well as with rigor, and show how they complement, corroborate, or contradict each other, and also acknowledge it. In mixed method research, there are a lot of challenges we face as you do. So what are the strengths and what are the limitations has to be addressed, which is an added weightage, is for your mixed method research when you address that in your research report. Many say that, most of the scholars or the researchers, faculty research, whatever challenges they face, they don't put it there. When we ask only, many things will come. You have to put, because that will add on value to your study. And elements of well-written mixed methods results now. We finished with data analysis, and now the results section. Report quant and qual results separately or concurrently. Both ways you can write, depending on the research problem and the design what you have used. And make sure the results are consistent with the flow, the flow of design and the priority. You need to prioritize which one. We know from the design itself which one is priority and which one should come first. Organized to reflect the type of design used in the study. And always it is good that you use figures, tables, and matrices to summarize. And again, methodology can be written like algorithms, methods, as well as a flow chart, that is more good for the readers. And we use joint display of qualitative, not only separately qualitative and quantitative. There are some studies which use the joint display of qualitative and quantitative depending on the design what you are using. So quantitative result findings, appropriate tables and findings, this is all the routine. You have to mention the significant levels, and significant patterns and relations should be highlighted. And also you have to, in this example, the study results indicated a positive correlation, and they've given the R value and this between the use of digital learning tools and the student engagement levels. And also students who frequently use digital tools reported higher engagement. That's a outcome findings which has come. And qualitative findings, present the qualitative findings using themes, quotes, narratives to illustrate the key points. Dr. Kanchana mentioned about each design and said what should be there as the key points, and include visual aids and discuss the context and nuances captured by the qualitative data. And qualitative findings, one example is in this particular study, they have they have come up with 3 important main themes: interactivity, accessibility, and personalization. So the students appreciated the interactive features like quizzes, discussion forums that made learning more engaged. And then accessibility, this is digital tools are available in their hands. So anytime they can access and allow for flexibility, for learning schedules. And personalization, tools that offered personalized learning paths were particularly effective in maintaining student interest. So these came out from this study as qualitative finding. And you need to synthesize these qualitative and quantitative findings, showing how they complement and contradict each other. And so it is like when you integrate, it is a more comprehensive understanding of addressing your research question. So this I'm not going into detail. And now, elements of discussion. As I said, in MMR, when you report, results and discussion sections are very important. So when you write the discussion section, you need to see, like, before the research, the previous studies, existing literature, now says like this, like this. Now this study has brought out like this, like that, it has to be written. And reports general quant and qual results for the study. Usually discussions mirrors the flow. There should be again a flow. Limitation should be there mentioned in the discussion session, and also talk about how the study adds to the new mixed methods literature and open ups for the future lines. And when you write discussion, there are certain key points. You emphasize on the consistency and the similarity which you have found, comparing with the existing or the literature, the studies which are done already. So emphasize how qualitative and quantitative data reinforce each other, revealing different dimensions of understanding. It is nothing but agreement between 2 sets of findings, your finding and the existing findings. Example, in the patient experiences theme, how quantitative satisfaction scores. Now you have a score for the satisfaction aligned with the patient's narrative. Say one example is expansion occurs when some findings overlap. No, that is one point. Okay, so in patient experiences, the quantitative satisfaction scores come and the patient also narrates. That's a slide, next slide, which talks about it. The next key point is expansion. Sometimes expansion occurs when some findings overlap, but also provide space for further interpretation. Some will be the same, similar, and sometimes it overlaps. And the next thing is divergence and difference. How qual and quant together offer insights that would not be possible from separate analysis. So there will be conflicts. There will be conflicting interpretations. Your study says something, but the existing literature is different. So and so study said like this. So here the example is in the patient experience theme, quantitative data revealed high satisfaction scores, but qualitative data shows some patients are still unhappy due to long wait times. So it supplements or complements, comprehensively adds, evidence to address the problem of patients' experience who are taking treatment for a particular disease. So this is how when you write the discussion, you have to have these points: consistency and similarity, where there is agreement between 2 sets of findings; expansion when there is an overlap; and divergence and differences when there is conflicting interpretation. So when you write, you need to write like this in your discussion. And at the integration, at the reporting level through narration, there are 3 types. One is weaving. Weaving involves writing both qualitative and quantitative findings together on a theme by theme basis or concept by concept basis. So when you write integration part, you can use this type. Or contiguous, where the presentation of findings is within the single report, but the qualitative and the quantitative findings are reported in different sections. Findings are reported in different sections, but in the discussion, it is in one, that is contiguous. Simultaneously you present. We call it as joint display. And staged is researchers describe the qualitative and the quantitative findings in series of reports. One report will be on qualitative, other one will be quantitative, another one may be with integration. So it is staged, way of reporting. And one another example is integrating these findings suggests while social media can negatively impact academic performance, its role is complex and influenced by how students manage their time and focus. This is what our students also say. And the quantitative data revealed a significant negative correlation between social media usage and the academic performance. You see the divergence. And qualitative data uncovered the themes of distraction and time management challenges. So this is how we write the discussion part, when you have the MMR. And there are some ideal structures of different designs suggested by John Creswell, who's an expert in MMR. And as I said, the discussion section and the result section are important. So for intervention design, this recommendation is a guideline or the ideal structure recommended by him is quantitative outcome first and then the qualitative results as they relate to the use of qualitative data in the intervention experiment. Here you can write a joint display. You can, write together. I'll show you an example in the next slide. And then the discussion section, when you write it for intervention design, when it is used in MMR, you can present the quantitative results and then how the qualitative results add to the intervention. As I told you, you might develop an intervention after doing a quantitative study. So you have to present that way. Then the ideal structure for a convergent design by Creswell is result section, separate quantitative results and separate qualitative results. And again, integrative results can be joint display. And in the discussion, it can be a summary of quantitative results, qualitative results, and then integration results. And sometimes it is simultaneously discussed and it can be joint display also for convergent design. And this is one example where the way of, this is a big table. In the presentation, you can have in the results section, self-treatment and avoidance of medical care is a theme developed as part of qualitative research. And the quotes were, no over-the-counter medicines and hormones are bought. And when you say quantitative findings, they have found the attitude in going to a daughter. This is the study among the transgender women. And going to the doctor was poor. That is given in terms of percentage, moderate and good. And the qualitative findings is, I am on hormone therapy. The exact narration is given. I am buying and eating by myself. I am doing that because I don't have the money to go to the big hospital for treatment. If there is anything necessary, it is customary to go to the medical store and buy medicine. I try to treat myself. This is one person's qualitative narration. And then when you joint display or when you interpret the meta inferences and interpretation, I mentioned some important points, the properties, areas of convergence between two phases. 45% have poor attitude in going to a doctor for any treatment, but most of the transgender women were reluctant to approach the doctors to go to the PHC. And in the areas of expansion where survey findings help to expand qualitative resources. And the majority, 81% of them have moderate poor perception related to health worries, which is making them to get even more hormone therapy over the counter despite financial constraints. So this is how you put together and you make it as a joint display. And this is ideal structure for exploratory sequential design. Result section, you present first the because it's an exploratory sequential design, qualitative results, and then the quantitative results where you have to definitely clearly mention about the instruments used and the intervention developed and quantitative test of the instrument or the intervention. And here in the discussion section, you can have the summary of qualitative results, quantitative test of instrument and intervention, and how this new instrument or intervention improved the understanding or generalized the qualitative results. That has to be written in the section, this discussion section. If you have used explanatory sequential design, result section should first say the quantitative results, then the results to follow up, then the qualitative results, and how qualitative results help to explain quantitative results. When you write the discussion section, it has to be a summary of first the quantitative results, then the results, whatever you have followed up, then the qualitative results, then how the qualitative results help to explain the quantitative results. So this is how the structure for writing your results and section discussion section for that design. And now the next one is the implication of the study in your thesis or in your manuscript, you have to explain theoretical, practical, as well as the policy implications. Theoretical is nothing but what it adds to your education or management, or practical is for the nursing practice, as well as for the policy implications at the higher level of the integrated findings. So these three words are very important when you write the implications of your MMR. For the same study, what I gave as example, for educators, the study suggests incorporating interactive, accessible, and personalized digital tools to boost student engagement. That is for the educators, the implication. Policymakers should consider supporting the development and integration of such technologies in educational curricula. That is for the people who are making the policies or developing the curriculum. That is how you need to write your implications. When you write the conclusion of your research report, some key findings, the main findings should be there, and emphasize the added value of integrating both methods in addressing your research problem, and the final thoughts. Offer the final reflections of the significance of the study and how it is going to contribute to this field, and highlight any broader implication. That is the final paragraph you should conclude with in your conclusion of your research report. Some examples, there was an environmental research project. It was titled The Impact of a Conservation Initiative. And when you say quantitative data, changes in biodiversity and habitat restoration. And when it comes to qualitative data, it is from the interviews, from the community, perception, attitudes, all that. And here it is written together. As Dr. Kanchana said, any community-based study, it is always write it together, integrate. And integration provides holistic understanding. And quantitative data confirms in this problem ecological changes, while the qualitative data reveal how invested the community are in achieving this. So this is how, for this particular environmental research, usually the report writing is joint display. And for education evaluation, there's an example, impact of remedial classes on student performance. And here the quantitative data will be the students' test scores, attendance rates, and the grades, what they have obtained. Qualitative data will be through the focus groups and interviews. And why we have to write it together? Because integration offers a comprehensive view. Quantitative data gives you statistical changes, whether the academic scores have improved or not, whereas the qualitative data says how and why these changes occurred. It tells us why, and so that based on that, you can modify the way you deliver your classes or to address or improve the student performance. So in education evaluation, again, it is written together. And in public health research, one another example is some researchers like substance misuse in an urban area. There are two parts, quantitative and qualitative. The quantitative part, they wanted to know the substance abuse pattern and the prevalence rates. So that is written separately. You can't mix that here. And the qualitative data, individual experiences of those participants of unique lived experiences are the reality on ground. And a psychological project, when you write, another example is there. Here again, we write separately. Each study has different objectives. So cognitive test quantitatively measures its objectives are different, and the in-depth interview, it is different. So quantitative component measures cognitive abilities. Qualitative component measures the insights into the thought process. So here you need to maintain clarity. So separation is good in this psychological project. There are other subsections, as I mentioned to you in the method section. References, I'm not going in detail. There are different writing styles based on the requirement of the university or the journal you need to follow. And appendices, here you need to, especially when you have qualitative data, sometimes many sub-analysis you do and your data, you have a lengthy data. So some, if you want, you can put it in the appendix. And you can also write articles on whatever data you get, additional data. And also instruments, you have to have a copy. And also the detailed table, some you cannot put in the section because of the page limits. You can put in the appendix. And your ethical clearance, you has to be there. And the permissions, appropriate permissions will have to be there. And also, what else in the appendices? Permission ethical considerations, and any additional information you want to put, you can put it in the appendix. Now coming to a few slides are there on writing manuscript, scientific writing of reporting the remix method research. This is a definition given. It is a distinctive style of writing used by academia and researchers that is noted. Keep in mind, it has to be objective. Objectivity has to be maintained in your scientific writing. Critical analysis should be there, not just writing the findings there. And also presentation should be well structured. And also clear argument should be there when you discuss. And the evidences should be brought in with a reason. So these highlighted points are very important when you write a manuscript for publication. And when you write MMR, publish quantitative, when you publish the MMR research studies, publish quantitative and qualitative papers in separate journals, because you can identify different kinds of journals to publish, but with clear references and links to the other articles. Okay, you need to link. And publish concurrent or sequential quantitative and qualitative papers in the same journal. And publish an integrated research in a single article which describes both the methods and findings and draws overarching lessons with or without appendices that provide the study details. If you want to have reference, I have given here this particular website is the detail of publishing an integrated mixed methods research in a single article. And you can also co-publish separate qualitative and quantitative papers accompanied by a third paper, which is the overarching lessons from analysis. Actually, when you do MMR, you can bring out so many publications, so many, plenty you can bring in when you do the MMR study. But only thing you need to have time and, energy to put in. And when you write for publication, you make sure that the word length is important. It should be shortened manuscript and stick on to the guidelines given. Multiple publications from a single study you can do, and alternative publication possibilities. If it is not accepted here, you have another one to go to. So you need to explore all that. And importance of educating readers about MMR. Whatever you communicate in the scientific article, this is an important thing, whether I am giving anything to the learners, the people who are, professionals who are reading my article, what are they going to take, from this? Sometimes when you read, nothing will come out from some of the journal articles. So no, you have to take some take home messages or the lessons learned by reading that. So you have to keep that also in mind when you write the scientific. These are the different types of articles you can write for quantitative and qualitative. And what type of journal will you choose? This is very important. Everywhere now in the country as well as outside country, if you go, peer-reviewed and indexed journals are recognized. If you don't have, if you, publish in another other journals which are not indexed or peer-reviewed, your mark for that article is 0. I'm telling you. Everywhere. I have outside also helped in, scrutinizing these publications, and in country also, the rubric says 0. So make sure that you publish, because you have put in a lot of hard work and effort. So make sure you publish in indexed and peer-reviewed journal. And also explore about the journal. What is the impact factor and citation frequency, or for an average article in a journal, and which should be a prestigious one. And when you write a good research report and publish, many of our speakers yesterday brought in so many systematic reviews. Your article also will be there, which ultimately contributes to a new finding, new evidence. So you're contributing to the scientific, in a scientific way to your profession, to your discipline. And it's not just for namesake, I have to have these many publications. No, not like that. So you have to choose the journal properly. You need to have the circulation details, how often, who all reads, frequency of publication. And the response time. Some journals take their own time to respond to you. So you have to make sure that they respond to you, and the acceptance rate, and also identify journals through various resources. And prioritize the journals for submission. Always don't go for one. You have 1, 2, 3. One you submit and wait for the response. And if it is not accepted, if you can modify, you can submit again. Otherwise, wait for the second one and then go. So you have to have at least priority-wise 3 minimum. And the 3 types of mixed method journal articles you can publish. One can be purely on methodology. One can be purely on methodological articles with example, and empirical articles applying MMR, the integration. you can write as different papers you can bring in. And types of mixed method research journals, these are the common ones. But nowadays, as somebody said, many journals publish MMR. So journals that frequently publish mixed method studies are International Journal of Social Research, Qualitative Inquiry, Qualitative Research, British Medical Journal. Most of our studies in CMC, they go to BMJ, and which is a very good indexed journal. And journals devoted to mixed methods research studies, Journal of Mixed Methods Research is one. Many studies you can find, including nursing studies. International Journal of Multiple Research Approaches, it's an online journal. There again, I found many nursing studies, field methods, and quality and quantity. These are all different journals. You can explore also. And the reporting guidelines, depending on the type of research papers you produce. If it is an observational study, RCT, you have all these guidelines you can follow. You can go to the website and explore. Coming to mixed method research, there is MAS guidelines, mixed methods approach, standards, reporting standards, mixed methods approach reporting standards, which gives you the guideline, JAS guidelines. So you can go through that, how to write scientific manuscript following this guidelines. Then rejection, there are some of the reasons, usually plagiarized. I'm not going into detail. Incomplete, as I said, it has to be complete. Language issue, incomplete figures cannot be read. You have to, when you send the figures and diagrams, clarity is very important. So whatever requirement is there, accordingly you send your figures. Non-conformance to guidelines, incomplete or old references. Yesterday, Dr. Vishnu was mentioning within last 10 years, if you quote, it is good. However, some ancient studies which are of basis for theoretical framework you can use, and limited relevance to audience of the journal to which it is submitted. And these are common reasons for rejection. And sometimes the conclusion will not be justified. So conclusion is also very important. Sometimes it cannot be, it is incomprehensible. And sometimes as you read, it is boring. Okay. So these are some of the reasons. And reflection on feedback, it is depressing. And read the comments, seek advice, and take criticism, learn from what criticisms have come, and make revisions. And then do not give up. And because it's your hard work, ultimately you see a fruit there. That is your way of communicating your evidence. And practice, practice, and practice. I've given a diagram there. It does not fit in this lot. Okay, then, that one works. So you can wait and go to the next one. So don't give up, practice, and then go back. And there are some of the best practices of reporting, mixed methods research. This I have already mentioned, but this is by Dr. Elizabeth. Clarity and consistency, transparency, and detailed documentation, as I explained, result section, what should have, and all that. Then balanced presentation, as I mentioned, types of data, how you have to balance, and integration focus if you are using integration. So this is very important, best practices. And Creswell again gives 7 important guidelines for writing a MMR report. So as it is mentioned, it has to be well developed based on the structure. And when you develop your protocol for MMR itself, it has to be clear, well structured. Then only your writing report will be good. And then there should be clear, distinct quantification and qualitative strands. And you have to have separate research questions and data and analysis to answer the research question and sample data. And it has to be sufficiently sized to support your meaningful analysis. So this is a third point. Fourth one is the sample of the data should be connected via scholarly supported rigorous methods. That is your validity, reliability. And the data should be analyzed with, in qualitative, it is trustworthiness is very important. Data should be analyzed with leading edge analytical procedures, and justification for these procedures also should be included in your research report. Clarity is very important, and validation procedures need to be mentioned, like how you will deal with the external and internal validity, as well as triangulation and member checks. And the 7th point is meaningful inferences. That is very important when you publish a mixed method research. It has to be integrated, compared, contrasted with prior research. As I mentioned, the divergence, convergence, as well as the expansion. and discuss how the study contributed to the field of mixed method research and the implications I have already said. So these are the 7 important points you have to use as a checklist when you write and submit a report. So these are some of my references and websites. Thank you. I can take few questions if time.
Thank you, Dr. Valsala, for explaining such an important topic in a nutshell, very comprehensively explained. Crafting comprehensive report integrates data, credibility, and validity. And the most important, like you explained, was clear communication. And you rightly mentioned good reporting is essential to assess the quality of research because it not only helps in dissemination of knowledge, it will help in funding and support. It will also help in informed decision making. And if somebody reads your report and finds that it is very good, they may want to collaborate with you also. So thank you so much. The forum is open to the audience. Any questions from the audience? No? There are no online queries at the moment. So should we?
Thank you all.
Thank you so much.
I request the chairperson, Dr. Meera Achrekar, to hand over the certificate to the resource person, Dr. Vatsala Sandan. Thank you, ma'am. I request the moderator, Mrs. Vijay Prasad, to hand over the certificate to the chairperson, Dr. Meera Achrekar. Thank you, ma'am. I request Ms. Daisy, Assistant Professor, Department of Medical Surgical Nursing, Yenepoya Nursing College, to hand over the certificate to the moderator, Mrs. Vijay Prasad. Thank you, ma'am. We have covered a lot of ground this morning, and it's time for a break. Lunch is served in the back side of the hall. Kindly proceed to the food counter with coupons and help yourself.
Recording stopped. Recording in progress.
Now for eminent panelist, Professor Dr. Rohini T, Principal Institute of Nursing Science and Research by Vision Health Science Publishers, Punjab. For this, I call upon Professor Rohini T, Principal, Mr. Pirappa, Vision Health Publishers, Dr. Priya Reshma Arhana, Vice Principal, Dr. Binisha Papachan, Organizing Secretary, Mrs. Hazel Rima Barboza, Organizing Joint Secretary, Professor Shashikumar Javadagi, HOD, Department of Nursing Foundation, to proceed to the dais. We are happy to unveil their latest publication of following books: Textbook of Nursing Management and Leadership by Professor Dr. Rohini T, Clinical Nursing Procedure by Jyoti Katwal, Textbook of Nursing Foundation, Jyoti Katwal, Textbook of Mental Health Nursing by Bharat, Textbook of Midwifery, Obstetrics and Gynecology, and Community Health Nursing by Monica Sharma. Thank you all. I request all the delegates to be seated. The most awaited session of the day, panel discussion. Since morning, we have gained insights from our various speakers. Now, it's time to enrich the knowledge on myths and challenges in mixed method research. Now, I call upon Dr. Leena Casey, Dean, Yenepoya Nursing College, to welcome and escort the panelists to the stage. We have Dr. Anis George, Professor and Head, Research and Collaborations, Manipal College of Nursing, Manipal Academy of Higher Education, Manipal, Karnataka. Professor Dr. Rohini T, Principal, Institute of Nursing Science and Research, Malabar Cancer Center, Talashiri, Kannur. Miss Seema S. Chavan, Associate Professor, All India Institute of Medical Sciences, College of Nursing, Gorakhpur, Uttar Pradesh. Dr. Joshua Prima D'Souza, Postdoctoral Researcher, FSTM, Department of Life Sciences and Medicine, University of Luxembourg, Belval. Dr. Sister Judy, Principal, Fadamulla College of Nursing, Tumbe. And Dr. Matpadi Prabhat Kalkura, WASH and CES Policy, Advocacy and Networking Expert. I request Dr. Lina Casey, Dean, to moderate the session.
It's on. Okay.
Very good afternoon to all our experts out here and all the delegates who are part of this conference. And as we wind up after so much of heavy discussions about mixed method research, we are coming to the end of the conference, which we are going to wind up discussing about the issues, challenges, how to overcome those issues related to mixed method research. And I'm very glad to introduce to you all our eminent panelists. I must admit that we selected this panel looking at the publications and the work all of the panelists here today have done themselves. And with their experience, they are going to talk to us and enlighten us about how they were as they began and how they are today. So I'm very happy to introduce to you Dr. Rohini, who is sitting to my extreme right. Dr. Rohini is a professor and principal of Institute of Nursing Sciences and Research, Malabar Cancer Center, Talasheri. And I'm not going to take your time telling about her CV, but I would only like to say that her area of research in mixed method research is all about dialysis, child abuse, and nursing handover. So these are the areas where she has worked extensively. I welcome you, Dr. Rohini. Thank you, Ms. Vinisha. Next to Dr. Rohini is Dr. Sister Judy, Professor and Principal of Fadamulla College of Nursing, Tumbe, Mangalore. She too has done extensive work in the area of nocturia, quality of life, and sleep-related research. And she has explored mixed method research using various approaches. I welcome you, sister. Thank you, Ms. Namita. To my extreme right is Dr. Prabhat Kalkura, and he is WASH and CCES Policy Advocacy and Networking Expert of UNICEF, Hyderabad Field Officer for AP, Andhra Pradesh, Karnataka, and Telangana. He brings his vast experience of doing mixed method research and policy advocacy of the findings of mixed method research and how it can be having implications for improvement of healthcare services in various parts of the country. I welcome you, Dr. Prabhat. To my left is Dr. Anis. She's a professor and ex-dean of Manipal College of Nursing. And she is one of the senior most nurse researchers who has done numerous mixed method research designs, having mentored so many mixed method researchers. And she has conducted this sort of research in the area of dysmenorrhea, quality of life, cancer, evidence-based practice, palliative and end-of-life care, hypertension, and migraine. I welcome you, ma'am. Next to Dr. Anis is Dr. Joshma D'Souza. She is a postdoctoral researcher, having completed one postdoctoral study already. She is doing her second postdoctoral fellowship, and she is from the Department of Life Sciences and Medicine, University of Luxembourg. And she brings in experience of working for early detection and prevention of cancer interventions. And she is also working on non-communicable diseases like diabetes, hypertension, cervical cancer. I welcome you, Dr. Joshma. To my extreme left is Ms. Seema Chavan, who is an associate professor at All India Institute of Medical Sciences College of Nursing, Gorakhpur. And she has done mixed method research in the area of pediatric cancers, autism, quality of life, mothers' experiences of dealing with children diagnosed with cancer. I welcome you, Ms. Seema. Thank you. So with this eminent panelists, I think it's good to hear from them about what they felt about doing mixed method researches, how they felt about their initial experiences of doing mixed method research. Each one will talk about one of their studies. Although they have done multiple studies, I request each one to mention their favorite study so that it will benefit all of our audience. To start with, Dr. Rohini.
My study, actually, it was a mixed method study, which was done among patients undergoing hemodialysis. So actually, three variables were explored, that is sleep disturbances, fatigue level, and their quality of life. So first, qualitative approach using phenomenology research design was done. That is, Van Manen's approach was used. And then, subjectively, I was able to explore what are their descriptions related to the sleep level, fatigue, and quality of life. So that helped me to develop a protocol. It's not to develop a protocol, it is to refine a CBT protocol. So the intervention given for the patients was on cognitive behavioral therapy. So these experiences helped the researcher to actually refine the CBT protocol, which was actually validated by the experts. And then in the second phase, the protocol was implemented to test and see whether this therapy had an improvement on these three variables. So that was related, that is in brief related to the study design. So the design what I used in the study was sequential exploratory research design, because first I did qualitative followed by quantitative. So that is regarding my study.
So what do you say about your experience of entering into the domain of mixed method research?
Okay, to be very honest, actually, I did this study when I was a PhD scholar. I had mixed emotions. That is the truth. It is like becoming a mother for the first time. You're very happy. At the same time, you are like, I had a feeling like whether I'll be able to complete this project. So, on the positive side, what I saw was I was really, what to say, I had that interest, or I had that zeal that I want to learn something during my doctoral program. I really wanted to taste what is qualitative research, to go into the depth of it, and then to bring something which can be helpful for the patients who are in need of a particular intervention. So there was a mixed feeling, because one was this, and the other one which was pulling me was whether I'll be able to, because three variables were addressed in my study. So whether I'll be able to complete the three variables, first phase, then the intervention protocol development, then the second phase. Will I be the last person in my, you have such feelings, no, whether you will be able to complete within 5 years, maximum 7 years, and all such things. But I think the interest and the enthusiasm, along with God's grace, actually helped me to pull me higher to complete the project, rather than, actually, I have, even today, I have that satisfaction that we have done something genuinely. And that is my motivation. Thank you.
Thank you. I'll come back to you on further discussion on that. What do you think are some of the experiences that you can share in addition to what Dr. Rohini mentioned, ma'am, Dr. Anis?
Thank you, Dr. Leena. Unlike what Dr. Rohini has mentioned, she did a study. But most of the times what I did was I facilitated the mixed method study for my candidates. So my biggest challenge was not doing, but to make the candidates understand whether a mixed methods design or an approach is really essential or not. And if it is essential, why is it essential? And mainly I always focused on the complementarity of the data from the two approaches. Equal challenge I had in convincing the Institutional Research Board and the IEC, because this was the beginning period when we started on. Unlike all the other panelists, I have the single privilege of seeing the entry of qualitative research into health sciences profession, which was not there when I was doing my master's, only quantitative was there. Then slowly the entry of qualitative approach into the nursing sciences research, and later the mixed methods approach also. So all the difficulties which the different speakers have talked today, as the beginners in these two approaches at Manipal, the challenges were to convince and to accept that this is something required, and to tell to the professional community that neither quantitative or the qualitative or mixed method, none of them are superior to any of the other. Depending on the topic, each method is equally strong and good. But when we require complementarity of the data and to make sure to the world that there can be quantity, but the same phenomenon is experienced differently by all of us, it was my challenge, not on my study. I hope that is okay to tell.
If I could clarify, maybe 15 years back, 10 to 15 years back.
About 24 years back, the qualitative study entered into the field. And maybe, as you said, around 9 to 10 years back, we started with the mixed methods.
Thank you, ma'am. Now over to Sister Judy. What is your experience of exploring mixed method research?
Thank you, ma'am, for the opportunity. Good afternoon. My experience on mixed method research begins with the reflection from MSc nursing students. They were doing mixed method research under Seema ma'am. Seema Chavan is here. So that time we were the panelists to discuss about this. And that time I understood this mixed methodology is not very this vague, and I am not understanding what exactly to be done, and I was not able to comment properly on that. That time I took a decision, when I'm doing my PhD, I will do this mixed methodology to get to know that more about this methodology, and I took it as a challenge. And that time popularity was more, and weightage was more, like that. Some kind of attitude was in my mind. Like that I started my mixed method research. That time I had a doubt about this huge data in qualitative, and the amount of the data from the qualitative is very small. That was in my mind, how to integrate this. That was the major question within me. And one more thing is how to frame the protocol was not known to me. So many challenges I had in the initial stage, how to frame it. Then finally, I agree with Vishnu sir. Dr. Vishnu is here. He helped me to frame. Actually, as Dr. Vishnu told me that he has already discussed yesterday, with that peer review helped me a lot till the end of my study. That was a main resource for me to the guide for my study. And towards the end, as the process was going on, I understood my area is very novel, nocturia, and nobody has done that study. And moreover that, there were no scale developed from India to assess the quality of life. Therefore, towards the end, maybe half of the study, I understood the need of developing a scale for assessing the quality of life. Therefore, I later on, after 2 years, I started to do that. Another further years, I took to develop and validate and standardize that tool. That was one of the outcome of my study. So I am happy that now the beginning stage and the transition changed in my life till now. It was a very vast change I could realize, and that was my experience.
So you say it was a good learning experience.
Yes, it was a real learning experience.
Thank you. What about you, Dr. Joshma?
Well, my experiences were not as ancient as the experienced panelists here. I could go back to just few years back, let's say 6 or 7 years back, and this is my first experience with my my doctoral thesis that I conducted at the University of Catholic University of Louvain, Belgium, and my experiences were mixed, like ma'am already told. Although I was excited to do this, I was a bit hesitant because it comes with its own challenges. But what I clearly remember was that the comprehensive nature of this methodology, which I was sure is going to help me in my complex research statement. So my research problem was to identify what are the reasons women do not go to undertake cervical cancer screening. So what I had to go in depth was to understand the psychology, the behavior, as well as understand all the other structural problems that comes along with implementing or making cervical cancer available in itself. So giving a holistic approach to the problem itself, adding a component of health behavior research, adding a component of psychology, adding a component of health capacity mapping to see if the screening services are available to make them utilized by the women. So all these things made it very complex. And the only last resort was the mixed methods research. I had no choice. I'm sorry, I was pushed. Not really. And I really appreciated that this was a very good methodology. And I'm very grateful that I had good experts to guide me through this research. And I think with this kind of guidance, and of course, reading and learning by doing, if I can do, I think anybody else can do. So this is my initial take on this, yes.
So that's motivating for our audience.
Definitely.
What about you, Ms. Seema?
Good afternoon, everyone. I bring to you greetings from AIMS Gorakhpur, and thank you for this opportunity. Thank you, ma'am, for the question. My first encounter with mixed method research, basically actually, ma'am was also in the panel and Sister Judy was also in the panel of getting the study being approved back in Father Muller's. So it was with facilitating, just like Dr. Anis said, for my student. Initially, I started off the qualitative aspect of research was not very well accepted those days back in our university. Hence, we decided to go for a quantitative approach for a problem and problem solving approaches of mothers of children with cancer. That was our study. But as we processed a little further, we realized that a qualitative approach would really bring in a lot of essence to the study. That's how it kind of became an emergent design, I would say. So the qualitative approach was later added on, and it was kind of a concurrent design that we took with an identical sampling. Initially, there were a lot of uncertainties, a lot of apprehension, whether we'll be able to do. We didn't have much experts to look out to, or rather, we didn't know. We were ignorant of the experts, possibly. So a lot of uncertainties because nobody around to tell us how to go about. So there are few experts that I approached, and I would acknowledge Mr. Vishnu here. References, reading materials, all this helped us go a long way. And the end result was really beautiful. And that was something which motivated us to take, furthermore mixed method research. So initially it was definitely a challenge, a lot of hurdles, but then yes, we could overcome that.
So what was the position of the student?
A student was interested because she was getting to know this newer aspect of research, which she had not learned much. And I was fortunate enough to be backed up with a really enthusiastic student who herself put in a lot of efforts. She too was reading, I too was reading. So it was like a guide student equally giving a lot of inputs. And that's how the beauty of the study was brought out. Thank you.
Thank you. Now, we have Dr. Prabhat, who will throw light on his study.
Yeah. Good afternoon, Chair, and the dignitaries on the dais and off the dais. So, indeed, my story is very different. For me, the mixed method study was introduced during the time of my PhD. And my study had an intervention of the community-based peer-led support on the glycemic control among the diabetic people with diabetes. So indeed, which had two phases. The initial phase, we opted for the sequential explanatory design, wherein it's a quantitative dominant mixed method study. And the phase 2, we had it was a randomized cluster control trial. Indeed, multi-level mixed method study was adopted. So those days, I thought that I'm getting into the new venture, which is very innovative. Today, it had become a bread and butter for me. Every day, every year, we do conduct at about 10 to 15 mixed method studies for different reasons related to the policy planning, etc. So related to this mixed method study, my experience, like it was very new for me initially, but I thoroughly enjoyed it. I thoroughly enjoyed this study. Initially, the qualitative assessment was conducted among the people with diabetes on the knowledge, attitude, and the practice about the glycemic control. Followed that, the further try to explain further about their practices, which was indeed a very, very interesting qualitative phase. But the real challenge which I have faced was to integrate this. See, you have a lot of softwares, etc. available. At the end of the day, your brain matters and your expertise in that area that matters. Probably my guide and co-guide, they had a vast experience in the area of diabetes and they had a community exposure also that has helped me to integrate it. But however, I tell you, probably that was not theoretically correct way. But however, it had given insights about from the patients. Phase 1. The phase 2, we have used that for the program evaluation, basically. The intervention for my study was the peer-led diabetic intervention, basically, the community-based approach. So wherein you used the multi-level mixed method approach in the program evaluation. So that had helped me a lot. See, third point to conclude, I tell you, after having this experience, Basically, I consider this not as a research or a approach. I consider this as a philosophy to inquire your problems, which gives you the comprehensive information, knowledge, or the understanding. This is the very important thing, which later part it had become a bread and butter for me. Every time when you go for the study, you need to go with the mixed method intervention. So this was my first experience, and fortunately I am in an arena wherein every day I have to go with the same, I have to facilitate the same, I have to support the same.
So it has become part of every research that you do.
Yeah, and adding to it, basically, I mean, I don't know, madam has a very vast experience in the nursing domain. Of late, I understood that this mixed method study is widely used in the policy, planning, advocacy platforms. So every policy document which we give, it is considered to be the evidence-based or the informed advocacy what we do, which are evolved from the mixed method studies.
So from our panelists, after all the discussion, I feel that all of them think it has become part of their research journey, and they don't have any apprehensions or hesitation to take up a mixed method research. So all of them have learned through that experience and are comfortable now. Now, our topic today is about myths and misconceptions about mixed method research. Lot of facts about the mixed method research has been discussed from yesterday to today, all the sessions. And you have an overview of what exactly is the mixed method research. So today we are here also to throw light upon some of the myths and misconceptions that we have about mixed method research. So for you audience are already aware of some of them, but to talk about it from our panelist side, what do they think as they come across students or co-workers or colleagues doing it? I request Dr. Joshma to say something about the myths and misconceptions.
Well, like I already told, the myth I had was that if I will be able to do it or not. What do you think? The students, I'm asking you, the students, what do you think? Will you be able to do this or take up a mixed methods research? What are your first thoughts? Anything?
They still may have some misconception
Yes.
that they won't be able to complete it on time.
I would like to know what is their first feeling. That is the same feeling that I had when I started my mixed methods research. It's absolutely a roller coaster ride, but of course you need to put on your seatbelt, which means you're supposed to get ready for it. The biggest myth is fear. I think the fear is something that is making students like think twice about taking mixed methods research. I don't know what is the fear about. Maybe because it makes the idea complex that there is both qualitative and quantitative research in it. Maybe that is the fear. And how will I be able to do two different methods without expertise, without experience? Well, if that is your fear, that is quite genuine fear because nobody comes with experience in the beginning. And I think as students, the first exposure to research is the first thesis that you conduct. I'm not sure if the master students are well versed to conduct theses here, but in universities abroad, they are already trained to conduct a well-versed thesis in their master's or a post-graduation. But like we know, there are a lot of constraints in terms of time, in terms of resources, whatever it is, what should draw you to do a mixed methods research, like Sir said, was that it is comprehensive and there's always light at the end of the tunnel. If you once enter the tunnel, you know you're in it, you will go through it. So it's all your perspective. If there's fear drawing you back, then I think I would say set it aside first, and then take some examples of common people like me who could do it. And it's really not so difficult or challenging. And it could be a myth. Although it is challenging, let fear not stop you. This is what I feel.
What do you think are some of the myths, Dr. Prabhat?
I don't say, I mean, the people say that it's very difficult to adopt at the PG level, but I don't think so. It could be scaled up and fixed to the at any level. But however, its conceptualization of the design is most important. And one most important fact is like we have to analyze and decide whether your study requires a mixed method or not. So you should not go, it's a mixed method study trend, I could be published it easily. No, that's not the way. Basically, you analyze and identify the suitable this one for you. And if it is the mixed method, I feel like it could be adaptable to any level, fixed into any level. And the second fact is about, I mean, it could be a controversial. I mean, the panelists could have a differences with this. They could tell. Usually the people say that this mixed method study consumes a lot of time. It could be the fact, I don't know. But however, I am in a situation wherein the government asked me to produce a mixed method study on the situational analysis of some vertical program. It could be a program of the national vector-borne disease control program, probably particular to the dengue. So when you are asked to do that, and the methodology which suits for you is the mixed method approach only, then you need to go for that. And you will not be having the time to wait until the dengue to have an outbreak of the dengue and losing a lot of people, and then it is not to present your report. So in the given context, the time people say it is a time consuming one. But however, my situation, I'm not saying it's a fact. My situation, our situation is such that you have to give them a report within a given time. That is the need of the hour. So I conclude by saying that the time consumption could be a myth, but adding to it, during this scenario, probably you may have to invest a lot of resources. It could be a group of data collectors who need to have expertise over that. And it could be a people who have a subject expertise over there. You need to bring a multi-sectoral people over there to produce a very good paper. But it is a in terms of financially, I mean, it's a high cost exercise to be done. To conclude the same, the third point what I wanted to importantly stress upon is, so end of the day, your subject expertise and your experience and the knowledge, that makes you to give you the very validated report to the people whomsoever required. I'm talking about the policy. We are in the era of the artificial intelligence, but in spite of that, our brain and the intelligent peoples are more valued in terms of money. This is what I would like to conclude. So to quote an example, sometime we spent about 50 lakh rupees for one small situational analysis to undertake from UNICEF side. And we have requested them to give it in the 15 to 20 days time. So in terms of report size and in terms of the report which we are producing, it is considered to be not the cost effective, but it was the need of the hour and we go for that.
So you are trying to say that like PhD, you don't need 3 or 5 years. You should also be prepared to take up studies. So PGs get roughly about 1 month's time to collect data. And
that's what I underline that. This is what I am telling. If you would like to complete this study, which requires a huge resource. And it is not
what do you say, Dr. Seema? Madam Seema said that she tried to do it with the PG students. So what do you think? You mentioned that it can be done at any level. I know you struggled.
Yes.
And you ended up doing a lot.
Yes, ma'am. Thank you for the question. I would rather say that there were a lot of apprehensions, like I had already mentioned, as to how are we going to collect the data, how are we going to integrate, and how do we go about with the protocol, because it was the first experience for both me and the people around me. So it was really challenging. And time was a big, I would disagree with sir. It was a challenge because there is a structured, as we all know, for our PG students, we have a structured pattern of finishing their deadlines with a Gantt chart that is prepared for them. So what I used to usually find is my student is lagging behind when compared to the rest of the students. And she's always apprehensive as to, ma'am, whether I will complete. Will I be able to, complete along with others? Because she is taking a lot of time when she's going for qualitative data collection and analysis, unlike the other students who are done quantitative and, finish it at the stipulated time. So that was a big constraint. And possibly, like Sir said, maybe having resources both financially as well as human resource. If we have multiple investigators, possibly, yes, we can complete it. So that was a little bit of a challenge, but fortunately, having an enthusiastic and very positive student helped us to take it further and helped her to complete on time. But yes, it was a challenge. Thank you.
Dr. Anis wanted to add something.
I want to look at it from the shoes of a student. Dr. Prabhat mentioned, I really agree and appreciate you are able to do it with a short time period because now you are an expert. Your PhD had given you that exposure and expertise and the confidence to do. For a PG student who is doing the first time research, to learn two approaches, quantitative and qualitative, and to add on to that a mixed, it will be a mixed feeling and mixed difficulty experienced by the candidate, because all of us know the time limit which they have got. But the other day also I was telling in another forum, one of the ways through which we can introduce mixed method, if it is really essential for the problems which the student is undertaking, is to have the guide having the expertise in qualitative research also. That can support the student a long way instead of doing both qualitative and quantitative together. The basic and the in-depth problem in our profession is that we do research only as academic research. If we go out of that academic research for MSc, MPhil or PhD, and as faculty, if we start taking up small research as the previous speakers have mentioned in qualitative to develop expertise, then it can be introduced very easily into the MSc students and it can be done in a very smooth way. The time aspect which is mentioned also, that's a fear which the student has got. Because all of you who are either students or faculty, you know, a quantitative study in MSc when they want to do also, they go through a lot of stress. So I tell the MSc students that no, research is very easy, not like your clinical nursing subject. You have to learn hundreds of disease conditions, pathology, pathophysiology, all that. Whether you do MSc research, MPhil, PhD, postdoctoral, steps are the same, isn't it? So that stress can be reduced if support is there. For that, we faculty can come as the support if a new approach has to be taken up for the problem which the MSc student is doing. I'm so happy Dr. Prabhat is doing, but the limitations in academic research, we need to always think about it.
Ma'am, you mentioned about expertise of the faculty.
Yes.
Now, if we look at, I'm sure all are not experts.
Yes.
That's especially because in our curriculum, there isn't enough emphasis on qualitative research and especially mixed method research. Maybe those who are pursuing higher studies know, but there are a lot who have just stopped at post-graduation.
Yes. I fully agree with the Dr. Leena. Now, qualitative research in the present MSc syllabus in unit, one of the units, there is one small topic on qualitative. It is only to sensitize. So the problem is we who are not experts, we are teaching. But next year, if we want to teach qualitative research, this year, 3-4 of us join together. 4 of us as faculty joining together, our strength is much more than what the student. We do it, experience the difficulty, so that when all 4 of us teach next year, we become more clear about how the qualitative is done. Same way, the next year, let the teachers take a mixed method so that we become more clear. What I do personally is that in the research, although mixed methods is not there in depth, one session of sensitizing them about mixed method also, I'm doing it out of the syllabus because that is the trend now. So they should be at least aware of. So in fact, faculty have a lot of work to do if we have to make that qualitative and mixed experience a very pleasant experience for the student. We need to do a little bit more work. That's my opinion. Thank you.
What do you think? Dr. Rohini wanted to make some point.
I do agree that the first speaker, what she told, fear is one myth. but I think we can overcome that because now this conference, many conferences are being conducted throughout the country. And so when people attend it, we come to know that, okay, only one part what we have to strengthen is qualitative. So qualitative, as Anis ma'am told, if we take some initiative to have some experience in qualitative research, then ultimately mixing and integration, if a question can be answered, it's a very easy problem to be solved. But that initiation should come from our side. Then Dr. Prabhat was telling about the time. I do have I'm not against it, but I would say that many factors affect the time with what we complete a project. Like the first time we enter the kitchen and we start making a dish, looking at the recipe each time, and then by the time we finish it, it will be like a big hill task. But after years of entering into the kitchen and preparing a dish, it's like multitasking. It's like, within minutes, that you're so confident that you can prepare it within that time limit. I think Dr. Prabhat, maybe because of that experience is one thing. The phenomenon what we study, that is another thing. And I think the number of team members, how many members can be included for a particular research project, all these things will make a difference. I have another one different point of view as a myth. Though this is an international conference on mixed method research, and though we say that more and more MMR should come in the future, one concern what I have, I'm just sharing, that it comes to a point that if it is only a mixed method research, then the research project is considered to be having some standard. It has come to some, certain places, it has come to a level that what is the study you're doing? What is the PhD study you're doing? Only when you say that it is a mixed method research, there is a myth that mixed method research only has that evidence-based practice. But personally, as a researcher, what I feel is it is not whether it is mixed method research is definitely wonderful. As everyone said, it brings a comprehensive view. But even a small descriptive study, which is done with integrity, is more valuable than doing an RCT or than doing a mixed method research without any integrity. Because there are certain journal articles, when we read certain articles, what we find is, though the design is qualitative research, the sampling or that data collection method or the analysis what they have used doesn't sometimes fit with what it should be. So that time it gives us a concern that even if it is a small study, let it be a descriptive study, let it be a descriptive correlational study, it brings out certain facts which a researcher only can bring out. And that respect also we should have for each other's study, though we are speaking in a mixed method research international conference. Thank you.
So Judy, you want to add on to that?
Yes, ma'am. I do agree with the Anis ma'am, because the PG students in that level, we are just experiencing the difficulty of them to understand the concept of even quantitative method itself is heavy for them. And one more thing, in policy level, sir can do, or in university level, if you want to do all faculty to be involved in, it can be a mandatory for faculty at least in year one research method, or even once in 3 years, something should be done by faculty. Otherwise, recently I had an experience. I took up research of qualitative, like coping strategies of cancer patients with my few faculty. The beginning part, I had 5 faculty with me, and slowly, one by one, they were having problem with their management of time, and finally, we too were towards the end were forced to do all the data collection. Finally, I was alone to do the analysis towards the end. Anyway, I have completed with the others also helping me. Still, I will complete and present it. But this is the difficulty we face along with our duties. This may not be possible for faculty also. So some kind of policy should be made to do, or some time should be spent for faculty should spend for this kind of research methodology. Otherwise, we don't learn this only for PhD or
please.
can be done.
Sister, my opinion is you need not wait for the university to make policies. You can have institutional policies for promotion. Like, like certain things can be brought. Initially, they may have resistance, but later on, they'll feel happy because when they worked in an institution over a period of years, their resume is also coming up to a higher quality. They may be worried that I have to do this, that, etc. But ultimately, after 5 years, when they turn back, when they look up at their resume, they'll have 5 publications. I think if you can make it as an institutional policy, that would be wonderful.
Yes, ma'am. Any level policy is okay, but somewhere it should be mandatory. Otherwise, nobody will be interested. In my experience, I told no. They will after some time they will be fed up with the collecting the data. They were not interesting in that area.
Can I add one thing about the myths when I talk? From the beginning period onwards till now, my observation is that the most common myth was that adding one open-ended question in a structured questionnaire makes it a mixed method study. That was a problem in many of the other universities in the PhD panel when I was there also. This was a concern and that went on for quite long time. But now you see we have grown so much that all of us agree to that that is not the way. So from there we have come to the different methods. Today morning, I think Dr. Shubha was mentioning, in that thematic analysis, content analysis, and others were told. Earlier, it was thought that, only that qualitative data, summarize it and put it, that becomes a method, mixed method. That was the worst myth we had on that. Now, also, I feel personally that we think a thematic analysis or content analysis makes a wonderful mixed method study. No, we know when we talk about qualitative designs, there are stronger qualitative designs. So now for all of you and all of us, it's time for us to step into incorporating a higher level like grounded theory, phenomenology, or ethnography, and developing strong output from the qualitative strand and then integrating. It will become a strong methodology in mixed methods. That myth has to go off. And thematic analysis is the only thing. And along with that, other myth was that focus group discussion, many people considered it as one of the qualitative designs. But morning, yesterday, you all have heard that that's only a data collection process in all. So many myths have on its own gone away. So we need not worry so much, but we have to take a strong step to see that we incorporate much more. Like RCT, we say is quantitative. Like that in qualitative also, more stronger design. So our mixed will become more stronger.
Thank you for that update, ma'am. I have come across one professor from one of the universities abroad where he says that he's doing so much mixed method research. But later, during my interactions, I came to know that it's not he who's doing this mixed method research alone. There is a big team, like he's a professor in a department, and he has few PG students and few PhD students. So if he has 4 variables, 4 of them are doing research. It's part of a big protocol. And at the end, he is producing the findings of a mixed method research. How was your experience with that, Dr. Joshma? Is it what is practiced in other countries? Because in India now, universities don't permit you to do student research projects where I take a part, you will take one part, and then finally we make it a part of a big whole.
Well, this can be seen in 2 perspectives. One is the master's or UG or post-graduation level.
Let's keep UG outside.
Yeah, or post-graduation level, right?
Post-graduation.
And I can talk for myself, what I did for my doctorate level. So you want to talk about the post-graduation level,
Yes,
right?
as
Yes,
well.
yes, okay, okay. So for the post-graduation level, it is true that students work in groups in countries abroad. They work on a particular topic together as groups, and that is why it's much easier for them to take a topic and work on different aspects of the topic combine together and make it a collaborative mixed methods research work. So that was one thing that we had, we were discussing in our previous discussion earlier, that that why not collaborate students and get everyone together and make little groups and make them work on each method, so that ultimately and present to each other. For example, group A works on qualitative part, will design, group B works on the quantitative part, while planning happens with both the groups, so that each group is aware of what the other group is doing, presenting to each other as to what is we have done last week, what is our progress now, and what we plan to do. That is group A that presents. Group B presents, okay, you know what, we heard about your qualitative research, good job, this is our quantitative research, this is our research methodology, and this is what we want to do, please add something to it. I think this kind of supportive learning is something that can be inculcated here, but I think it is not
It's
accepted or
no, we do not know if it is not accepted, but it's not the usual practice.
it's not the usual method. But I think it's okay to break the stereotypes. Like you can make your own policies in your institutions. I think you all are going to be heads of your institutions someday. So I think it's okay to break the stereotypes or whatever it takes to make the students learn about research. For me, for example, like Sir was telling about the resources and stuff like that, it was totally different for me. Trust me. If I'm over here with the group of expert members or panel members here, it's because I had time and resources to conduct my research. I had entire 4 years of my research dedicated to do mixed methods research for my doctoral research, and I dedicated all of my entire time to do mixed methods research. And this is how I came up with my study findings and conclusions of my study. So which I cannot compare or I cannot expect from a postgraduate student to give all the 4 years. I think the study itself is 2 years postgraduate. So even otherwise,
if not as a postgraduate program, whether faculty collaborative research can be done, we can have a discussion.
yes, depending on what your workload is from the faculty, I think the faculty has given their views. As a student, what I believe is that if I get guidance from my faculty, my teachers, like I got, I think it is possible. And even if I'm not able to do the entire qualitative and quantitative part of the research, if I had a friend who is doing a qualitative and if I'm doing a quantitative, I would be happy to share with her my views and my experiences and learn from her what are her views and experiences. This kind of collaborative learning happens from classroom, madam. And this is what we do in entire projects. Even when I moved to WHO, I was in WHO, the International Agency for Research on Cancer, doing my postdoctoral fellowship. Even there, no one person is expert in everything. Is one person expert in everything here? Can somebody tell I know everything? It's impossible. We join hands. There is a group. In a group, Sir knows it well. There is a statistician. There is an implementation scientist. There is a psychologist, and there is a theoretical translational researcher. That makes a group. And that is how I think we can learn from each other. That is individually, even if we are compartmentalizing our work, we can learn from each other. I think that can start from classroom itself. And depending on the faculty workload, I think faculty knows it very well. But if there is a little bit of motivation from faculty too, to encourage students, to allow them to do while giving a little push, I think that would be excellent. And that will probably encourage students to think in terms of research and go more into research. Like for me, I'm drawn to research from my doctoral thesis, and I can't think of anything but research. I don't get bored of research. And even if I'm bored of doing anything, I just take my laptop and start doing my research. I'm going maniac about it. And this is not what it should be. But what I'm saying is that the basic interest comes from your experience. If your experience is good, you will automatically be drawn. And that experience, I think it's best to give from a postgraduate level. And teachers and facilitators like you who are at a level who can make a decision for them, make a curriculum, can plan a design in such a way that students can be involved.
You want to add on to anything what Dr. Joshma said, or you disagree with? Now, one challenge, one of the myths that people have that you slightly mentioned was about publications. Now, Dr. Seema mentioned about the PG student who struggled but who completed. Whether the paper is published or she could publish it with your help. Whether publication is the outcome of mixed method research, it's difficult to have publication. Is it a myth, misconception, or it is a fact?
Ma'am, I wouldn't agree that it's a challenge to, yes, publication at all levels is a challenge if we do not have our protocols in place. We do not know the sequencing, prioritization when it comes to mixed method, and we are not sure of when to integrate, how to integrate. If we have flaws in our protocol, definitely it's going to be a challenge. So if we have these things in place, we are strong with our methodology, and we are able to incorporate our study into the manuscript as per the guidelines of the journal. So I think we can get through the particular manuscript. It's just like how we do it for quantitative or qualitative alone, the similar kind of challenges when it comes to mixed method. And mixed method in itself has a huge data having qualitative, quantitative, and integration. So there are journals which are exclusively for mixed method research, which promote mixed method research, which have a word count of around 7,500 to 8,000, depending on the journal. So they range between that. So we can actually do it, but challenge is how we put it in a nutshell without destroying the essence of the study. So that is a challenge. And I think as we write, the first time that we write, we would have some challenges. There may be rejections, and we may be offended with that, but that's okay. We can always have 2 or 3. I think one of the expert mentioned in the earlier talk, we should have 2 or 3 journals which are of a similar pattern, so that one gets rejected, we have a second one with little modification, we can go or with little revision. And rejection is in a way good. It will kind of give us a lot of inputs which are going to refine our study, beautify our study, and the end result will be really beautiful. Thank you.
I think Dr. Vatsala did mention about publication related aspects, but generally what we find is it's most of the researchers who do this mixed method research, they publish their quantitative, they make one paper, qualitative, they publish, that's another paper. And then you hardly find publications where the whole study is available so that the persons who read will get motivated or learn. Do you think that is a common thing to happen when it comes to mixed method research?
Dr. Lena, I would like to respond to this. Again, as I had been telling that we are improving in this. Quite visible improvement in this we can see. Initially, most of the mixed methods papers which were sent were getting rejected. It was not only this compartmentalization or slicing of the quantitative, qualitative, and the overarching objective-based report. One was that, as all of us know, a mixed method has got a huge amount of data. So we should have journals which will give more words acceptable. So it was very difficult to fix in 2,000, 2,500 words. And so we tried to remove so many things which was essential in that. So those were getting rejected. And the other reason for rejection was that most of the reviewers also were not very very familiar with these sort of articles for publication. So those were getting rejected. Now, as Dr. Lena and Dr. Vatsala has mentioned, there are journals who are looking forward to have mixed methods publications. The ideal way is that the quantitative, qualitative, and its integration together in one, then only it becomes a mixed method article publication. Otherwise, it will be standalone publications of 3 publications. So we need not get disheartened with the rejection. It's improving. Many are getting approved. And so in the days to come, the acceptance of mixed methods papers will be better, I feel.
You want to add something, Dr. Joshma?
Yes, on this aspect about publishing the papers on mixed methods research, I would like to talk about my own experiences with it. I think I also was listening to the talk by Madam here, and the richness in or the quality of the paper is reflected in its methods. And if you intend to skip some methods just because you have only word limitation, doesn't make sense. I don't know if the readers will get the whole essence of the paper and how it was done. It absolutely doesn't make sense. Implementation fidelity, I don't know if you are aware of this aspect. Everything reflects on the methodology. And if you have to fit for the mere purpose of the word limit, which is absolutely doesn't make sense. I think like ma'am said, I totally agree. It's always better to publish the papers in as qualitative and quantitative because you can give entire detailed methodology of your research. And when you're quoting one paper and connecting to another paper, it's always better to say that the qualitative part of the research of this part of the research already published and available elsewhere. Cite the paper. The readers will always get to go and read the paper, which is already, the qualitative aspect is already done. You can always say that this paper was built on the findings of the qualitative paper, which is published, or that way. I did the same for my research papers too. I tried my level best to see if I can put everything together in a mixed methods journal. I tried to, but I miserably failed. And I didn't want to give up because my data was so rich and I didn't want to compromise just with one journal. Also, this could be an added advantage for researchers. You could have more papers. Why do you want to put two papers and, with so much rich data that you have, why do you want to put everything into one and say that, okay, I've done a mixed methods research, like with so much detail and so much methodology, so much effort gone into each study. So I published my papers separately as in a qualitative journal and as well as my quantitative paper. But when it comes to connecting the two papers, what I did, my research was done in 3 different states of Karnataka, Himachal Pradesh, and Meghalaya. And what I did was I went there and tried to understand why women do not undergo cervical cancer screening. So it's a sequential exploratory design. So it got to do with the qualitative research and then did a quantitative research in 3 different states of India. Who does the results concern? The results of this research, whom does it concern to? Who are the stakeholders? Are the women the stakeholders? Maybe if the intervention is concerned. But my main stakeholders were the policymakers to whom the problem had to be shown to or addressed to say what are the barriers and what more can be done. Is a cervical cancer screening available? Is it accessible? Is it affordable? At 3 main points. And then if it is available, accessible, and affordable, is it acceptable? So the acceptable part is where the health behavior theories and psychology comes into picture. So to put everything together, I very conveniently did a qualitative methods research and quantitative methods research. But how am I to convince this idea, saying that I did both of this and these were my findings? So I did a separate report for the mission director of National Health Mission, Meghalaya, and then mission director of Karnataka, and then the mission director of Himachal Pradesh as well. I made a detailed report of each of the states. That concerns the policymakers, right? Or where would the report go? Publications, your stakeholders are very clear. If you're doing a research, who are your stakeholders? This is what you want to know. If your stakeholders are policymakers, you want to make sure that your results don't go in a thesis book and in a library. This is not what I wanted for my research. I didn't want to do my research just to keep my thesis book in the University of Catholic de Louvain, somewhere dusted. Maybe once in 2 years, some student will go and see my book there to see what she has done, or maybe not, or maybe not. So this is not what I wanted. My idea was clear that I wanted to convey this message to the right person who it concerns to, and to bring a change. So I think this was my motivation. And I made sure that the report that I made was detailed and it went to the concerned authorities so they know what is the cervical cancer screening utilization related challenges for women in their state, be it for Karnataka, government of Karnataka, be it Himachal Pradesh, or be it Meghalaya. So this was my thing. So even though you can publish in different papers, who are your audience? Are your audience the researchers who want to do the research? Journal publications are mostly, I think most of the researchers, we look for journal publications and we try to, research is research. Why is it called research? Because we keep searching over and over again. Research never ends. Research never becomes search, you see. It's always research. So it's a continuous process. So what research I did, somebody else will take up and do another research in other context, another methodology. It keeps on going. Your target audience is researchers. If you're putting in a journal, I don't know how many policymakers will go through your research papers. Does it, some might be able to tell, is it necessary, sir, to make a policy?
This is what my point I wanted to discuss in this point. So, I mean, I may be getting away from the academics, but what is the purpose of publication? It is to disseminate and it is to reach the end user. It is to reach the end user. For example, if there are interventions which are taken in the clinical side, and if it is useful for the physicians or the nurses, probably it should be published in the journals, which is read by the medical professionals or the nurses. In case if it is related to the advocacy, what she rightly says, if you publish it in the journals, can you see any of the bureaucrat in our country has a sufficient time to go through the journals? Forget about India. Probably we are the developing countries and competing with the developed countries. I have not heard any of the international bureaucrats, so-called the international civil servants, those are all the WHO representatives. I'm talking about the generalists, not the specialists. WHO or UN, etc. Those generalists rarely read these journals. However, generalists are the decision makers, not the specialists. This is how the world runs. When this is how the world runs, probably the best way to do the dissemination of your study report is a informed advocacy document for the so and so. It could be for the policy. It could be for the program. It could be for the program monitoring. It could be for a reviewing. It could be for a improvisation. It could be for an amendment for your act. This is the one section. Second one, I closely involved with the SBCC also, social and behavioral change communication. So the social and behavioral change communication, in other way, if you consider it as a health, we call it as the health literacy. Where does this health literacy should reach? We are talking in terms of non-communicable disease. It's a problem with your lifestyle. The lifestyle modification is the need of the hour. Who has to do this? End of the day, it has to be done by every individual. Could be a physicians or the counselors or the dietitians or the physiotherapists or the nurses could be mediator to facilitate the things. End of the day, it should reach to the people. In the given context, in an advanced media era, you have a social media, you have a newspaper, you have an electronic media. Why can't we try that to publish it in those things? I could quote an example from the Manipal College of Nursing. Rainel was one student, I think in the year 2013 or 14. She was pursuing the post-graduation study. So she was coming to me, I have motivated her to undertake a study of my interesting area, that was the disaster management. I have taken her to my village, formulated a village disaster management committee. On the flood blank area, she has created an awareness, formulated a committee. So end of the day, I mean, I was very happy there was some success which I could see in the next monsoon season when there was a rain. I was fortunate to be work at the state level in the State Disaster Management Authority from the UNICEF. Initially, I have disseminated this study report to the Commissioner for the Karnataka State Disaster Management Authority. He did not buy in that report. The later part, I had a discussion with the Commissioner for the Panchayat Raj. She was a very sensible lady. She told that, but I can't do that. Probably it has to come from the KSDMA for me to implement or take it up in our state. Then I have ensured to publish that in the newspaper. That was the Kannada newspaper. And Udayavani, which was the low circulating paper in the Karnataka state, comparing against the Vijaya of Karnataka, Vijayavani, etc. Despite of that, there were quotes from the Commissioner KSDMA and the Commissioner Panchayat Raj. Today, you have 575 Grama Panchayats out of 5,000 are having the village disaster management plan. This was a very good example I could give you. I mean, my understanding of the publication is very different. This is the one part. Publications are for the dissemination and for the application. This is one point. The second point, what I could see is having a very naive data, very weakened methodology. If my university says need to be published in the quartile 1, if I for the quartile paper, could it be possible? This is the second point, mine one. So I mean, I think we need to analyze ourselves properly, where I stand, where my study stands, where my study fits into. So this is the second point. The third point, precisely what I see is, even though the journals, see, most of our studies, particularly, I don't know about the others. My study, which was very much confined to my geographical area, At the most, it could be for the state. If I take it to the other geographical area, somewhere like I have conducted my study, PhD study in the coastal belt. If a coastal belt is considered to be the good performing districts and equivalent to the Kerala, some of the health indicators of the coastal districts are equivalent or better than the best of the best. This is what I heard about. So if I take this capsule to the states, forget about the Kalyana Karnataka region, considered to be the backward district, forget about the Uttar Pradesh, considered all those the states were considered as a B-Maru states, those states. Can I take my capsule to the Uttar Pradesh? Can I take my capsule to the Rajasthan? My intention is, my work is to be disseminated and implemented in the area wherein which is equivalent to the your geographical area. In the given context, really do we need to target for the quartile one journal? I don't think so. This is a common thing I tell you. Very small. Give me a minute. I know majority of my talks are disagreed for the academics, but however, I'm trying to put the facts in front. So there are some journals called as Indian Medical Association publishes some journals. Hard copy reaches to the every physician. If you go to the polyclinic physician, in front of him, there will be a journal. He will be having the time to read those journals rather than surfing it into the internet, or probably nursing journals. So these kind of journals, if it reaches and if it is replicated in the other places, that would be the biggest achievement or the outcome what we could see from our study. I mean, this is the fact I am trying to put forward, but I completely agree. We have to work with the frame. There is a frame. Within that frame, we have to work. In between, probably 20%, I strongly feel we need to focus on this. I have attempted with this because I have given my report to the Commissioner Health and Family Welfare, my study report. I published this one in the Times of India newspaper. Then I had many queries related to it. Suvarna News has published this one, and all different things. But I underline, my name, nowhere my name is mentioned, or I was benefited out of it. That is there.
Thank you, Dr. Prabhat, for the passionate emphasis on policy advocacy. I know you are day in and out doing this, and our discussion on mixed method research also values the importance of ground level changes that all of us expect at the end of the day, at the end of all our research. So definitely, this is one area that we can always look at. But then the scientific community is always looking about categorizing the journals and ensuring that it is a hardcore research that is reaching researchers, which will definitely go a long way in improving the mixed method research or any type of research practices. Thank you for that valuable discussion.
Academic framework, everything. I mean, I respect. I mean, my point is very straight, wherein wherever it is to be reached, that has to be reached. In case if it is for the scientific community, definitely quartile 1, quartile 2, I mean, something like that we have to go. Other things probably we can think out of the boundary. That's what my point.
Yes,
right?
yes. So definitely it is correct. And in addition to that, we also have discussions about, even if we think about the publication, at the end of it, the evidence-based practices, basically not looking at individual studies, but systematic reviews or meta-analysis, which will actually result in policy changes. But then these things can be considered so that at local level, at regional level, we can definitely bring about a change. Dr. Rohini wanted to make a point.
Yeah, ma'am. Regarding this publication, no, I too agree with what Dr. Joshna has said, because it is a real hard work, and at last to compromise the hard work for the sake of one particular journal, that we should never do. We should have the patience to write again. If not this, if not A, let us go to B or to C, or I will improve from A to B. Something will happen, and that hard work should not be compromised with one substandard or over expecting or over expensive journal. But I too have like an additional point to say that first, maybe like qualitative aspect can be published. quantitative can be published. Like yesterday, Dr. Vishnu was telling about mixed method objective. The third objective is going to be mixed method objective. Then maybe after publishing that qualitative and quantitative, we can cite the papers what we have published in qualitative and quantitative and explain like how that qualitative, that mixing up part, that integration, how that qualitative ended up with quantitative, or maybe how concurrently both the findings came up with the same result. So that can be taken up as a additional paper. So to prevent that plagiarism or what to say, repetition of data, we can cite the previous two journal articles.
So for the benefit of our audience, maybe some of them have their doubts that whether it is salami slicing, whether it is ethical and all that. Would some of the panelists clarify about publishing things separately? You publish qualitative first, then the quantitative, then the overreaching objectives. So what is your view on that?
What I meant is it is not the same variable. It should not be published again and again. What I meant is like if there is a good quality of data which can go for one publication, it should be sent for one publication. There is nothing wrong. But certain people, when we tell like that, what they do is it may be a very small paper containing small data. That also they will split into two. I'm not talking about that aspect. When it comes to MMR, what I personally feel is qualitative, quantitative, if so many variables are there, and if you feel that all the data cannot be expressed in one journal article, we can go for one for this, one for that, and maybe a mixed method objective can be written as a third paper. Usually when we go in grounded theory, that is how it is, like you develop a conceptual framework or a theoretical framework, and then development of that theoretical framework alone will be a separate paper, because how that researcher ended up with that framework is a separate paper. So that is what I meant. I just thought I'll clarify.
I think that this comes under the institutional strengthening part, madam. I feel every institution does as the internal research committee or the institutional research committee and the institutional ethics committee. They probably see, I mean, these research publications and all, not if those are the individual work, despite of the individual work, they have to take the IEC approval, isn't it? And if it is the institutional work, then IRC needs to give the approval. The IRC and IEC should have a proper rule on this, because it's a very debatable thing. See, there is no right or wrong. When the, sometimes, you know, the publishers, for me, I have splitted 4 and published it. They have accepted it. I had given the same IEC number. I'm telling you, same IEC number, which is if you put there, it will be reflective on your site. Despite of that, it is published. So what I'm saying is you don't have the other side, you don't have any regulatory body as such for the publication from the journal side. So there should be some regulations. This we had UNICEF had a similar kind of conference in the recent past regarding the publications for our funding, our support agencies, wherein it was decided that the IEC and IRC should take a decision on the same. Every publication, prior to the publication, that is to be communicated to the IEC and IRC, get an approval from them, and then you put the paper for the publication.
Yeah, that may be there in many universities, like how we have one. Most universities may be having. We do not know about very large or over-affiliated universities, but definitely deemed universities, other smaller universities may be having it in place. So that's definitely a challenge that can be overcome. Madam, yeah.
Just to add on to one more point, adding on to what Sir said, coming about the ethical clearance and aspects, I would like to share something. When I was presenting and proposing my PhD study, which is a mixed method research, I had a little resistance from the panel to get it accepted. Possibly, you know, having sensitization also is important to allow the student to, take up a mixed method research. Sometimes, they are so
Used to
preoccupied and obsessed with the quantitative aspect only. So it was a real challenge and a Herculean task for me to convince them and get it approved. So that also is one of the thing. I don't know if anybody else has faced it, but I did.
No, it is a common challenge, as I understand from discussions.
Yes.
I don't have a direct experience, but I know a person whose PhD study was purely qualitative. And because of the IEC members and the other people, they were not in supportive of the qualitative portion. It was in a deemed university, and they were not supporting. And because of that, she had to change her study into a quantitative portion, which means it was not now, it was years before. But now I think slowly, even among the medical fraternity, like they are into qualitative. They do understand what is the importance of undertaking a qualitative research. I will not tell, I don't know the complete percentage, but now IUC approval or we are getting it. But earlier it was a struggle. What Dr. Prabhat was said was also welcoming. That's actually a new thing. What I have heard that that can be good, like mixed method research. When we have doubts or clarifications, as you said, that slicing of something you told, no ma'am. Like whatever it is, if that is a concern, it's better to get the guidance of IEC also, so that that sort of a name also, anybody need not end up with that the same article was published many times.
So now some of our audience also may have doubts about which are the journals to look for when it comes to publication of mixed method research. Dr. Joshma, I know Dr. Vatsala has already dealt with some of it, but if you have anything further to share.
No, I think I came across the same chance. I was just at the back looking at her screen, and I was actually telling you guys that she's clear. She's actually covering the same points that we are about to talk in here. That is in the journals which we can publish in. My research was mostly in public health research, and I have published most of my publications in BMC journals. I think coming to nursing research, I have a list of couple of them which ma'am already listed on screen. The Journal of Mixed Methods Research is already listed, which is right now, everybody has at the fingertips right now. Sage Publications has other journals, that is Field Methods, Journal of Research in Nursing, American Journal of Evaluation, Journal of Social and Personal Relationships. These are the journals of Sage Publications that do publish mixed methods research. Elsewhere, publishers also have a couple of journals like Social Sciences and Medicine, Evaluation and Program Planning, and some from the American Psychological Association as Journal of Educational Psychology and Journal of Counseling Psychology. I know that most of these are social sciences based journals, which actually encourage mixed methods research, which I can relate to because mine was a psychological and health behavior based research application in public health. So yeah, these are a couple of journals I made a list of so that I could convey to the right audience, because maybe it's more appropriate for the nursing related research.
Also, I'm just asking some questions on behalf of our audience and about the statistical tools and methods that can be used. Many of our speakers yesterday and today did mention about it, but if one of you could mention about some of the statistical analysis methods and tools that can be used. Madam Seema, or would you like to?
Yes, ma'am. Coming to our quantitative, when we are at the protocol stage itself, we would have had the methods being very clearly designed, the kind of design that we're using and the kind of tools that we are using. So mostly for quantitative, we might use standardized tools or we might have our own developed tools. And when it comes to qualitative, we might go for interview guide or some guidelines based on which the major questions, and then as and when we are interviewing, we might emerge with questions depending on the kind of responses that we are getting. So this is related to the tools. When it comes to the data analysis, quantitative, most of us may be comfortable using either Excel or SPSS or any of these. And when it comes to qualitative, there are tools like NVivo, you have 11, 12, you have Atlas, you have Max QDA, and Open Code, a few tools of this sort. This tool, what we need to understand when we are using this, especially the qualitative tool, it won't generate themes, it won't generate codes. So the first time, like I think one of the expert mentioned, it's important that you do it manually. So initially, when I started off also, I have done it manually. And then we learn the data, we get familiarized with the data, and that will kind of help us to, come with codes. But the plus point of the software, what I can talk about with my experience is, when you enter the qualitative data, when you, kind of sort of identify the codes, it will color code, like what we used to do it manually is, color code it manually and put it in the files. And it was a lot of cumbersome thing, and managing the data was a little cumbersome. So here, this software will help us to, kind of code the data, organize, categorize, recategorize, because we might do it again and again. As and when we are reading, we might sometimes feel it, clusters into this category. Sometimes we might feel it might cluster into the other category. So categorizing and recategorizing becomes easy. And it will also give us reference when we are quoting this. It gives us a reference from which participant, said that, and which line it was mentioned. Those kind of detailing, the software will be able to give us reference. So anytime we are looking back at it, we're able to quote exactly from where we got those codes. And then we can generate our themes, sub-themes, and then, have our final thing. So it's important that we need to understand, we have to put in efforts, read, reread. That part cannot be omitted just because we are using a software. So that part we have to see. And when it comes to integration, like sir said, brain, is something which has to be, used appropriately here. Because although we have quantitative and qualitative, and we have used softwares for both of these, when it comes to integration, again, it is the researcher's perspective which has to be put in. A lot of efforts needs to be put in, how you're integrating, when you're integrating, and how you come out with the final overarching objective. How are you meeting it? So those things have to be looked into.
Thank you. Dr. Judy, do you have anything more to say on this?
Yes, ma'am. Regarding software, as ma'am Seema ma'am mentioned, many of us are nowadays have a tendency to just jump into the software, and they think that all themes and sub-themes are generated by softwares. So instead of that, as she said, mentioned, we should be very much thorough about the data while reading and rereading and understanding the concept. Then when you formulate the codes or clustering the codes and all, we'll get a personal experience of each person's experience. What was that? We still remember that which participants had that this is problem. So it was nice.
Okay, thank you. So I think it's time that we address few of the questions that have come online. The first question is, while publishing quantitative and qualitative separately, whether the same journal is advisable or different journals must be okay with proper citation, whether editors have to be notified about this. Would you like to take up this question, Dr. Joshua?
Well, I can of course give the mic, but as per one experience of mine that I already did, mine was not in the same journal. It was in two different journals, and there was no issue of citing my paper with the other, connecting it to it. I didn't have any issues with that. So that's my experience.
Actually, there is no rule regarding that. We can send it and see. There are some publishers who would like to get the second paper and the third paper into their same journal. That we cannot decide. Once you write, you will have to tell that the second part and the third part is there. Would you be interested? Then they will communicate with us. That's what I have seen.
Okay. Any other views on this? Okay. Thank you. I hope we have clarified this question. One more question is online, that is, after producing your research report to the policymakers or government authorities, did they bring about any change or take any steps for cervical cancer screening in all these 3 states mentioned by you, Dr. Joshma?
Yeah, thank you. I'm happy there's somebody who is actually thinking about it, because this was my intention too, that to bring to the notice of the right people, to serve it on their table. But how do I know the served dish is eaten or utilized, right? So currently, my research that took place long back, I would say 2017 to 21, it's not much time until now. So I cannot say the policy change is drastically immediately done with one research. Evidence-based research takes a lot of time and effort. It's not one research that makes evidence. It is a couple of researches done over the time, and it's a comprehensive report of all of them that brings evidence. Well, although there is evidence that cervical cancer screening can improve survival rates or prevent cancer, the idea is not just about improving utilization of cervical cancer, because the challenge starts from making cervical cancer screening available. Cervical cancer screening availability is, first of all, not equitable across the country. All of us know that. The main challenge is for the policymakers itself to make sure cervical cancer is utilized, is to make available the cervical cancer screening facilities. So the challenge had two different aspects. One is the health system related barriers, another is the psychological barriers of women themselves. The health system related barriers, like how I explained, was the availability, accessibility, and affordability. Now, in 2 years, how would you make cervical cancer screening available across all health facilities in India? I don't think it is practically possible to suddenly bring such a change. But now there are health and wellness centers that are now improving, and the community centers are being upgraded. Some of the centers are having cervical cancer screening. At least some centers are actively involved in cervical cancer screening. If not all, the district hospitals that had cervical cancer screening facilities, yet not utilizing it or making it available, are at least making an effort to conduct screening. For example, when I was doing my research, I went into one remote area I wasn't sure if it's in Himachal Pradesh or Meghalaya. I went to a remote area, but although it was a district hospital, it was supposed to have cervical cancer screening facilities. Cervical cancer screening facilities, there was everything. There is logistics, there were materials, there are people to conduct screening, but screening was not conducted. So that is a gap. That is the gap that I was addressing. Not when screening facilities are not available. When everything is available, what is the problem to conduct screening, right? There's no accountability, there's no reporting. That is why people were ignorant to conduct cervical cancer screening.
True, but
now,
what you are trying to say is that there is an improvement.
there is an
a
improvement
visible
on, at least
change,
at
that's
district
beginning.
hospitals. Yes, at least at district hospitals who were ignorant to do that. Now, at least they're making an effort to do that. So what I'm trying to say is change doesn't come drastically, but it has just started.
What's your experience, Dr. Prabhat?
I would like to broaden this component from the cervical cancer. I will take it into larger perspective of the policy changes. See, the policy changes which happens through the advocacy. If it is a priority of the people, I mean, the elected representative, you have 3 pillars in our constituency. One is the legislative, bureaucracy, and the executive and the judiciary. The judiciary always makes people to correct. That is the one way you can change the policy. The second one, elected representatives, sometimes they feel the pulses of the people and they prioritize it. They bring the changes in the policy. Executive is eventually executive body. But executive always in a well position to have an advocacy with the legislation. So when you talk about this advocacy and the policy changes, policy change is a very big process. From mere one study or some systematic review or the meta-analysis, they cannot derive to change the policy. For that, probably the first step could be you throw an advocacy brief to them, give the empirical data. This is considered to be the informed advocacy. The second point could be you bring the stakeholders, try to negotiate to have a meeting at the executive level, bring the stakeholders for the same, need to have a stakeholders meeting. The next component, probably if there is a buy-in for the same, you have a right shop, where in right shop you involve the government machinery, because end of the day it is to be implemented by the government and the policy it is to be taken considering the government functionaries and the peoples. So
Okay,
executive is to
thank
be
you.
implemented.
Yeah.
So these process is to be adopted. Then only there could be a changes with the policy implementation. You could have a separate vertical health program, or sometimes you can go to the reach of amending the act also.
Thank you. Thank you. So that means Dr. Prabhat also has seen changes happening with advocacy and policy makers. So we have addressed the online questions already. Now the floor is open for discussion. I request the audience over here, if you have any queries, to please address so that we can take up few questions and clarify your doubts. Are there any?
Maybe I don't have a question, but maybe I can. I thought I'll tell my viewpoints on the publication part of it. Being an editor for a journal and seeing lots of peer-reviewed articles in this mixed methods. So maybe I'll say this. When it comes to a publication, we always think that the publication is all about the final outcomes of the study. So if you have a mixed methods research, a good way of publishing it should be, rather than focusing just on the quantitative and qualitative part of it, first try to publish the protocol of your mixed methods research. So the protocol will cover the entire details of your project, saying that this is how I'm going to plan my quantitative, qualitative, how am I going to do the integration. Yesterday, we have seen the example of a Pelican home study. It covers almost everything about the methodology in 5,000 or 6,000 words. And then you publish the protocol. Then when it comes to the next part of it, like, we were telling about the concerns of salami slicing. Salami slicing concerns come when we kind of, divide the outcome measures of our study into different journal, like, knowledge in one journal, attitude in one journal, practice in one journal, knowledge, attitude, association in another journal, association, practice in another journal. It's a clear example of a salami slicing. But whereas when it comes to what are the other, take your focus, take a step back and see the bigger picture. You have developed an intervention as a part of your study. Put your protocol first. Then you can say that this is the intervention, how we developed. This was how we developed the cross-cultural adaptation and validation of my instruments. That can go as a different paper. This is like, how I develop the tools or develop the intervention. So these all can be different components of the publication. Then when it comes to the final paper, you may kind of come out with a paper saying that, this is the outcome paper of the protocol which we already published. And these are the outcome. This is the quantitative findings. This is the qualitative finding. This is how we did the integration. So when you see the journals or the articles which are published in Journal of Advanced Nursing or Journal of International Journal of Nursing Studies and all, we could see that they focus basically on the outcomes of it, so that you have enough space there to say, like, then, or else what we will in the method section, we will just say 2 or 3 words. We will say that this is a so and so study. The protocol of this publication is already discussed in so and so paper, then cite it, your methodology. So you are taking a lot of space, saving a lot of space there, and we focus on the outcomes of the study. So you are safeguarding yourself from not duplicating a lot of things, not doing a salami slicing. You are ethically right, and so on. And another best practice in publication is that when you send it to the journal, the covering letter itself, you can say that this is a part of the study which was conducted. This is the overall ethics approval, or this is the trial registration, and the protocol is published, this one, then cite the protocol. This the scope of this particular paper is development and testing of a conceptual framework or integration of the study findings. So as a researcher, you are being ethically sound in saying, or you're clear in your communication with the journal, as well as with your audience, saying that this is no way you are neither duplicating nor salami slicing your findings. However, each paper that comes out of your study has a unique objective or a unique focus, be it the protocol, be it the conceptual framework, be it the tool development, be it the intervention development, be it the final outcomes of your study. So that would be a best practice I would kind of contribute.
Thank
You so much.
Thank you. Any further questions?
Just to add to that resources, basically there is a website called Committee of Publication Ethics. I'm not sure how many of you are aware of these resources that are existing in place. If you have any questions related to publication, salami slicing, or first authorship, who has to take what contribution, equal contribution, in all of this, there's a clear guidelines which is available. You can go and take a look at the Committee of Publication Ethics. Just wanted to highlight that resource. And also, I would recommend, if you talk about publications, is rather, you design your study well in advance. Depends on what you are supposed to report. Right? Sometimes we try to design the nice study and then we look at the reporting guidelines. Oh, we missed all this information. We would have known this before, we would have collected this data. So you don't end up at the end after completing your study and saying that, okay, the international journal expects you to write an article based on these guidelines. So rather you look up for these guidelines initially when you design your protocol. So there is a resource called Equator Network, which contains a lot of library, this reporting standards. Similarly, the sister organization Latitude Network, which also talks about the bias. The major point in terms of doing research is we end up introducing a lot of biases. So that also talks about what are the biases that you might encounter in these kind of study designs. So you use these resources to begin with, along with your protocol, so that you have a better outcome at the end.
Thank you. We had one more question online, that is whether qualitative research findings will bring about changes in ground level realities or practice. I think we did discuss that it's not just about qualitative research, but the mixed method research will have stronger evidence wherein policymakers will look at it and bring about ground level changes that happen. I'm sure this is addressed during our discussions. Now, it's time to conclude this panel discussion. I, as a moderator, thoroughly enjoyed being part of this panel discussion, since we had eminent panelists with first-hand experience of doing mixed method research and qualitative and quantitative research. And they have thrown light upon various aspects related to the mixed method research, the myths, misconceptions, challenges, and we did address few of the approaches to overcome these challenges. I'm sure all of you enjoyed being part of this panel discussion. Thank you, all the panelists, for your wonderful interactions and support. And as a moderator, I deem it a privilege that on behalf of the audience, both online and offline, I have tried to address few of the questions, and I hope our panel members have satisfactorily answered the questions that came up during the discussion. Thank you very much.
I have something to tell as a member of the panel. The moderator have done a wonderful job. What is taught in nursing education, the principles of conducting a panel discussion is really followed, which is not seen in many places. So I congratulate Dr. Leena for that.
Thank you, ma'am.
That was an enlightening panel discussion. Our panelists have provided us with a wealth of knowledge and diverse perspectives. As we wrap up, we extend our deepest gratitude to our panelists for sharing their expertise and to our moderator for guiding this enriching conversation. Thank you, audience, for your thoughtful questions and active participation. Now I request Dr. Priya Reshma Arhana, Vice Principal, Yenepoya Nursing College, to hand over a certificate to the panelists. To Dr. Anis George, Professor, Head Research and Collaborations, Manipal College of Nursing, Mahe, Manipal. Next, to Professor Dr. Rohini T, Principal, Institute of Nursing Science and Research, Malabar Cancer Center, Talasheri. Next, to Ms. Seema S. Chavan, Associate Professor, Reader, AIMS College of Nursing, Gorakhpur, Uttar Pradesh. To Dr. Joshma Prema D'Souza, Postdoctoral Researcher, FSTM, Department of Life Sciences and Medicine, University of Luxembourg. Thank you, Priyaman. Now I request Dr. Renita Priya, HOD, Department of Child Health Nursing, to hand over the certificate to our panelist. Dr. Sister Judy, Principal, Father Muller College of Nursing, Tumbe. Dr. Matpadi Prabhat Kalkura, WASH and CES Policy Advocacy and Networking Expert, UNICEF Hyderabad. Next, to our moderator, Dr. Leena Casey, Dean, Yenepoya Nursing College. Thank you all. Dear delegates, postage and feedback link is shared in the WhatsApp group. Kindly fill it. To further enhance the quality of our events, we kindly ask you to fill out the feedback forms provided. Upon completion of the feedback form, you will be issued with the certificate of participation. Where there is righteousness in the heart, there is a harmony in the house. Where there is a harmony in the house, there is a order in the nation. Where there is a order in the nation, there is a peace in the world. By APJ Abdul Kalam. I, Pavitra,
Hi, Rakshita.
welcome,
Welcome each and everyone to this valedictory program. We have with us Chief Guest Sri Madivalappa Nagarahalli, Secretary, Karnataka State Diploma in Nursing Examination Board, Government of Karnataka, Bengaluru, Dr. Veeresh Kumar Nandagaon, KSNC Observer, and Principal Kahir Institute of Nursing Sciences, Belagavi, Dr. Leena Casey, Dean, Yenepoya Nursing College, Dr. Priya Reshma Arhana, Vice Principal, Yenepoya Nursing College, Mrs. Hazel Rima Barboza, Organizing Joint Secretary, Yenepoya Nursing College. I request all the dignitaries to occupy the seat on the dais. Volunteers kindly escort the dignitaries.
Prayer is an inner bath of love into which the soul plunges itself. I now request Mr. Munib, second year BSc nursing student, to lead us into prayer.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا إنك جامع الناس ليوم لا ريب فيه إن الله لا يخلف الميعاد صدق الله العظيم. In the name of Allah, the most gracious and the most merciful. O Almighty, guide us towards what pleases you and keep us firm on the path of righteousness. Grant us the strength and wisdom to implement what we have learned and make it a source of benefit for us and our community. O Lord, protect us from all harm and grant us success in all our endeavors. Fill our hearts with knowledge and faith, our actions with sincerity, and our lives with your mercy. We seek refuge in you from knowledge that doesn't benefit, from hearts that are not humble, from desires that are never satisfied, and from prayers that are not answered. Thank you.
Thank you, Mr. Munib. Now I call upon Dr. Priya Reshma Arahana, Vice Principal, Yenepoya Nursing College, to welcome the gathering.
Good evening, everyone. Respected dignitaries on the dais, off the dais, faculty members, guests, invitees, and dear delegates. Every ending is a new beginning. As we are at the valedictory ceremony of this 2 days conference, I'm sure that the scientific feast we have received would lead many of us to begin a new journey in research. As we begin this valedictory ceremony, I take pleasure in welcoming the gathering. We are delighted to have Sri Madivalappa Nagarahalli, Secretary, Karnataka State Diploma in Nursing Examination Board, Bangalore, as our chief guest. With his master's degree in community health nursing, Sir has a vast experience in teaching at Government College of Nursing at Kalaburgi, Karnataka from 2007 to 2021. He has also served as a BOS member for KSDNEB during 2012 to 2014. Sir is a president of Karnataka Government Nurses Association, Kalaburgi District since 2019. And since September 2023, he is the secretary of KSDNEB.
Sir is also a resource person to train ANMs on HIV and AIDS. Mr. Madivalappa has immense interest in Kannada literature as well. He was a General Secretary, Karnataka Sahitya Parishad Kalburgi from 2015 to 2020. He had played a key role in organizing 85th Brihad Akhila Bharata Kannada Sammelana at Kalburgi in 2019. Sir has also authored 2 Kannada books, Parimalada Hoovu and Davalaralla Now Badavaru, and an English book, Florence Nightingale. A few awards mentioned to his credits are Arogya Ratna Shri Award by Jilla Sangeet Chitrakala Parishad Kalaburgi, Best Anchoring Award by Kannada Sahitya Parishad Bengaluru, and Yoga Patu Award from Jilla Patanjali Yoga Samiti Kalaburgi. On behalf of Yenepoya Nursing College, I extend a warm welcome to you, sir, and I request Dr. Leena Casey, Dean Yenepoya Nursing, to present a sapling and welcome him. Thank you, madam. I welcome Dr. Viresh Kumar Nandagaon, Principal, Institute of Nursing Sciences, KLE Academy of Higher Education and Research, Belagavi, who was there with us during this conference as a KNC observer. A hearty welcome to you, sir. I request Mrs. Vijay Prasad to welcome sir with a sapling. Thank you, Ms. Vijay. I take this opportunity to welcome Dr. Leena Casey, Dean Yenepoya Nursing College, the chairperson of the conference. Warm welcome to you, dear madam. A hearty welcome to Mrs. Hazel Rima Barboza, the organizing co-chairperson. Welcome to you, dear Rima. I extend a warm welcome to all the guests, invitees, faculty members, non-teaching staff, support staffs, students, and delegates to this valedictory ceremony. Once again, welcome one and all. Have a great evening.
Thank you, ma'am. We welcome you too. It's my pleasure to welcome our chief guest, Sri Madivalappa Nagrahalli, Secretary, Karnataka State Diploma in Nursing Education Board, Government of Karnataka, to address the gathering.
Good evening, all. Respected dignitaries on the dais. President of this ceremony, Dr. Leena Casey, Madam, Dean Yenepoya, Nursing College, Mangalore. And Yenepoya deemed University, deemed Bangalore. Observer from Karnataka Nursing Council, Dr. Viresh Nandagaon, sir. Principal, Kahar Institute of Nursing Science, Belgaum. And Vice Principal, Ms. Priya, Madam, and Ms. Hazel Rima, Madam. I am delegates and honored to participate in the valedictory functions of International Conference of Exploring the Boundless Horizons of Mixed Method Research, Integrating Insight and Advancing Healthcare. When I was invited to address this workshop, I was thinking that thoughts I can share with you in this beautiful environment. First and the foremost, I would like to share that I was impressed by seeing the program schedule of the conference, that the speakers were from 5 different states and 2 from abroad. And the topics selected were also the need of the hour, as nursing research is gaining more and more importance in India and abroad. Nursing research is an emerging and growing field in which individuals can apply their nursing education to discover new advancements that promote evidence-based care. As nursing students are the future members of the nursing profession. And for the profession to continue to advance, nursing research must be the foundation of comprehensive, evidence-based clinic practice. This may only occur with increased exposure to nursing research. Therefore, it is critical that future members of the nursing profession be exposed to, develop an appreciation for, and become more involved in nursing research, and thus incorporate its outcomes into the delivery of optional professional nursing practice. In nursing, most of us more focus on quantitative researches, whereas qualitative and mixed method researches has very less been conducted by our nursing professionals. But as we are dealing with humans, to understand patient experience, exploring complex issues, improve communication, qualitative and mixed method studies also plays very important role. Today, Yenepoya University has taken very good initiation to conduct this international conference, which will make our nursing students to become more skillful, knowledgeable, and confident to conduct qualitative and mixed method design students also along with quantitative research studies. Our present syllabus in JNM, post BSc, BSc, and MSc, even PhD. But this research is not in medical, dental, pharmacy, Ayurveda, or any other healthcare professionals. It means the nursing profession has been a wide important for research from diploma to postgraduate level, because this research helps in giving better individualized comprehensive nursing care. To motivate students to teachers in research work, lot of initiative is taken by universities. For example, RGVSS gives the research grant rupees 15,000 per UG nursing students for maximum of 5 students per college. And for teachers also get research grants. Many deemed university also give research grants and even for their publication too. Overall, research work and research publications has become vital for the patient care and for personal and professional unfulfillment. I am extremely thankful to the management and principal for inviting me as guest and giving me chance to share my experience. Thank you. Thank you, one and all. Thank you.
Thank you, sir. On behalf of Yenepoya Nursing College, I request Dr. Leena Casey, Dean, to present a memento to Sri Madivalappa Nagarahalli, Secretary, Karnataka State Diploma in Nursing Education Board. Thank you, ma'am. I am pleased to welcome Dr. Viresh Kumar Nandagaon, KSNC Observer, Principal Kaher Institute of Nursing Sciences, Belgavi, to share your thoughts with the delegates.
Very good afternoon to one and all present here. Respected chief guest for today's valedictory function, Sir Madivalappa sir, Secretary KSNDEB, President of the function, Dr. Leena Casey madam, other dignitaries on the dais and off the dais. It's a happy moment, like a valedictory function is kind of thing where we are going to be relieved. But to say things about this conference, we really enjoyed and thoroughly we understood what exactly the mixed method is. First of all, I would like to congratulate the organizing committee for selecting this topic for the conference, which is need of the hour. As we all know, as a nurses, we always conducted quantitative kind of studies, mostly. And recently we started with some qualitative studies, but this is next level what we are going to step in research in the field of research. Obviously, today we had experts among us, and definitely they are the only experts among us to tell about this mixed methodologies. Each topics under this theme have been selected very wisely with appropriate and expert speakers. They have given justice to this conference by sharing their knowledge with us. Even during this challenging environment, I think many of you have attended this conference. Even I came along with my colleagues from Belgium, and definitely it is really challenging environment outside, but we made it, and we are happy that we made it. And in person, we were present here. About mixed methodologies, about research funding agencies. Honorable Vice Chancellor Yenepoya, in his speech, he has mentioned that there are many funding agencies. We should opt for that. We should utilize them. And as a nurses, we should go for such grants. It is really a matter of proud that participants are from 15 states. Really, it is a commendable job, like big number of participants from all over the India, as well as many of from abroad, they have participated in this study. Once again, I would like to congratulate on this note. Coming to the sessions, what I am supposed to talk, speakers have really given justice and they have spoke very well about the topics allotted to them. Like I can say, in first sessions and all in first day, like Dr. Vishnu Ranjit had given a clear idea about what is mixed methodology. He has given good examples. Basically, for us, we did till now more than studies in qualitative or quantitative, but this is new thing and we have to go with this. Yes, mixed methodology will give more insights through interpretations of results. Definitely, we will come to know much more about, and that is the beauty of this mixed methodology. What is quantitative question? How a mixed methodology question should have? What are the components should be included in that particular thing? As sir said, that it should have a quantitative question, it should have a qualitative question, and it should have a mixed question. Sir, we really enjoyed your session and it was really very much informative. Thank you for that. Coming to the next thing, that is regarding ethical consideration in mixed methodology by Dr. Sushma Madam. It was really very elaborative and useful for us. Dr. Richard has explained the analytical part or analysis statistics, which is like for terror for nursing people. Statistics means, but sir, you have made it a point to understand at our level, and it was really a good session. And we were discussing about the sir. We were wondered by seeing his citations. Congratulations for that, sir. Thank you. Dr. S. Kanchana, Madam, steps of conducting a mixed method study, how to integrate qualitative and quantitative results. Madam explained regarding availability of softwares for quantitative as well as qualitative research, and qualitative studies provide context. This is very importantly said, that qualitativeness should be there in that particular thing. Madam has given us good guidelines how to write this report. Finally, it was really wonderful panel discussion, Madam. It was like really we got involved in methods, encouraged all of us to go for such kind of studies. Definitely, we will be having some kind of fear about that. And after listening to all your experiences and expertise opinions, definitely, I think many of us are going to do with this mixed kind of research, mixed methodology we are going to use here. To conclude all the sessions, overall, it was very fruitful conference. Once again, to all the organizing committee members, chairperson, on behalf of KSNC, Bangalore, I would like to congratulate and thank for giving me this opportunity to be here and part of this conference. Otherwise, also I have registered before only for this conference along with our friends. And it was really a good experience for us. To tell about food, really it was very credit points for this. And then once again, I thank you all for giving me this opportunity. And thank you very much.
Thank you, sir, for your informative and inspiring insights. On behalf of Yenepoya Nursing College, now I request Dr. Leena Casey, Dean, Yenepoya Nursing College, to present a memento to Dr. Viresh Kumar Nandagaon, Principal of Kahir Institute of Nursing Sciences, Belagavi, as a token of love and gratitude. Thank you, ma'am. Now I call upon Mr. Girish GR, poster and paper presentation convener, to announce the best paper and poster awards.
Okay. It is with great excitement and pride that I stand before you today to announce the winners of scientific poster and scientific oral paper presentation. This event has showcased the incredible depth of research, creativity, and dedication. It was conducted in an hybrid mode with online presentation on August 1st and offline presentation on August 2nd. We had a privilege of experiencing more than 32 posters and 116 papers presented. However, none of this would have been possible without the invaluable contribution of our esteemed judges. At this moment, I would like to extend deepest gratitude to each one of our judges. Your time, effort, and dedications are deeply appreciated. As a token of our appreciation, we would like to present you with a certificate and memento. This is a symbol of our gratitude and a reminder of the important role you played in making this event a success. To assist with this, I am honored to invite Dr. Viresh, the KNC observer, to join us on stage to present the certificate and memento to the judges. I'd like to welcome Dr. Vannagowda Patil, Associate Professor, Kahar Institute of Nursing Sciences, Belgavi, to come forward to receive the certificate and memento. Next, I'd like to welcome Dr. Teresa P. Varghese, Associate Professor, Yenepoya Pharmacy College, to come forward and receive the certificate and memento. I'd like to welcome next Dr. Grisha Jose, Principal, Indira College of Nursing, Mangalore, to come forward and receive the memento and certificate. Now, I'd like to welcome Dr. Priya Reshma Rana, Vice Principal, Yenepoya Nursing College, to come forward and to receive the certificate. I would like to welcome Dr. Renita Priya D'Souza, Associate Professor, Yenepoya Nursing College, to come forward and receive the certificate. I'd like to welcome Mrs. Sarita Telma Fernandez, Associate Professor, NITE College of Nursing, to come forward to receive the memento and certificate. Next, I'd like to welcome Mrs. Janet Prima Miranda, Associate Professor, Yenepoya Nursing College, to come forward and receive the certificate. Next, we would like to recognize the winners of poster presentation. I'd like to invite our chief guest, Mr. Madivalappa sir, to present certificates for best poster and paper. The best poster goes to Miss Atira Abraham, Father Muller College of Nursing. We have two posters. One is Atira Abraham and the second one is Miss Clarita Joylan Lobo, Father Muller College of Nursing. Congratulations to both of you. Moving on to the winners of scientific oral presentation. Let's begin with online presentation. Given the high volume and exceptional quality of submissions, we have 7 winners. The best paper presentation in room A goes to Miss Anjana Sharma, Manipal College of Nursing. Is there? Okay. Next, room B, Miss Anjali M, Sri Devraj Aras College of Nursing, Kolar. Room C, we have Miss Gata G Das, Yenepoya Nursing College. Room D, we had 2 winners, Miss Chimi Dolkar, Yenepoya Nursing College, and Dr. Reena Wilma Frank, Father Muller College of Nursing. Okay. Next, we had room E, Dr. Amarja Gosai, MGM Mother Teresa College of Nursing. Room F, we had Dr. Sonia Karen Sekera, Father Muller College of Nursing. Next, move on to the offline presentation. It was conducted in 3 rooms. The best paper presentation in room 1 goes to Miss Charita Clavier Lewis, Father Muller College of Nursing. Room 2, Mr. Biju S, Kasturba Medical College, Manipal. Room 3, Miss Sushmita Fernandez, Father Muller College of Nursing. Thank you, sir. Let's give a big round of applause to all our winners. I'd like to thank the faculty members and postgraduate students of Yenepoya Nursing College for their invaluable contribution. Without your hard work and dedication, this event would not have been possible. Congratulations once again to all the winners and thank you.
Thank you, sir. Now I request any 2 delegates to come forward to share your feedback about the conference. Any 1 PG student and 1 faculty.
Good evening to all. I am Ms. Clarita Joylin Lobo, second year MSc Nursing student from Father Muller College of Nursing. On behalf of PG students, I'm happy to share feedback on today's conference. First and foremost, I take this opportunity to thank and congratulate the entire organizing team for conducting this international conference on mixed method research in spite of some weather issues. The resource persons were really wonderful in outsourcing their experience and making us understand about the topic. As a student of masters, we had an adequate knowledge in a classroom scenario, but attending this conference, we clearly got an in-depth knowledge, understanding, and mastering over the mixed method research. We even got an opportunity to present our paper for the first time, which was a stepping stone for our career. I must admit that it was a great foundation already led for us as a student. It was just like a knowledge hub for us. When we were speaking to Binsha ma'am, we really understood the hard work done behind each details of this conference, mainly concerned with the selection of greatly experienced resource person and all the other facilities like transport, food, hospitalities provided was remarkable, ma'am. It was also a golden opportunity to interact with different eminent personalities from nursing fraternity. Special congratulations to Leena ma'am and team for conducting such an interacting panel discussion on myths and challenges in mixed method research. Kindly host likewise international conferences on need-based care in our profession and challenges faced, which will be the stepping stone for the embedding nurses too. As we have come to an end, my humble thanks for the great platform set to be a delegate, paper presenter, and an opportunity to give feedback. Thank you all.
Thank you for your valuable feedback. Anyone from faculty side?
A very good evening to one and all present here. I, Dr. Vaishali, represent Kelly Academy of Higher Education and Research, Belgaum. First of all, I would like to congratulate the organizing team for organizing such a wonderful conference for 2 days. The conference has defined its goals very clearly and a clear sense of purpose. They were chosen the speakers who were highly qualified with diverse topics, and the sessions were very interactive. The venue was very well organized and the technical support was appreciable. The paper presentations, both online and offline, went on very well. And the best part of presentations was the poster presentations, which was done through online mode, which I like the most and which has saved a lot of time. I appreciate the hard work behind the organizing team for organizing such a wonderful and interesting conference. And congratulations to one and all who has taken the part in organizing such a wonderful conference. And I would like to assure that we always concentrate on mainly quantitative aspects. And here I would like to say that this mixed methodologies will be applicable in our research studies, so that in future we would like to take such kind of studies. And I also tell to all the nursing colleges that we should have such kind of conferences has to be organized in future also. This is not a full stop here. Thank you one and all.
Thank you, ma'am, for sharing your valuable thoughts. Now I would like to invite Dr. Leena Casey, Dean, Yenepoya Nursing College for the presidential address.
Very good evening to Mr. Madiwalappa from Karnataka State Diploma Examination Board, Dr. Viresh Kumar, the Karnataka State Nursing Council Observer, Dr. Priya, and Ms. Reema, the Organizing Joint Secretary, and all the resource persons, experts, judges, chairpersons, moderators, my faculty members, who include the chairpersons of the committees and the members, the student volunteers, postgraduate students and non-teaching staff, and all the invitees and my dear delegates. The 2 days of this conference is culminating here, and I'm here with mixed feelings. I feel really happy to have you welcomed here and having completed the conference successfully. We look forward to future collaborations, interactions, and teamwork. Come and experience Team Yenepoya, anytime that you feel free to come. We do organize a lot of conferences and workshops. We will always intimate you about the activities that we do out here. I hope we have met the objectives of the conference of these 2 days. And I hope that you enjoyed these 2 days with us here. And it was a thoroughly learning and enjoyable experience that my team had with all of you, with all your support, cooperation, and the enthusiastic participation of everyone online and offline. Thank you very much. And I congratulate my team once again for everything that they have done to make this possible. And thank you once again.
Thank you, ma'am, for sharing your insightful thought. Wear gratitude like a clock, and it'll feed every corner of your life. Rumi. With immense gratitude, I welcome Mrs. Hazel Rima Barbosa, Organizing Joint Secretary, to deliver the vote of thanks.
A warm good evening to one and all gathered here. On 2nd August 2024, we embarked on an extraordinary journey into the boundless horizons of mixed method research. And today, as we draw this enriching experience to a closure, I'm humbled to express our thankfulness to each and everyone who made this conference a resounding success. Let me arrive at the pronouncement of Nigel Hamilton, and I quote, "Thanksgiving is a time of togetherness, acceptance of teamwork, and gratitude." Let us express our profound thankfulness to Almighty for showering His grace upon us and making this conference a truly enriching experience to all of us. Our sincere thanks go to the visionary leadership of Dr. Yenepoya Abdullah Kuni, the Honorable Chancellor of Yenepoya Deemed to be University, Mr. Farad Yenepoya, the Pro Chancellor, Dr. M. Vijayakumar, the Vice Chancellor, Dr. B.H. Shripati Rao, the Pro Vice Chancellor, Dr. K.S. Gangadhara Somayaji, the Registrar, for their unwavering support and encouragement extended for this conference. We sincerely thank Sri Madivalappa Nagarahalli, the esteemed Secretary of the Karnataka State Diploma in Nursing Examination Board, Bengaluru, for gracing the occasion as the chief guest. Thank you, sir. We thank KSNC Observer, Dr. Viresh Kumar, Principal, KLE Institute of Nursing Sciences, Belagavi, for his esteemed presence during the conference. Thank you, sir. We are deeply grateful to all the eminent speakers who shared their knowledge and provided invaluable insights that have undoubtedly enriched our understanding of mixed method research. Thank you all. I'd like to extend our sincere thanks to the panelists for sharing their expertise and insight with us. I'd like to extend our heartfelt appreciation to the dedicated chairpersons and moderators who skillfully have guided the sessions. Thank you all. A special thanks to our esteemed judges for their invaluable time and expertise in evaluating the scientific posters. I'd like to extend our heartfelt appreciation to the esteemed paper presentation judges for their meticulous evaluation of research papers. Thank you all. A sincere thanks to the researchers who presented their invaluable work at this conference. Thank you all. We are truly grateful to all the delegates who joined us, both physically and virtually, to make this conference a resounding success. We had 100 offline, 130 online delegates through Zoom platform, and around 700 YouTube viewers. We thank you all. Your active participation and engagement have created a vibrant and stimulating atmosphere for knowledge sharing and networking. A special thanks to our sponsors and partners whose generous support made this event a grand success. We are deeply grateful to the Elsevier Publishing Company, TNAI State Karnataka Branch, Yenepoya University Alumni Association, Vision Health Science Publishers, CBS Publishers, JP Brothers Medical Publishers, and Yenepoya Central and Pharmacy Stores for their invaluable contributions to the success of this conference. Great organizers build a great team, and the teamwork always turns out to be victorious. I'd like to express our sincere appreciation to the dedicated organizing committee, Dr. Leena Casey, the chairperson, Dr. Binsha, organizing secretary, vice principal, Dr. Priya Aranna, conveners and members of various committees, non-teaching staff, and the postgraduates of Yenepoya Nursing College. Your tireless efforts and unwavering commitment have been instrumental in the success of this conference. Thank you all. A special acknowledgement to the PRO, hall arrangement team, photographers, IT department, media, marketing, catering, transport department, housekeeping staff, and all others who work tirelessly behind the scenes to ensure that everything is in place for a smooth and seamless conference experience. Thank you all. This conference has not only expanded our knowledge, but has also ignited our passion for collaborative research. Let us carry the spirit of inquiry and innovation forward as we strive to advance in healthcare together. We look forward to seeing you all in our upcoming events too. Thank you once again for being a part of this remarkable journey. Thank you all. Have a blissful evening. Thank you.
Thank you, ma'am. As we reach the culmination of this transformative conference, we firmly believe that this conference has been a platform for growth, learning, and inspiration. Let us carry the spirit of this event forward in our professional and personal lives. Thank you for your active participation and dedication throughout this conference. As a symbol of our unity and commitment to our nation, I kindly request everyone to please rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जल वितरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Refreshment is arranged in the backside of the hall. I request all the delegates to refresh yourselves and proceed. Delegates, kindly collect your certificate from the registration counter. I request all the delegates to collect your certificates from the registration counter. Thank you.
Recording stopped.